Well, good morning again, everybody. Today we are going to replay the day one of the Schara wrongful death trial. Uh, I actually didn't start my channel until day two, so I never captured this. So I do want to make sure that we do cover this, and that those of you who didn't get to see Warner Mendenhall's amazing opening statement and Grace's mother's extremely emotional testimony, I highly recommend you take a look at it, and we'll just get this going and kind of see where this goes from here. We'll save some commentary for a video later in the day. I appreciate it, everybody. Let's start.
Now talking to the family before and Nurse McGinnis injected Grace Schara with morphine, a powerful opioid drug that suppresses breathing. Like I said, her only defense against these drugs and the acid buildup killing her was breathing. Doctor showed her order took her breath away. Now her Grace was dead. This trial, we will show that Grace Schara, a beautiful, gifted 19-year-old girl with Down syndrome, was killed by a deadly injection while dozens of medical personnel stood aside. Nothing. I'm Warner Mendenhall, along with Mike Administrator, John Fleiter, Joe Boyle, who represents Scott Schara, who represents the estate of his daughter, Grace Schara. Who was Grace? Before I talk a bit about how Grace, I want to talk about how she lived. As her mother Cindy will tell you, Grace was blessed with something the family termed the love chromosome. You'll see loved her family and friends, and lived a full and vibrant life. He was Scott's best buddy. They did a lot together. They hunted, they fished, he taught her how to mow the lawn. I'm sorry, Scott. He even let her drive his truck around the property. The bond between his father and daughter was unbreakable. Grace's mom taught her how to read and write. She provided her with violin lessons and horse riding lessons. Grace got so good at the violin that she's even played I Can't Help Falling in Love at her big sister's wedding on a violin. And Cindy were devoted to Grace. She was their purpose. This was a beautiful girl who should be here today. Instead, we will show that because of medical decisions that violated basic principles of patient care, informed consent, communication with the family, and human dignity, Grace was torn from her family life. For some syndrome in a hospital setting, having family present is not just comforting, it's medically necessary.
Okay, it's a little after 9 o'clock.
Powers of attorney for healthcare decision.
So what we're going to do today is I'm going to start with some opening comments. Then we'll go to Cindy, Jess, Attorney Joe Voiland, and then Attorney Warner Mendenhall, and then we'll take questions. All right? So first, in honor of Grace, what would she say if she was here right now? She would say, God did it, Dad. And boy, did he ever. And in that light, I want to thank Kyle from the New American and CHD TV for live streaming the entire trial. For those with ears to hear, they saw for the first time what's behind the curtain. And it was fantastic to be part of it. I cannot believe God chose to use our family to expose this evil. Then second, I want to thank the two attorneys who are not here. Attorney John Fleiter. We would not be here without John. John and I worked side by side for literally over 1,000 hours putting this together for trial. I know John's watching this right now over live stream, and he's sitting with his wife, Erin, who he hasn't seen for 3 weeks, and his little best buddy, Jack, is probably on his lap right now. So I wanted to thank he has his own firm, the Fleiterer firm, just did a fantastic job. Then
I don't know why we're getting crossover audio. Bear with me. Just fix this. Apologize for that. Bear with me one moment while I'm handling technical issues.
He even let her drive his truck around the property. The bond between his father and daughter was unbreakable. Grace's mom taught her how to read and write. He provided her with violin lessons and horse riding lessons. Grace got so good at the violin that she's even played I Can't Help Falling in Love at her big sister's wedding on a violin. And sitting devoted to Grace. She was there. This was a beautiful girl who should be here today. Instead, we will show that because of medical decisions that violated basic principles of patient care, informed consent, communication with the family, and human dignity, Grace was torn from her family and life. For someone with Down syndrome in a hospital setting, having family present is not just comforting, it's medically necessary. Scharas were her advocates, powers of attorney for healthcare decisions. When Grace developed cold symptoms in late September 2020, Grace decided to test her for COVID to avoid exposing wedding guests, which she happened to have COVID. When the test came back positive, they followed medical advice that they were given. They tested her oxygen. They bought one of those home oxygen meters to test that oxygen, see if it held. On October 6, 2021, when her levels did drop below 90, we called the pediatrician who said to take Grace to the Ascension St facility, because Grace had tested positive. But as a precaution, the urgent care staff recommended Scott get a further evaluation of Grace at the St. Elizabeth's Hospital. But they also offered to keep Grace for a couple of days as a precautionary measure to treat her with supplemental oxygen and steroids. Basic treatment for COVID. Thursday, believing it was in Grace's best interest. Right. Scott insisted on staying. That Scott could get COVID himself. Scott didn't hesitate. Protecting his daughter was the most important thing. It was more important than protecting himself, and he thought the hospital was a safe place. Grace was eventually admitted into St. Elizabeth's around midnight, just after midnight on October 7th. On the evening of October 6th, not sitting on her ears properly was causing discomfort from noise and high flow air pressure. Unbeknownst to Scott, the staff did nothing to address her discomfort. Instead, they submitted her to lorazepam. That didn't calm her sufficiently. They added precedent. And also physically restrained her time. In 20 minutes of the precedent, that drug was causing life-threatening respiratory distress and low blood pressure. Nurse Haynes, who you will hear from, actually noticed, and he turned down the precedent. Grace's blood pressure began to improve. Unbelievable. The next morning, on October 8th, incoming nurses turned by 4 p.m. that day. Restore her heart rate and blood pressure.
Sorry for the technical difficulties. Our stream keeps crashing. I'm actually going to restart the stream again. We're only a few minutes into it, but I know we missed a few minutes. Uh, Not quite sure why this is happening like that, but we'll give this a stop and see if we can make this work better.
Investigating why. Now talking to the family before and Nurse McGinnis inject Grace Schara with morphine, a powerful opioid drug that suppresses grief. Like I said, her only defense against these drugs and the acid buildup killing her was grief. Dr. Schara's order took her breath away. Now her Grace was dead. This trial, we will show that Grace Schara, a beautiful, gifted 19-year-old girl with Down syndrome, was killed by a deadly injection while dozens of medical personnel stood aside. Nothing. I'm Warner Mendenhall. We represent Scott Schara, who represents the estate of his daughter, Grace Schara. Who was Grace? Before I talk a bit about how Grace died, I want to talk about how she lived. Mother single term loved her family and friends and lived a full and vibrant life. It was Scott's best buddy. They did a lot together. They hunted, they fished, he taught her how to mow the lawn. I'm sorry, Scott. He even let her drive his truck around the property. The bond between his father and daughter was unbreakable. Grace's mom taught her how to read and write. She provided her with violin lessons and horse riding lessons. Grace got so good at the violin that she's even played on a violin. And City were devoted to Grace. She was their purpose. This was a beautiful girl who should be here today. Instead, we will show that because of medical decisions that violated basic principles of patient care, informed consent, communication with the family, and human dignity, Grace was torn from her family life. For someone with Down syndrome in a hospital setting, having family present is not just comforting, it's medically necessary. Schara's were her advocates, powers of attorney for health care decisions. When Grace, because of an upcoming wedding, her parents decided which she happened to have COVID. When the test came back positive, they followed medical advice that they were given. They tested her oxygen. They bought one of those home oxygen meters to test that oxygen, see if it felt good. On October 6, 2021, the levels did drop below 90. We called the pediatrician who said to take Grace to the Ascension St facility. Because Grace had tested positive. But as a precaution, the urgent care staff recommended Scott get a further evaluation of Grace at the St. Elizabeth's Hospital. But they all keep Grace for a couple of days as a precaution, basic treatment for COVID. Doctor agreed to let her stay, believing it was in Grace's best interest. Right. Doctor insisted on staying with his daughter. Protecting his daughter was the most important thing. It was more important than protecting himself. And he thought that he was a safe place. Grace was eventually admitted into St. Louis around midnight, just after midnight on October 7th, 2021. And she would not be revived. On the evening of October 7th, a high-flow nasal cannula device, which provides oxygen to victims, not sitting on her ears properly, was causing discomfort from noise and high flow air pressure. Unbeknownst to Scott, the staff did nothing for harassment. That didn't calm her sufficiently. They added precedent and also physical restraint her. In 20 minutes of the precedent, that drug was causing life-threatening respiratory distress and low blood pressure. Nurse Haynes, who you will hear from, actually noticed, and he turned down the precedent. Grace's blood pressure began to improve. Unbelievable. The next morning, on October 8th, incoming nurses turned the precedent back up to a rate where Nurse Haynes had seen problems occur. Grace was being overdosed again. By 4 p.m. that day, Grace was in full crisis. Blood pressure dropped, and her pulse was down to 39 beats per minute. Minutes later, the medical staff stopped the precedent, started to give her resuscitation drugs, like atropine, to speed up her heart rate. Her heart rate stayed low, though, so they inserted what's called a tape, it's a catheter. Sends drugs directly to the heart to give her an ongoing infusion of norepinephrine and dopamine to restore her heart rate and blood pressure. One effect of these medications is that by slowing down circulation and not clearing acids from the system, blood gets more and more clear on the charts, called metabolic acidosis. Your cells don't work. If acid levels get too high, your heart cannot beat. Scott was not home. He was wet. He was undergoing a life-threatening event. He thought she was just sleeping. And she was dazed and she had point way home this time. The next day, October 9th, she was joking and she was interacting with Dad. Still, no one told Scott what happened. Old records, though, documented everything. The dangerous drop of vital signs, the emergency medications, the metabolic acidosis. It is the doctor's duty to provide informed consent to patients with ailments. That this was breaching. Forced out of the hospital. It shows that nurses were irritated that Scott was asking questions about things. Grace to do that. They refused. One nurse did show him how to turn off what are called non-essential constant alarms. So Scott was very persistent about taking care of his daughter, about the things he was informed about. His daughter couldn't fully advocate for herself. Scott was doing exactly what he was supposed to do, dad and power of attorney for health care. When Scott was forced to leave Grace, hospital St. This person's out of security. The last time Scott they seem to have Grace's sister Jessica immediately takes Scott's place. Jessica wasn't just her sister. As healthcare power of attorney, she had legal authority to make medical decisions for Grace, and to be present for her care. Jessica arrived right away at 10 a.m. that morning, and she was turned away. Like the medical record that the hospital had a written power of attorney identifying Scott, Cindy, and Jessica, advocates for their daughter and sister. The hospital told family contacted their lawyer to negotiate with the hospital to let Jess be with her sister. But for 31 hours, alone, without a family advocate. In the afternoon, Jess finally entered Grace's room. When she entered that room, found nurses treating a bed sore that had developed with Grace's death. Nevertheless, for the 4 hours that Jess was present, Grace actually had fun. Her oxygen levels were in the 90s, her breathing was relaxed. They joked. Despite the lawyer's intervention, though, they kicked Jess out, claiming that visiting hours were open. In 30 minutes of Jess leaving that hospital, started to ramp up. Same drug that already caused 2 life-threatening reactions. The next day, October 12th, Jessica finally stayed with Grace. Stayed with her that day, and at night, held Grace lying on her stomach throughout the night. You'll hear that this is beneficial for someone with Grace's condition, but it requires patience, encouragement, and understanding. And with Jessica there, encouraging her, talking to her, helping her, Grace's oxygen level rose into the 90s the entire night. And how Grace seemed to be like herself. On October 13th, Dr. Shofar and Nurse McGinnis came to the medical team in charge of Grace's care. They were 100% responsible for her care, including a duty to understand the records as to what had happened in prior days, especially those records from October 7th and 8th. On the morning of October 13th, though, Grace had done exceptionally well overnight. She had successfully maintained that prone position and kept her oxygen saturation high. She was stable. Later that morning, shortly after 10 o'clock, Dr. Shofar called the family with good news. Grace had such a good day that they begun moving so she could go home in the next several days. Oddly though, despite Grace's improving condition, Dr. Schara requested Scott authorize a ventilator, even though there was no need for a vent at that time. Scott will testify that he had learned that when patients are ventilated, about 5% of them die. So putting her on a ventilator, and she had a 20% chance to live. Ventilation involves putting a tube down your throat while a patient is sedated, temporarily paralyzed. The tube then connects to a machine that breathes for the patient. Family did not want to pre-approve this process. But after that conversation, Dr. Schara noted that on the chart. He noted, do not intubate. But he also entered, do not resuscitate. DNR. Already heard that term. Family will tell you no one consented to not resuscitate. Behind the scenes and before the call with Dr. Schara, another scene was unfolding. Nurse McGinnis arrived at 7 o'clock in the morning to increase Precedex to a level above the overdose level from the days before. Nurse McGinnis continued to increase the maximum rate 2 more times. Jess was with her sister. No one told Jess what was happening. No one told Jess Precedex would be an increase, or even that Grace was getting Precedex. Jess had spent the night, and she told Nurse McGinnis she needed a shower. Nurse McGinnis, despite Scott having showered in the room, he was with his daughter. Nurse McGinnis told Jess she could not shower in the room because of not being able to wear personal protective equipment in the shower. Jess went home. She figured, well, my sister's doing well. I can run home. She's going to be in the hospital for a couple more days anyway. She might as well go home and get a shower. By the time she got back at 9:30 a.m., she learned that Grace was quitting the steering for running to get out of bed. During that time, you'll see the medical records, and Grace's vital signs started to deteriorate. The pulse actually elevated, her oxygen level. Grace was forced to defecate in her own bed. Scott said he had a prearranged call to discuss Grace's care with Dr. Schara that morning. While they were on the phone with Dr. Schara, that's when that Precedex was being ramped up to the maximum allowance. Less than 4 hours since Nurse McGinnis started her shift. Call ended about 11. Dr. Schara entered the DNR, do not resuscitate order on the chart. And Nurse McGinnis acknowledged that DNR order 12 minutes later. No one had discussed with Jessica, Cindy, or Scott anything about the do not resuscitate order. They were not informed, they were not told, they didn't consent. Moving on into the day, Nurse McGinnis ordered lorazepam at 11:23 under the orders of Dr. Leonard. Dr. Leonard was on. Two minutes after entering that order, she gave the lorazepam to Grace. As drug levels went up, Grace's pulse rate and respiration became erratic. By 1:50 p.m. in the afternoon of the 13th, it was clear from something called a blood gas draw. Grace was an overdose, including this odd term that I talked about, metabolic acidosis. Instead of recognizing another life-threatening situation, reducing the medications causing the problems, like they've done twice before, this medical team of Dr. Shokar and Nurse McGinnis did the opposite. They maintained the maximum level, gave Grace 2 more doses of lorazepam, recreating a dangerous combination that had nearly killed Grace a few days earlier. So, Don is our expert on this, and he's going to talk about what was happening in Grace's body on the 13th. Drugs were interfering with proper blood flow to the tissues, calling that metabolic acidosis. And the only way for Grace to compensate for metabolic acidosis caused by the drugs was to breathe faster. This was rapid breathing that wasn't agitation that needed to be sedated. It was her body's natural, desperate attempt to stay alive. Medications were the problem, not COVID. But the medical staff, Dr. Shokar, misinterpreted this life-saving bodily response. Instead of investigating why she was breathing hard, the medical records will show that Dr. Shokar thought breathing hard was the problem and that it needed to be fixed. The medical record, for the first time in Grace's stay, shows that there's an order for morphine. There were no complaints of pain by Grace. Grace was unconscious. She had no pain. She wasn't agitated. Despite that, Dr. Shokar ordered the morphine. The nurse McGinnis administered the morphine. You will see the Precedex instruction that shows that combining Precedex Dr. Verdani will testify that when you give morphine to a patient, respiratory depression, life-threatening events may occur. You should closely monitor inpatient. Grace was not closely monitored by Nurse McGinnis or Dr. Shokar. Instead, Jess, not aware of morphine, not asked to approve one, left alone with Grace. She told Grace's hands getting cold, and she came out in the nurse area and asked the nurse to check on her sister, take Grace's temperature. Jess's concerns were dismissed. Nurse McGinnis told her, "Oh, that's normal. Cover her complaint." Instead of having a nurse come into the room and help Grace, a security guard was posted outside the door. Because it's the help, Jessica called her parents, Scott and Cindy, on FaceTime. Hired family. Jessica in the room. Scott and Cindy on Facebook begged the medical staff. Save Grace. The staff responded from the hallway that Grace was, do not resuscitate. This was the first time a family learned that a do not resuscitate order had been placed on Grace's chart. Scott and Cindy screamed, "Not DNR, save our daughter." They demanded resuscitation. Medical staff refused to use morphine reversal medications that we've all heard about now. Narcan, anyone? Blaming, the staff blamed their refusal on the unauthorized DNR order. 7:27. and Cindy watched their daughter die face. Grace's heart stopped at about 7:30 on the 13th. The evidence will show she died. Ladies and gentlemen, we have multiple legal claims in this case. First one is wrongful death, drug overdose. Failure to reverse the overdose of the woman. The second is medical negligence. Communicate with families and investigate the cause of the patient's distress. These standards were violated. Third, under Wisconsin law, patients and their families have the right to be informed about the risks and benefits of treatment. Grace's family was not told about the life-threatening reactions of the 7th or the 8th. They were not warned about restarting those medications. They were never asked to approve the DNR. Actually had a deadly interaction with Precedex or Ascension. 9, the information to make any kind of informed consent decision about Grace's will. Our fourth claim is something called battery. Intentional administration of treatment without consent. This isn't about failing to provide information. This is about providing treatment with no consent whatsoever. Grace never consented. Family never consented. And they were administered repeatedly. And finally, we have a claim that's a bit different. This claim is not about money, called the declaratory judgment. About having the court declare what happened to Grace was wrong. Based on your findings of fact, we want this court to declare that the DNR order, the do not resuscitate order, was improperly placed. That medications were improperly administered without consent and that hospital policy. End of the trial, if you'll hear evidence about Grace's life in the future and the impact of her loss on the family. But we trust you to determine what justice requires in terms of any financial plans. I'm going to leave you with this. The last time Grace saw her dad was first was him being escorted out of the hospital by a taser-armed guard. The last thing she felt was her sister trying to warn her. The last thing her parents heard was Grace's silence as they begged the hospital to save her. Grace did not get to write the ending of her story. Her family is now cut out of the life. Question in this trial that's in your hands, considering all the evidence you're going to hear, is very, very simple. Now it's up to you to write the ending of Grace's life.
Thank you, Mr. Mendenhall. And I know there needs to be a change of equipment, or no, not yet. Okay, so who's going to go first for the defense?
I'll go first. I don't need the equipment.
Frankowiak, okay.
It is the court, ladies and gentlemen, jury.
30 minutes.
Sitting next to you. We start out first of all by thanking you all for being here. My old son. Pleasure and honor to press upon him in the days that service, the importance of serve. Governments rise and fall, politicians come and go. Left with is the bedrock of our nation, the Constitution that enshrines the right to trial. But your participation here today and over the next couple of weeks is going to help us fulfill the gift that we given to us by our forebears. A reliable mechanism which resolves disputes, relying upon the collective wisdom of the people themselves. I thank you for your service on the jury here today over the next couple of weeks. At the outset, I'm going to ask you for a very important thing. I ask you to listen very carefully to the evidence and reserve your judgment before acting. You'll see that as we go along with this case, the plaintiff will present your case. And I can just solve. First, counsel for Dr. Schara Walls. That's just the way these trials are set up. I'll ask you to reserve judgment until all witnesses have testified, all experts have spoken, all evidence is record. Because as you know, there's two sides to every story, and this is most definitely the case. Well, this case is going to take us back to the days of only a few years gone this morning. Seems almost like a lifetime. I venture a guess that everyone in this courtroom lived through this moment in the pandemic has vivid memories of it for one reason or another, in one man. Compare that the saga that will occupy our next couple of years began on a false Grace Schara, 1980, with Down syndrome, and her parents, Scott Schara and Ascension St. On that day attended a large music concert in Washington. The Delta variant of COVID-19 virus was tearing through the population. Compared to predictably Grace developed COVID symptoms. Grace's father, Scott, had previously come across a COVID treatment program advocated by dissident doctors known as the Frontline COVID-19 Care Alliance, or the FLCCC. The treatments recommended by the FLCCC medications. Grace's parents treated her at 10 days after she was initially infected at the concert before her declining oxygen saturation. They were concerned enough to take her to urgent care. In urgent care, Grace was placed on oxygen, and it was recommended that she proceed to the emergency department to get some x-rays. She did go to the ER at St. Elizabeth Hospital, accompanied by her father, Scott. X-rays taken to the ER on that date showed extensive infiltrates in the lungs, which was a sign of significant. The doctors in the ER recommended Grace's admission to the hospital with Mr. Schara. Down syndrome, and she was not functioning when her father was home. Mr. Schara demanded of the hospital that he be permitted to stay with his daughter in her ICU position. Special accommodation is needed in order to allow that given by the hospital. Staying in the hospital, otherwise contrary to hospital policy at the time, which limited visitation. It is only actually that such visitor policy widespread on these reasons, intended to protect hospital patients and staff. You'll hear that Cindy Schara, Grace's mother, and all of the attorney could not state that Grace had Cindy herself. Cindy too had to travel to Grace back in reception to enter the hospital and stay with Grace in her room, and this would later become the linchpin of the hospital. And you're going to hear testimony about several hospital policies that cover this fact. Policy preserving the right of the hospital, for example, to ask any visitor. If that visitor is acting in a manner that interferes, policy restricting visitation during the COVID pandemic. And a policy which requires any visitor who became symptomatic with COVID while visiting the hospital, leave the hospital. You'll learn that the key points embodied in these various policies were then placed on signs that were posted all throughout the hospital, entrances and the hospital, so that no visitor could possibly miss them. Anyone who set foot in the hospitals during this era would likely be familiar with these types of visitation restrictions. The these policies is that now, Rick's initial check are over 600 infiltrates consistent with COVID, and you'll see that subsequent X-rays in the hospital not shown. In fact, subsequent X-rays show progressive deterioration in Grace's pulmonary function. We'll look at these X-rays later in the trial under the guidance of a radiology called by the defense to explain those things and tell us what they show. Grace's breathing requirements also increased over the course of consequence. Progressed from the use of a nasal cannula to get oxygen to the need for a MyPath mask. MyPath is a type of mechanical ventilation that kind of forces oxygen to the patient's lung mask that's held over the mouth. Eventually, Grace's breathing requirements would become so significant, reach a point where only intubation and mechanical ventilation would be an effective option. You'll learn that Grace was cared for in the hospital by a team of medical providers that included an infectious disease specialist or expert, a team of intensivists, and several hospital staff. Grace was initially admitted to St. Elizabeth from the ER in the early morning hours. You'll hear about that. By that, she was experiencing bouts of significant agitation. For a period of, on the evening of October 7th, for example, non-stop bed restraints were temporarily used for a short period of time to help handle agitation. And one of Grace's treating physicians at the time, a physician by the name of Dr. Murata, entered an order for an anti-anxiety medication known as Precedex on the evening of October 7th. You'll learn that Precedex is what's called a titratable medication, commonly utilized in the ICU setting to deal with patient agitation. You'll also learn that patient agitation is not at all uncommon. Numerous reasons, particularly the COVID patient who struggled with breathing. It's kind of like the drowning. You can imagine how agitated it would be if you're in a room where the oxygen is being pulled out and you're struggling to breathe. You're drowning. It's very agitating. When the learn that's what we're saying. Precedex is ordered by a physician. It's accompanied by what's known as titration. In Grace's case, Precedex was ordered by Dr. Murata for the purpose of helping the staff manage Grace's agitation with titration parameters that were set at 0.1 to 1.5 micrograms. You'll hear that once that order was entered by Dr. Murata, the nurses in the ICU were thereafter empowered to titrate that Precedex medication up or down in accord with Grace's their observations of Grace's status at the time, given for whatever her state of agitation was. More agitated at a given time or less agitated at that medication, up or down, without having to go back to the physician. And that there was much oxygen. necessary to achieve the effective clinical. Educated, you can be titrated up. That education, less education, you can be titrated. The appropriate and necessary titration level was dictated solely by Grace's clinical condition at any given time. But the therapeutic goals that are also considered. When placed on Grace earlier, Grace automatically became classified as an IC patient. Because titration of medication like Precedex requires the close attention of a nurse and you at St. Elizabeth Hospital. There's 1-to-1 or 1-to-2. One nurse per patient, very close monitoring by the nursing staff. The nurse Sam Haynes in the night. Nurse Haynes will tell you that with a new titratable medication like Precedex, the nurse must start the titration some of the most important titrations in order to seek a baseline of medications. Now, in the case of Dr. Murat's Precedex, 7, Nurse Haynes began the titration level of 1.0, which was comfortably in the middle of the titration parameters set by Dr. Murat. After a short time, the records will indicate, and Sam will explain it because he will testify, that he determined that a titration level starting at 1.0 was resulting in drowsiness. So he exercised his discretion and he titrated the dose down to 1.0, where he found a comfortable baseline to Grace's clinical presentation. Mr. Haynes experienced isolation. Nurse Haynes will explain, for example, that a patient may be naive to the titration of medication at first because the medication is simply new to the patient. The patient might therefore require a lower dose of that medication. Then later on, after a patient has had that medication for a while, the patient is no longer naive to that. That means that the patient may require a higher titration at some point in the future in order to achieve the same therapy effect that you achieve with that lower titration level. You'll also learn that a patient's increasing agitation over time in the ICU is also another factor that the titration level of this medication at a date. It's anticipated that the plaintiff will focus upon Nurse Haynes' initial efforts to find this therapy Precedex on that first day on going so far as to characterize Nurse Haynes' decision to exercise his discretion and decrease that initial dose of 1.0 down to 0.7 as some sort of overdose. Nurse Haynes and several of the defense experts will come and they will speak to you on the witness stand right there. They'll explain that such a claim is premised upon a basic misunderstanding about Precedex. You'll additionally see that a standing word for another type of anti-anxiety medication was also entered by one of Grace's duty physicians early. Medication will know as chlorhexidine. Nurses were permitted to administer this medication to Grace under a doctor's standing order of 0.5 milligrams every 6 hours as deemed necessary by the nursing staff. You'll hear expert testimony from several experts in pharmacy and pharmacology that Precedex and lorazepam are in fact common anti-anxiety medications that are used frequently in an ICU setting, both now and in others, both in combination with one another and separately. You'll also hear that dosages to medication for standard and common dose and higher. You'll learn, however, that Dr. Verdine has no practical experience, as he admittedly does not prescribe Precedex himself. And he does not have experience titrating medication. becomes the pivot point for plaintiff's allegations against this lawsuit. You'll learn that this day is actually the sole focus of plaintiff's experts on their opinions in this case. But you're not going to hear any opinions from representatives by these leaders with respect to the administration of medication and criticisms against the events occurred. You'll hear testimony from Nurse Allison Barkholz, who was the charge nurse on the fatalist device that evening, for that morning. Nurse Barkholz indicated to Mr. Schara that he would need to leave the hospital premises and warn him. She indicated to him that there were two very specific reasons that she had found unequivocal for her request. Number one, Mr. Schara on that morning was showing clinical symptoms of a severe, urgent COVID-19 infection. Secondly, Mr. Schara had been observed by nurses now turning off various alarms, machines, and pump alarms over the previous nurse. Plaintiff's experts, Dr. Verdine and Nurse simply ignored the reason Nurse Barkholz were asking Mr. Schara, because they would much rather argue that Mr. Schara was somehow kicked out of the hospital simply because the nurses didn't want to deal with it. In truth, I'm going to have to tell you, there will be evidence in this case that Mr. Schara was indeed aggressive, and there's no better word for it but disrespectful. You'll learn that whenever Mr. Schara says that any nurse in the hospital is not in fact performing her nursing duties for Grace in exactly the way that he had instructed them to, he interpreted this as some sort of sign that he was being disrespected by the nurses. And he certainly wanted to know. You'll hear from one of those nurses, Emily Fisher, who cared for Grace on October 9th to October 10th. Nurse Fisher will take you through her notes from that evening for the details of her interactions with Mr. Schara. And she'll even quote Mr. Schara in one of her notes as telling her, and I quote, "I'm not taking any more of your stuff. You're here to follow my commands." We'll hear from Nurse Barkholz, however, that Mr. Schara's disrespectful attitude toward the nurses was not in fact the reason she asked October 10th at all. After all, the nurses have been interacting with Mr. Schara for about 4 days on various shifts of night shifts and day shifts at that point without any incident. Though something else had changed, but Nurse Barkholz will identify exactly what that was. Mr. Schara was now showing clear and dangerous signs of very severe COVID infection. And he also had now been observed by the nurses deliberately turning off various machine and pump alarms. Mr. Schara will not deny to you that he was indeed experiencing the symptoms of COVID-19 infection as of the morning. In fact, he'll admit that he began experiencing symptoms in the hospital as early as October 7th. He will tell you that he, in fact, was later hospitalized himself with a severe case, only days after he was asked. Both Nurse Barkholz and Nurse Fisher will confirm the view of Sunday the 10th, and they both personally witnessed signs of clear COVID illness in Mr. Schara. In addition, you'll hear that Schara was not wearing any personal protective equipment, had in fact refused to wear such equipment, even though every nurse and healthcare provider who entered Grace's room was wearing personal protective equipment. It was hospital policy, so the hospital did not insist on it. Mr. Schara's case because he had it. Mr. Schara had essentially invited a COVID infection by being present in Grace's without any need to find this example. Nor will Mr. Schara confess that he was indeed turning off various alarms in Grace's in the days preceding the morning of October 10th. He'll tell you that he in fact turned off multiple alarms over multiple days. He'll tell you in fact that he did not even know in every case exactly what alarms he was anticipated, he may contend that he was in some way instructed by some unnamed nurse as to how to silence that unnecessary alarm. Nice. And the nurse who can substantiate that everyone ever was probably Mr. Schara, that it was accessible or appropriate to turn off any alarms. So, alarms in an ICU room are important, and it is dangerous to turn them off. There's rely on those alarms to know when it's a change in the patient's condition. A medication needs to change out. It's particularly dangerous when the layperson does not even know what the alarms are or silence. Existing hospital policies, which you will see, cover this exact situation. The situation of an individual in the hospital, a visitor who was exhibiting active COVID symptoms and who was also engaged in acts that clearly were likely to inhibit. Nurse Allison Barcole complied with those hospital policies, which she asked Mr. Schara to leave the hospital on the morning of October 10th in light of all of these factors. You'll also learn, however, that Nurse Barcole to Mr. Schara, the hospital that morning, did not occur. St. Elizabeth had anticipated the need for patients to be able to stay in touch with their family members. When the CDC had begun recommending restrictions on hospital visitation in order to prevent that spread of COVID, the hospital had in fact purchased a series of iPads that could be used by patients in order to allow patients and hospital staff to stay in touch remotely with the family when they were not otherwise in the hospital using the CDC approach. A plan for remote visitation was discussed between Nurse Barcole and Nurse Schara, and even left the hospital then. Nurse Schara and the hospital subsequently negotiated the parameters of an agreement for another person who ended up being his other daughter, Jessica, to eventually take his place at Grace's. Jessica was subsequently able to take her place with Grace and would start the following afternoon on Monday, October 11th. You'll hear that October 10th, Sundays at the hospital. I facilitate these negotiations to get Jessica in. But it was accomplished by the next day. Subsequently, Jessica was with us. Decided to replace theory. As Jessica will tell you, because she will testify as well, she spent the afternoon and evening with Grace on October 11th and then went home for the night before returning the next morning on October 12th, because she understood that her father was still in the process of working out some details with the hospital that would subsequently allow her to stay overnight for the remaining consultation. You'll hear that from the morning of October 12th until the time of Grace's passing on the evening, Jessica was with Grace at all times. Jessica will tell you that she considered herself the eyes of her parents and Grace's. Will tell you that she questioned everything that she saw. And she will tell you that the nursing staff readily answered all the questions about the time of Grace's group. She'll also tell you that she in fact had unfettered access to both her mother and her father via telephone and FaceTime at all times while she was with Grace. There was never a time when Mr. and Mrs. Schara were somehow unable to contact Grace or Jessica. Letters were both on October 12th. Grace's respiratory function unfortunately continued to decline over the course of the day in October 13th. And multiple doctors throughout Grace's hospital stay advised Grace's parents on the need for permission to potentially intubate Grace and use mechanical ventilation on a ventilator in the event that Grace reached a point where she was unable to breathe effectively. Mr. Schara, however, conducted his own brand early in the hospital visit, but he was still present. From that self-directed research, Mr. Schara reached a conclusion in his own mind that ventilators were not appropriate for use in treating COVID, and that ventilators were somehow involved in actually causing the patient. As a result of what he took away from his own side, Mr. Schara consistently refused each and every request by Grace's providers for permission to intubate Grace if her condition were ever to deteriorate to a point where it was deemed that intubation was necessary. This stance continued throughout Grace's entire hospitalization and even continues. Under no circumstances would Mr. Schara permit the hospital or any doctor to intubate Grace or put her on a ventilator at any time, up to and including the time of her eventual arrest. Grace's doctors were therefore faced with the prospect of addressing Grace's ever-worsening respiratory function without the most vital tool that was likely to become necessary in order to address her increasingly emergent pulmonary situation. Intubation accompanied by mechanical. Dr. Schara, the only doctor, Nurse Holly McGinnis, the only nurse who was with it, both participated on the final 2 days of her life on the road. Dr. Schara and Nurse McGinnis followed closely both of them, but her pulmonary condition continued. We will examine Grace's serial chest x-rays, which show her lung capacity continuing to decrease as a hospitalization. We'll also go through Grace's vital signs on her. We will see that Grace was breathing consistently throughout that day at 40 to 50 breaths per minute. We'll see that Grace's saturations were consistently in the 40s and 50s throughout much of that day for hours at a time. A normal patient would be somewhere about 90%. Dr. Schara and Nurse McGinnis faced a true emergency on October 13th. By the afternoon of October, Grace's body was tired, her lungs were ravaged by cold, and her agitation had ramped up significantly due to increased air. Once again, imagine the agitation is causing your breathing fast, and your oxygenation is half what it should be to be. Agitation was increasing astronomically. At the beginning of her shift on the morning of October 13th, it appeared that Nurse McGinnis, in order to deal with the increasing level of intractable agitation, increased the titration of Grace's Precedex medication up to a level of 1.4 micrograms. You'll also see that Grace's vital signs barely budged as a result of this titration. Grace's breathing never, even to a sufficient level to approximate normal, much would support any type of suggestion that she was experiencing some sort of sedation. By the afternoon of October 13th, Grace had reached a point of breathing. Grace was breathing too fast, so Nurse McGinnis administered a single dose of lorazepam, a small one, 5 milligrams at 5:46 p.m. under the standing order of that medicating. This was an effort to address her intractable ventilation. Again, she was moving forward. That dose, however, even budge Grace's vital signs. Her respiratory rate remained essentially unchanged at that initial dose. So Nurse McGinnis called up Dr. Schara, who was Grace's treating doctor at the time. Dr. Schara then gave a verbal order over the phone to Nurse McGinnis to administer a second dose, a small dose of lorazepam at that time. Nurse McGinnis complied with that order and administered a second dose several minutes later at 5:45. Once again, you'll see that that second dose of lorazepam had no appreciable effect whatsoever on Grace's respiratory rate or other vital signs. And Dr. Schara proceeded to Grace's bedside in order to address this emergency. We'll hear that at Grace's bedside, Dr. Schokar ordered the Precedex infusion to be shut off and then issued a verbal order for a 2-milligram dose of morphine to be administered in an effect to slow Grace's breathing so she to take deeper breaths that must begin to oxygenate the lungs better. You'll hear that when you're breathing so fast, 50 times a minute, your breaths are very shallow. They're not taking in oxygen, so they're not oxygenating the lungs, which accounts for why her oxygenation or SpO2 levels were so low in the 40s and 50s. Though she's breathing fast, she's not getting enough oxygen because she's not taking deep breaths. She had to get oxygen into her. Nurse McGinn is also at Grace's bedside. Precedex infusion is instructed by Dr. Schokar and complied with Dr. Shokar's verbal order for the administration of 2 milligrams of morphine in order to address Grace's dangerously high respiration. You'll see that within 20 minutes of the administration of this small 2-milligram dose of morphine, Grace's breathing decreased from 50 plus breaths per minute down to 35 breaths per minute. Admittedly, still much higher than normal, but also much better than the 50 plus that she was prior. At the same time, you'll see that Grace's oxygen increased significantly, up to 98% from the 50s. You'll learn that Dr. Schokar reached a reasonable conclusion that the morphine had done exactly what it had to do. We had lowered Grace's rate of breathing sufficient to allow her to take deeper breaths, therefore increasing her oxygenation level. Dr. Schokar watched the patient for a period of time and determined that she was thankfully apparently stable, at least for that moment, and both he and Nurse McGinnis were. Dr. Schokar shifted. Nurse McGinnis shifted and Schokar after they both left the hospital as a new shift in caregivers took over the care of the patients in the ICU. Approximately 1 hour after that successful administration of that small 2-milligram dose of morphine, you'll hear that Grace's lungs finally gave out as she went into arrest. You'll hear from multiple witnesses, including several experts, all witnesses, that without the ability to intubate Grace, the performance of CPR at the point of Grace. You will learn that CPR essentially circulates the blood, but without an ability to adequately oxygenate that. Otherwise, performing CPR will do nothing successfully. Grace could no longer breathe on her own. Caregivers' inability to intubate her or to place her on a ventilator in order to aid her mechanically in breathing made it impossible to sustain her life. You'll hear that no narcotic reversal could have been effective in resuscitating Grace. You'll hear from one thing that morphine administered to Grace that evening actually was a therapeutic modality that had the effect and had served its intended purpose. So there was no reason whatsoever to attempt to reverse a successful therapy. Let me do this on the whether administered local or in combination with anti-anxiety. You won't hear any pharmacology expert local. You'll also learn that if morphine were to have played any role in causing Grace's arrest, that effect would have been apparent within minutes of administration, not within an hour. In addition, you'll hear that no reversal agent or medication like morphine would have done anything to address Grace's actual problem. The only potential way for Grace's emergent pulmonary condition to have been adequately addressed at the point of her arrest would have been mechanical ventilation. The doctors and the nurses had been explicitly forbidden by Mr. Schara intubating Grace with placement. The records and testimony will establish that Grace eventually passed away on the afternoon of October 13, 2021, despite the heroic efforts put forth by each of Grace's medical care providers in the hospital for attempting to manage her severe COVID disease. Now, you will hear a number of witnesses over the next couple some of the beliefs that Mr. Schara holds and which have shaped the allegations that you're going to hear. For example, you'll learn from Mr. Schara that he does not really believe in COVID. He believes that the COVID virus was isolated. He refers to the COVID pandemic as a pandemic, scare tactic planned for nefarious purposes by certain governmental agencies. You'll learn that Mr. Schara distrusts modern allopathic doctors, hospitals, and that distrust permeated his decision when Grace was in the hospital, shaped the allegations. You'll learn about Mr. Schara's belief that hospitals are in fact used as arms of the government, as a tool to further what he describes as a euthanasia. You'll learn about Mr. Schara's belief that the COVID vaccine is in fact a bioweapon, designed by the Department of Defense through drug manufacturing Pfizer in an effort to deliberately cause injury. You'll hear a great deal about the research Mr. Mendenhall has conducted and the conclusion that he's drawn there. You'll also hear from all witnesses who were there and will be able to do many details of Grace's hospitalization back in October. Your stance who cared for Grace on the evening of October 7th through October 8th, and then again on the evening of October 12th through October 13th. He'll talk about his care of Grace. He'll also discuss titration of breast dex. There's Emily Fisher will write to you about her observations and interactions with Mr. Schara overnight from October 9th to 10th. On the ICU, Midway was there on the morning of the 10th when Mr. Schara began to exhibit symptoms of infection. She'll talk about her observations on that day. Certainly, Nurse Holly is, as I mentioned, who cared for Grace on the 12th and 13th during the time that is most acute stage. You'll also hear from a gentleman by the name of Mr. Nicholas Silver, who was St. Elizabeth Hospital's director of pharmacy. And he'll testify how medical orders were entered in the chart back in the hospital in 2021. We'll also verify that anti-anxiety medication, lorazepam, and the doses of each that were ordered were frequently in common with the guys, both separately. And that anyone who was familiar with these medications would know. Finally, we'll hear from Dr. Schara, who is the physician overseeing the Schara October 13th, who will testify about that care and about his interactions. You're also going to hear from plaintiff's experts, and I guarantee you there's only going to be two. A nurse by the name of Nurse Eichinger and, of course, Dr. Nurse Eichinger's focus will be exclusively on the hospital's request of Mr. Schara to leave the hospital. She has no opinions directly to the nurse's administration. She'll tell you that in her own experience working for approximately that's where she obtained her experience. She'll tell you a little bit about the function of alarms in an ICU, and according to her own experience, she'll tell you that her own hospital in Cape Florida, that they also had a business. They look very similar to the ones in Salem. She'll tell you about her own care of COVID patients at her Cape Canaveral Hospital. She'll tell you she was able to effectively and competently care for her patients and communicate with those patients and their family members in spite of the fact that none of them had it. She will also talk about how ventilators were used in her own ICU. Now, Dr. Burdine's opinion as to the hospital will also focus exclusively upon Nurse Barcole's request of Mr. Schara. Dr. Burdine will tell you that he has no opinions as to any nurse other than Nurse Barcole, and no opinions as to the administration of medications to Grace Schara by any nurse. Dr. Burdine will also discuss his own experience during the COVID pandemic, including the fact that like all less than 6 different medical experts involved in the defense. They're going to cover a gamut of areas of medicine. On behalf of the hospital, I will be presenting for Dr. Schara, the additional medical experts. For me, you're from Dr. Bruce Goldberg, a fellow of the Board of Forensic Toxicology and an expert in medication science. Dr. Goldberg is going to talk to us a little bit about Precedex, lorazepam, and work. He'll explain what these medications are, how they're prescribed, what they do, the time and the dose and frequency of these medications that's ordered for Grace was entirely unfolded. He'll testify to you that the medications used in the ICU setting and are frequently used in dosages similar to those. He will also opine that the record in this case is entirely inconsistent. The plaintiff will not produce an expert in pharmacology or toxicology capable of testing. You're also going to hear from a Dr. David Fisk, an infectious disease specialist. Dr. Fisk will offer opinions touching upon a number of topics. For example, Grace Schara's medical records are highly consistent with a severe case of COVID-19. He will discuss standard COVID-19 treatments for patients hospitalized. He'll opine that the medications received by Grace in the ICU at St. Elizabeth Hospital were routinely used for the treatment. He'll discuss typical ICU medication use. He'll discuss the role of the mechanical ventilator. He'll discuss the likely triggers and bases for Grace Schara's education in the ICU. Find that evidence in Grace's hospital records is absolutely inconsistent with an allegation that Grace has had anything whatsoever to do with medication use. He'll discuss hospital visitation policies during the pandemic phase of the COVID-19 virus. And he will explain why Grace's chances of survival were essentially zero at the time of her arrest in October. The lady will not produce an infectious disease expert to offer at trial in this body. Yes. You're going to hear from an ICU nurse expert as well, Kirsty. Ms. Davis will testify that the St. Elizabeth nursing staff met all standards of care prevalent in the ICU. She'll testify that Precedex, lorazepam, and morphine are routinely utilized medications in an ICU setting for the treatment of ICU patients. She'll testify that the dosages and the routes for those medications that were ordered and administered to Grace were fully in line with standard practices of ICU nursing. She'll testify that the hospital and its nurses met the standard of care relative to the integration of Grace's family into her family. She'll also testify as to the utility of resuscitation attempts in the absence of permission for intubation and mechanical ventilation for Grace. You're also going to hear from Dr. Erin Finson, who is a board-certified radiologist. We'll go through the chest x-rays and the radiology studies that have taken place throughout the hospitalization, and we'll explain how they show progression of Grace's severe COVID disease over her roughly 1 week in the ICU. The plaintiff will not produce a radiology expert to offer. You'll hear from Dr. Brian Garibaldi, a specialist in pulmonary and critical care medicine. You'll hear from Dr. Schara. He'll confirm the severity of Grace's COVID diagnosis and will explain the cause of death. He'll testify to the common use of anti-anxiety medications like Precedex in an ICU setting. He'll explain the difficulties and limitations of caregivers caused by Mr. Schara's refusal to permit the intubation of his daughter or the use of medication. Finally, you're going to hear from Dr. Mary Beach, an expert in bioethics and medical ethics. Dr. Beach will address issues surrounding mediation between Grace's family and Dr. Schara. The plaintiff will not use bioethics or medical experts to offer opinions at trial contrary to law. And at that point, we're going to ask you to do the written. My belief that once the evidence is laid before you in this case, you will see that medicine, stripped of any conspiracy theories or unsupported conjecture, will clearly establish that COVID-19 pneumonia claimed the life of Grace Schara, despite the heroic efforts expended on her behalf by all of the care providers, and that the standard of care has been at all times by each of these. I look forward to the case of the
Absolutely, yeah. What we'll do is just take a
What was that?
He did say break. I think so, yeah.
No, sir. We discussed today, yesterday, I'm going, the term battery was used in the opening statement, and I'm going to move for Mr.
and now,
I got a pretty good guess as to what you're going to say.
I think your motion's denied for all the reasons that we've indicated. Okay, sure. Your first witness, because what we'll do is have your opening, Attorney Guzzi, and then as the bailiffs move the lectern and stuff, we'll call them and we'll hand out the notebooks. But who's your first witness going to be?
Cindy Schara.
Okay, so she'll be ready to go.
Yes.
How long is if we start on this, just using this clock, if we start at 9:50, are you 40 minutes or so?
I think it's going to be shorter than that. And
Okay.
There's some stuff that I'm going to be able to move a little bit more quickly through since council covered it.
That's what I figured.
Don't want to do that.
Okay,
Maybe 2 weeks.
understood. So just so that first witness is ready to go whenever that is. And so if you can have her ready to go, and then I don't know how long she's going to be, but I imagine that would take us to our next break.
We take us to our break, still in the direct.
Okay, so that's what we'll do. So when we start back at 9:50, we'll go until about 11:20, right, an hour and a half, and then give them a 10 or 15 minutes, and then I think we should maybe go for a little bit more, or do you think that'd be a good time to do lunch?
Good time for lunch.
Everybody good with that?
Yes, sir.
Okay, so why don't we plan on like an 11:20 lunch? I'll have I'll let the bill tell the jurors that. Okay, we'll see you back here at 10:02.
together, and then there'll be a couple by themselves.
Do you have the numbers, and they've been numbered?
They're numbered as plaintiff's numbers.
6 or 7, I believe.
That the defense says what I'm. You asked me which exhibits I provided that we're going to deal with the first witness.
Okay.
Those are 1 through 6. Mr. Mendenhall might have given you some additional documents. That's if Mr. Schara's testimony comes up. I don't know that we'll get to Mr. Schara today, but the first witness, the first time we're going to show the evidence, it's Cindy Schara, and there's 6 exhibits that were provided last night, and the clerk has on it.
I understand the defense is good with 1 through 6.
1 through 6.
And then who's the second witness?
Samuel Haynes, Nurse Haynes, his exhibits are in there.
Are in where?
1 through 6.
Okay, so then he's also included in that 1 through 6?
Yes, sir, because it's the entire medical record is 1.
Understood, and so I'm taking it that the defense is good then with 1 through 6 for all witnesses, including these first 2.
Correct.
No objections. And then Mr. Mendenhall, you added on an exhibit from Mr. Schara?
I have a number of photographs that I want to go over, and I can probably mark those at lunch, Sharon.
I'll do that and get that to the defense. It looks like the jury is coming in.
All right, you may be seated. Welcome back, members of the jury. Just some, updating on where we're at. So 2 out of the 3 attorneys have made their opening statement. Attorney Guzzi is going to do his opening statement in just a minute. I understand that all of you that wanted lunch has ordered lunch, and that will be here at our break. We're going to go about 1.5, and then we're going to take a lunch break at that time. I was told by the bailiffs pretty adamantly that you guys quickly and unanimously agreed on a 45-minute lunch. Does that sound right? Okay, so we want to keep the jurors happy, so that's what our lunch break will be. And so it'll be like 11:30 to 12:15, and then we'll start up the afternoon. I see you're the jurors now that you just have all gone back to your assigned seats, so I don't know what that means. Yeah. Okay, so at this time, Attorney Guzzi is going to make his opening statement, and then we're going to get right into the first witness after that. Mr. Guzzi. Thank you.
Also, ladies and gentlemen, you heard from Attorney Frank Koyak, who mentioned that the judicial system is the bedrock of our society. I want to bring that a little closer home to you. It's also the bedrock of Allegheny County. I know it, but Allegheny County is, you were originally part of Brown County. I don't think that's a good thing or a bad thing. But, the first courthouse in Allegheny County was built in 1850. The second courthouse was built in 1882. Current courthouse, minus the additions and renovations, was built in 1940. So you might be asking, why is that important? Why is that significant? It's significant because for 175 years, people, different walks of life, different life experiences have been summoned to this courthouse and other courthouses to sit and hear the individual's case. Use their different viewpoints to reach a decision, work together. You are about to become a part of that history. So I have for you
good idea of what conflict is in this case. Conflict is whether the medical treatment rendered to Grace Schara in October of 2021 met the standard of care. Whether Grace Schara died as a result of COVID-19 or due to a medication overdose. I listened to Attorney Mendenhall's opening statement. I took one note. And he said something to the effect of the only thing keeping Grace alive as she's trying to fight off of acidosis related to medication overdose was her breathing. That's part of the conflict. I think after all the evidence is in, I think the evidence will show that Attorney Mendenhall has it exactly backwards. It was the medications, I believe, that were allowing Grace to keep breathing and to remain alive, absence of intubation. As the court told you, opening statement is my opportunity to present you our view of what we think the evidence is going to be in this case. Based on all the testimony, the expert witnesses that are going to come in here and talk to you, we believe the evidence will show that Dr. Shokar's care and treatment of Grace Schara on October 12th and 13th of 2021 met the standard of care that applied to a hospitalized 2021. The hospital is going to be important. I believe that the evidence is going to show that Grace's death was caused by acute hypoxemia caused by COVID-19 and another syndrome known as acute respiratory distress syndrome, or ARDS, which occurs in late stages of COVID-19. You're going to hear from a number of expert witnesses. Attorney Fran Kodiak mentioned some of them. But maybe more importantly, or most importantly, you are going to hear from Dr. Shokar himself. And he is going to tell you about everything that occurred on October 12th and 13th. And he's going to explain to you in detail why he did what he did, what his reasoning was, what the medicine was behind it. And at the end of this trial, after all the evidence is in, all the testimony is done, Judge McGinnis will instruct you on the law, and that will be the law that you apply to the evidence in this case in reaching your decision. Talked about burden of proof yesterday. Scott Schara has the burden of proof. The greater weight of the evidence. We heard yesterday, greater weight of the evidence. It's not evidence, it's credible evidence. Dr. Shokar does not have the burden of proof in this case. Because he doesn't have the burden of proof, theoretically, Dr. Shokar has no obligation to present any testimony, any evidence in this case. But this case, as you probably already figured out, is very important to Dr. Shokar. Very important, and we will be presenting the defense. We've already gone through the timeline. There's a couple of things I don't want to go through it all again with you, but there are a couple of things that I think I need to highlight for you. This screen. So, the main thing here is X-ray. The X-ray and CT scans that were done on October 7th, 6th and 7th. And you're going to have a board-certified radiologist who specializes in pulmonary and abdominal X-rays come in and tell you that not only the X-ray showed signs of significant deterioration of his lungs and evidence of advanced COVID-19, he is going to present to you the actual CT scan images. You're going to see pictures of them, and you're going to see a big board with them on it. You're going to see what are known as infiltrates in the level in her lungs. You will actually see what was going on with her lungs, compression. October 9th, going up to October 17th with dexmedetomidine and Precedex. Court didn't note that was not Dr. Schokar's opening. October 11th, another set of x-rays is done, and her condition is progressing. And those x-rays you will see show further deterioration of Grace's lung condition. On October 12th, that's when Dr. Schokar takes over Grace's care. Comes to the hospital, and he doesn't just walk into Grace's room and say, "Here I am, I'm your doctor." You will hear evidence as to the process that Dr. Schokar went through when he began caring for Grace. And part of that process is talking to the doctor that was caring for Grace previously, a gentleman by the name of Dr. Carl Ball, and how he prepared for his first encounter with Grace in terms of what he talked about with Dr. Ball and reviewing Grace's medical chart. Great, she was still in the midst of severe COVID, but it had stabilized. However, that changed as the day progressed. We'll see through the vital signs and through Dr. Schokar's progress notes, information he writes down in the record about what he's observing and what he knows about what's going on with Grace, that she starts to deteriorate during that time frame. And because of that deterioration, Dr. Schokar has to have a conversation with Mr. and Mrs. Schara. He first calls Mrs. Schara, has a great conversation in which she tells him, "You really need to talk to Mr. Schara about this as well." So Dr. Schokar calls back. You're going to hear from his testimony, and you're going to see the progress note that he wrote documenting the conversation. You hear everything that was discussed in that conversation about Grace's condition. It's deteriorating. It's getting worse. She could crash at any time. And then he moves into the conversation of, along the lines of that he'd been told that a number of physicians had already talked to the Schara family about intubation, and that they had determined that they would not have Grace intubated. And so Dr. Schokar will tell you that part of the reason for that conversation was to confirm Schara family's wishes were that Grace would not be intubated. And at that point in time, he starts talking about resuscitative measures do not resuscitate. Conversation is anywhere 30, 40 minutes long, documented in the note. No decision is reached on the do not resuscitate order during that conversation of October 12th. Dr. Schokar follows up in the morning on the 13th to discuss it further. And he will tell you that one of the reasons that he needed to have that information was that in the event that Grace suffered cardiac arrest, the hospital team had to know what the family's wishes were. And that'll become important as you start to learn about what CPR really looks like in a hospital setting. And that it's not the way it's portrayed, Gray's Anatomy or House or the Pit. In that Dr. Schokar talks about the importance of nutrition, getting Grace nutrients because she hadn't been eating well. And that's important because breathing, and Dr. Schokar will tell you this, and Dr. Garibaldi will confirm it, breathing takes energy. And your body has to have the nutrients and the calories to be able to continue the process of breathing. And when you're malnourished, that affects your ability to take breaths, and to facilitate the oxygenation process. Based on his conversation with the Schara family The Schara family consented to an insertion of an NG tube and a DNR, a do not resuscitate. Dr. Schokar changes the status. Throughout the day, Grace's respiratory rate keeps increasing. We'll hear from Dr. Schokar that at one point he came in the room and the monitor showed 60 respirations per minute. And then you see the pictures of the x-rays, I think the evidence will be clear to you and will show to you that this is all COVID-19 and has nothing to do with medications. I think that's what the evidence will show. Razapam is ordered and administered to help with the NG tube. I don't know, maybe you've had an NG tube, maybe you haven't. It goes in the nose, down the throat, into the stomach. And it's not a pleasant process. And so they give you a little bit of a Razapam to relax you. The x-ray taken to verify the placement of the NG tube, because we've got to make sure it's going in the right place. Not as bad things happen. That x-ray also shows her lungs. And you will see that based on that x-ray that was completed, Dr. Binstock is going to tell you that Grace's lung capacity at that point in time is probably less than 30%. Taking these breaths, 45, 50, 55, 60 respirations per minute, less than capacity. 1746, Dr. Schokar is faced with an emergent situation. Her respiratory rate is still the same, bad. Her oxygen saturation levels are dropping consistently into the 50s, 60s, 70s. Without the ability to Dr. Schokar is faced with an emergent situation, and at 1746, lorazepam is administered pursuant to an order by Dr. David Beck. That medication has no effect. Holly McGinnis and Dr. Schokar talk about that, and Dr. Schokar says, give her another ½ milligram and want to see if that does. Given at 549, monitored, virtually no effect on her respiratory. It's told again that her respiratory rate is not improved, and she's got this rapid breathing and low oxygenation. Dr. Schokar will come and tell you that the only way at that point in time, for the best way, to help Grace was intubation. And so at that point, he had very limited options as to what he could do. Doing nothing, his mind was not an option. So if I give her the 2 milligrams of morphine, that may lower her respiration rate, improve her oxygenation, get her deeper breaths, and preserve her life, give her a continued chance to survive. Gave it. He was in the room for 15, 20 minutes, and outside the room for another 10, 15 minutes, watching Grace and monitoring her to make sure that there were no negative effects of the medication. And part of that time, he was talking to Mr. Schara. Grace suffered a cardiac arrest around 7:20 p.m., somewhere around there, and was pronounced dead at 7:27. Cause of death in the medical records points to COVID-19. Thank you. The evidence. Heard me talk about Dr. Binstock. I'll tell you a little bit more about him in a minute. Dr. Garibaldi is a pulmonologist. We'll talk about him in a minute. But the rest of these witnesses, Attorney Frank Koyak, it's already briefly discussed, and I'm going to highlight Dr. Binstock and Garibaldi, Dr. Beachfree in a minute. So I want to give you a little bit of lung anatomy, and keep in mind this is coming from an attorney on an MD. So the way it generally works is you take in oxygen or room air through your mouth, it goes into your windpipe, and it's transferred to what are called the bronchi. From the bronchi, I mean, the large airways that then branch off into what are known as bronchioles. And from there, then they go into a system called the alveoli. I think it might help a little bit here. So you'll see, this is what normal respiration looks like. See the bronchioles branching into something called the alveoli or the alveolar complex. What that is, that's the process of when you breathe in air, you're breathing in oxygen and other elements. The alveoli takes the oxygen and distributes it through the body. It's called perfusion. It goes into the blood, oxygenates the blood, which then goes into all your organs and keeps them alive and functioning. The alveoli has the reverse obligation to it. It takes the CO2 out, which you then expel when you exhale. And that's important. Too much CO2, which carbon dioxide, can cause a problem. That's what your lungs, that's what lungs look like with COVID-19. Something in there called infiltrates. Infiltrates are basically all the substances in the lungs or in the alveoli or wherever that don't belong there. It's supposed to be airspace. We'll see when we show these images, level of infiltrates increasing with each image. And when you have the fluid in the alveoles, it cannot process the oxygen. The oxygen doesn't get to the blood. If it doesn't get to the blood, it can't feed the organs. Can't feed the organs. The only logical consequence at that point, at some point, is cardiac arrest. Evidence, I think, is going to be really clear. On October 12th and 13th, Grace Schara was in the final stage of COVID-19. Dying. Her respiratory rate and oxygen saturation levels are at critical, urgent levels. Dr. Schara was faced with an emergent situation on the 13th, when her respiration rate couldn't be controlled. Razapam prospects. Doing was not an option. If he did nothing, you would hear Dr. Schara tell you that if he did nothing at that point, Grace was going to go into it. Tell you that intubation was her best option for survival at that point. His orders for lorazepam and eventually morphine ordered an emergent situation. Emergent situation, you're going to hear testimony from a number of doctors that in an emergent situation, informed consent, not necessary. Orders for lorazepam and morphine, definitely in response to emergency. The evidence will show that his orders were reasonable within the standard of care. Dr. Schara's conversations with the family, hear what he has to say, he will receive the notes. I think the evidence will show that they were reasonable, standard of care. I think the evidence is going to show that without intubation, resuscitative measures would be in futile. Just pumping blood that has no oxygen or into the rest of the system, compressions, you're not solving the underlying problem of the respiratory. Medications ordered by Dr. Schara did not cause Grace's cardiac arrest. That COVID-19 or in ARDS. You'll hear much different terms, all kind of distractions. So let's talk about expert witnesses. You will hear instructions from Judge McGinnis, let me get a motion, about the sole job as jurors. Judge the credibility of all witnesses, but also of the experts. How do you go about doing that? The jury instruction will give you some ideas as to how to evaluate his credibility, including an expert. But with an expert, I think some of the things that you can look at are, is the witness biased? Does the expert come here to tell you, give you opinions? His or her evidence is, or testimony is obviously biased. They have an agenda. They have something else. Look at the training, background, and experience. Does this expert actually have education? They have the experience. Basically the same thing as the doctor that they're here to report. Also look at their methodology and process. By that I mean, what did they review? What are they based on? Are they based on medical records, contemporaneous records taken while Grace was hospitalized? Or are they perhaps based on deposition testimony taken 3.5 years later? As far as Dr. Burdine is concerned, a couple of important things. He did not serve in the fall during COVID-19 in 2021 as Dr. Schara. Please don't take that to be me saying Dr. Burdine did not serve a valuable role during COVID-19. I'm sure he tended to a lot of patients and did a really good job. That's not the issue in this case. He was not in a hospitalist role. Hospitalist manages day-to-day care of the patient. Dr. Burdine was a consultant who would come in at the request of the hospitalist or intensivist to look at Grace and lend his expertise as a not a radiologist, he's not a toxicologist, not a pathologist, he doesn't have any of those specialties at any hospital. We'll talk a little bit more with Dr. Burdine, and you will hear about what he has and has not done in terms of education, training, background, experience. So Dr. Schara, you had a chance to meet him yesterday, sort of. He's currently the medical director of hospitals at St. Mary's of Nazareth Hospital, Chicago. He's board certified in family medicine. He received his medical degree from Ross University School of Medicine, Portsmouth, Connecticut. Had a Bachelor of Science in Biology, and also a Bachelor of Medical Science, which included an emphasis in pharmacology and toxicology. Very important areas in this particular case, because we're dealing with medications and their effects. Already studied that in his undergraduate. Performed a residency in family medicine at Southern Illinois University. Our experts in Dr. Schara will explain to you what a residency is and why that's important. He was the hospitalist at St. Elizabeth 2020 for April of 2022. Before that, he was a hospitalist at Christus Trinity Hospital in Tyler, Texas, from 2018 to 2020. He served as a hospitalist during the COVID pandemic for 2 different hospitals, and at the hospital in Texas, appointed. There was an attending physician for cardiac and pulmonary focused patients at a specialty hospital, the St. Peaches Hospital. Our first expert is going to be Dr. Aaron Binstock. Dr. Binstock's a board-certified radiologist, graduated with honors when he received his medical degree, which he received from the University of South Florida College of Medicine in 1997. Completed his residency and fellowship training at the Mayo Clinic. He'll explain to you what fellowship training is. Essentially, it's a higher level of education and practical experience that doctors receive after they complete medical school. As I mentioned, he focuses primarily on pulmonary and abdominal imaging. I can tell you that the imaging on October 6th established that Grace was admitted with moderate to advanced COVID-19. Her images and lungs continue to get worse, all the way through 13. Come in and tell you that a reasonable degree of medical probability that Grace's imaging throughout hospitalization was consistent with severe COVID-19 harms. Our next witness, expert witness, is Dr. Brian Garibaldi. Dr. Garibaldi has 3 board certifications. He's certified in pulmonary, internal medicine, and critical care medicine. Critical care medicine is basically the practice of medicine in an ICU setting. Dr. Garibaldi received his undergraduate degree from Harvard, and then he proceeded to go to Johns Hopkins University for his medical degree, and he completed a residency and fellowship training there as well. We'll go through a little bit more of Dr. Garibaldi's qualifications when he's here to talk about them. He can explain them far better than I can. But I think it's important to note at this point that Dr. Garibaldi, when he was at Johns Hopkins, he was there during the pandemic, and he has written numerous peer-reviewed articles on COVID-19 treatments all across the gamut. He wrote about. He's also received multiple research grants to conduct research related to COVID-19 and the treatment of COVID. He's going to be here to tell you that the care and treatment provided by Grace's healthcare team met the standard of care. Grace entered the hospital with severe COVID-19 and progressed ultimately after October and caused Grace's death. I can tell you that Dr. Schokar did not need to obtain informed consent to use lorazepam or morphine. Reasons I mentioned before, it was an emergent situation. We'll tell you that lorazepam and morphine and also Prestex are medications routinely used in the ICU. I'll tell you that the ordering of the lorazepam and morphine were within the standard. Intubation was the best option for Grace's life. Without intubation, resuscitative measures would have been picked up. We'll also tell you and explain to you, as with Dr. Schokar, there's no evidence heard in the plaintiff's opening statement about a metabolic acidosis. I'll explain to you why there was no evidence of metabolic acidosis, and that there is a different condition called respiratory alkalosis. They'll explain to you the difference, why that is important. Dr. Shokar's final expert witness will be Mary Catherine Beach, board certified in internal medicine, professor of medicine, Division of General Internal Medicine, Johns Hopkins University. She's also the co-director for the Center of Humanizing Medicine. She has spent a good portion of her career researching and writing on medical ethics. And she's going to be here, and you can see up there, she's written over 150 articles on topics related to medical ethics. She's going to be here to tell you that the use of Prestex, lorazepam, or morphine fell within the standard for Grace's condition and would have been considered routine and did not require a separate informed consent. He will come here and tell you that after reviewing the records, her opinion that Dr. Schokar documented a thorough discussion with respect to decision-making, intubation, resuscitation, and that the DNR order was issued with the consent of the Schara family and documented properly in the medical record. We'll also come here and tell you that St. Elizabeth was not required under any informed consent discussion to inform Mr. Schara that he may be asked to leave if he exhibited signs of COVID-19. That's because it was well known. out in the hospital. Times. Place. As has been mentioned several times, the plaintiff has the burden, so they're going to have the opportunity to vote. We will be presenting the experts, medical records. Comes after. When I have the burden of proof, but I ask that you hold off on this, any decision about this case, for all the evidence, all the expert testimony. Well, ladies and gentlemen, a lot of times we refer to what you're doing, jury duty. I'd like to think of it more in the context of jury service. My viewpoint of Dr. Schokar's, what you are doing here over the next week, service, helping resolve the conflict. I know your time is important and valuable to you. And throughout this, be mindful of it.
Thank you, Mr. Guzzi. At this point, ladies and gentlemen, we're going to have we'll just move the pedestal. There you go, podium. And the bailiffs are also going to hand to you a notebook and a writing utensil, and I'm hoping, Judy, that we can get them some pens. Definitely. So you can have a pen and a pencil. I know a lot of people like to use pens. One thing I just want to say, and I'll try to remind you of this notebook as you're getting it, is this is a notebook that you shouldn't leave on your chairs here at break, so take it back with you to the jury room. You can't take it home with you, so at the end of the night, it's left in the jury room. Okay, so that should just kind of go with you as you're in this building, and then at night, it's left in the jury room. That notebook will be used only by you, during, and then you can share it however you want during deliberations. You don't have to share it, and I can represent to you that I will never look at your notebook, and nobody else will. So when you leave in a couple of weeks, when the case is over with, the bailiffs will shred everything in those notebooks before they leave on the day, and while I'm back in my office doing other paperwork. The task that gets done before everybody leaves. So that's kind of the notebook for you. You should label it on the cover, you know, whichever way you can identify it as your notebook, probably with your jury number. And hopefully that's helpful in terms of what's going to happen with that. And I'll try to remind you at breaks just to take it with you. I think at this stage, plaintiff, you're going to call your first witness.
Yes, Judge, and I would also ask that the order for sequestration of the witnesses be given to the gallery in the event there's anybody here.
Okay, well, and as I said at the pre-trial, I think you're all responsible for your own witnesses, because I don't know who's who. So, and I want to explain to the jury what that means. So there's an order that the parties have agreed to, that there's sequestration, which means if there's a witness in this trial, they will be sequestered out in the hallway or somewhere else during the testimony of witnesses before them. Once they're finished testifying, they can then stay in for the rest of the trial because their testimony's done. And there's an exception to that rule. So Mr. Schara is a witness, but he's a party, so parties get to be here. Same with Ms. McGinnis and Dr. Schokar. So they'll be here even before their testimony because that's their right as a party to the lawsuit. So if anybody in the gallery, if you are a witness or a potential witness, I'm hoping the attorneys have told you, but you need to leave at this time. Is Ms. Schara? Okay, Ms. Schara, if you want to come on up to the witness stand. And when you get there, Ms. Schara, just before you're seated, if you could raise your right hand, and the clerk is going to swear you in.
Do you solemnly swear or affirm that the testimony you shall give shall be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Please have a seat. and spell your name for the record.
Cindy Schara, CindySchara.
All right, Attorney Boylan, your witness.
Good morning. Good morning. Cindy, please tell the jury who you are in relation to this case.
I am Scott Schara's wife. I'm also the mother of Grace Schara.
Where are you from?
I'm from Appleton, Wisconsin. Grew up in a little town called Pittsville, Wisconsin.
Your educational background, can you tell us briefly about that?
Sure. I have a Bachelor of Science degree in education, and I majored in special education and minored in elementary education.
You're Grace's mom, you told us.
Correct.
When was Grace born?
Grace was born on September 22nd, 2022. I'm sorry, 2002.
Where was Grace born?
Was born in Oshkosh, Wisconsin at Mercy Medical Hospital.
Judges, pull up the first exhibit, which is exhibit number 2. And
As Attorney Boylan is doing that, just so that parties know, starting now, if something is up on that screen, I won't say this every time, but just a reminder that the parties have agreed that that's evidence. So whatever you're seeing, it may or may not be testified to, but if it's up on the screen and published to you, you can consider it as evidence in whichever way you observe it. Go ahead, Mr. Boylan.
thank you, Judge. Cindy, this is the first exhibit of the case. The reason it's exhibit 2 is exhibit 1 is going to come in later, which is the entire medical record. We're not going to do the entire medical record with you, but I want you to identify this photo for me.
This is a photo of Grace when she was 4 or 5 years old, I believe. She loved Santa Claus, and even as she got older, even though she knew Santa wasn't real, she loved to still pretend and made it joyful that she would get together with. So when we had Santa arrive at our horse barn, Grace would make sure that she had the opportunity to shine light on Santa and even whisper in his ear to tell him that, Santa, you know you're not real. It was pretty neat when we had every Christmas the opportunity came for Grace to see Santa and just play out that joy that she had.
Let me ask you about Down syndrome.
Grace was born with Down syndrome. She was a gift to us, and her doctor, when they found out she had Down syndrome, had just told us that you can take 2 normal children and put them in 2 different atmospheres, and one may flourish and one may not. And she said that's the same with any child with special needs. She said, you look at Grace as the sky is the limit, and you offer her the opportunities that you would for any other child. And so that's what we did. Grace was not denied opportunities. We let things happen in her time. For example, she walked just before she was 2. We knew she was going to walk, and she did walk. She talked, started to talk mainly when she was 3 years old, and that was after she learned several signs. She signed probably about 100 to 150 words, and then when we started horse riding when she was 3, she started to drop the signs and say the word. But Down syndrome is a chromosomal abnormality. A lot of people don't understand that. They think that it's something you can catch. And Grace had 3 21st chromosomes. And so her 3rd chromosome, she always called her love chromosome. And she did love. She loved everybody. There wasn't an opportunity that she didn't take to shine God's love on other people. And she just capitalized on that 3rd chromosome. And she would share that I've got a love chromosome. And so if you've ever met anybody with Down syndrome, you would see that as well, that third chromosome is just extra in them. Grace didn't have a lot of the Down syndrome features that some Down syndrome children have, but she had a few. She had the straight line on her palm. She had a little bit of folds on her ears, short, a little bit stock am short as well, but she was a little bit short. Her nasal cavity was more narrow and short. She just had little short stubby fingers, but yet that didn't prohibit her from later on playing violin and piano and so on. But those were mainly her features. She didn't have any health issues that interfered with her Down syndrome.
All right, so I want to be sure I understood you correctly, because is this her first time testifying here?
Yes.
Are you a little bit nervous?
Very nervous, I'm sorry.
That's okay. The people who do this every day, we get used to it. You're not used to it, and I don't want you to be, but I want you to be able to slow down. If you can, it's okay. We're not in a rush.
Okay.
So catch your breath. Were telling me, you're telling a jury, you're telling me about some of her features. Look at that picture and recognize this is a person with Down syndrome. You talked about her ears, and tell me just about the ears at this point.
Her ears, as most Down syndrome children have, just their ears kind of fold down at the top. And so they don't have the top nice peak on it. And that's was just a feature of Grace's Down syndrome.
Her nose.
Her nose was more shortened, and the nasal passages were very narrow. Another thing I just thought of is also with ears, their ear canals are very narrow as well. So that's just another feature, but it didn't influence anything with Grace's hearing or anything. She was totally fine in that way.
And I first asked you about her ears, then her nose. Her nose?
Right. Her nasal cavities or nasal passages were just more narrow. And that's a typical feature also of some Down syndrome children.
Cindy, let me ask you this. See Grace alive?
In person, the last time I saw Grace alive was the morning of October 6th. I also saw her FaceTime calls from our daughter at the hospital. But in person, it was on that morning when we took her to urgent care.
So October 6th, the first time you saw her, the last time you saw her alive in person?
Correct.
You saw her by some video means October 13th?
Correct. I last saw her at all the day of her funeral on September 28th. Or October 28th, I'm sorry, October 28th.
Prior to her funeral, when did you last see her at all?
The last time I saw her at all was in the hospital when I came to St. Elizabeth's after I learned of her death. And then I came to the hospital and saw her there.
I don't know that I heard you, and just, it's okay, slow down, but your voice is cracking in some way. So the court reporter's got to get all of these words down. The jury's got to hear everything you say, so we can take our time with this. What I was asking you is about when did you last see her at all? And I have some background in this, so I maybe heard you in a way that other people wouldn't have. Could you please tell us when you last saw her at all?
The last time I saw Grace at all was at the funeral.
The funeral, when did you last see her at all?
The last time I saw her was on the FaceTime call at the hospital.
That's alive.
Right.
When did you last be in Grace's presence prior to the funeral?
I'm sorry, I'm confused.
It's okay.
So the last time I saw her in person was October 6th, the morning that we took her there. And then I was in person, then I saw her at the funeral was the last time I saw her. But prior to that, I saw her in the hospital.
Okay, there's what I was wanting to ask you about. You went to the hospital?
I went to the hospital after Jessica had witnessed, and we witnessed on FaceTime, Grace's death. So our pastor and myself went to the hospital to claim Grace's body. So that is the last time I did physically see her.
How much time was that you were with her body after she died at the hospital?
We were with Grace's body for several hours. When I first got there, the pastor had helped me come in through the emergency doors, and then we walked. He actually pushed me in a wheelchair as I was in quite shock. And we went through hallways. There was long hallways to get up to second floor. And
Cindy, I'm going to stop you because
okay.
I'm
sorry.
Want to ask you something more specific. You said for about several hours?
Correct.
Were you sick at the time with a positive COVID test?
I was still having some coughing and incontinence is more of what was happening because I just coughed so hard.
Sure, but I want to understand, you told me that you were there at the hospital for several hours.
Correct. I was still to the point where I knew that the hospital would have not accepted me in the hospital, but I walked in with no problem at all.
And the hospital staff was there with you in the room for several hours?
Correct.
You had tested positive for COVID?
I had, correct.
But before she was dead, you weren't allowed there. When she was dead, you could come in.
Exactly, and I couldn't believe that I could walk right through. But nobody questioned me. I went right through to the room. And I felt sick. I felt I could have been with Grace much earlier because I didn't even challenge anything when I walked through the doors.
All right, Cindy, I want to go on to the next exhibit I'm going to show you. We saw Grace there as a toddler, younger girl, 3 or 4 years old, you told me in the first picture.
Right, 3, 4, or 5, I think it was, the picture with Santa.
Grace was how old when she died?
It was 19. Only 19.
So you raised her, you saw Grace grow up, and I want to ask you about some of that. I'm putting up a picture here, which is, tell me what it is.
This is a picture of Grace, a picture that Grace colored for us. She was just so talented when it came to coloring, and she would leave notes around our house and send notes to people. And this was one of the many that she had given to me. This was Mother's Day, and she always made sure that she didn't forget special days like this. And so, as you can see, she colored it and she wrote in cursive, her greeting noted on it that she was my BFF, Grace Emily, which she was. She was Scott and I's, our special gift to us. I actually think of her as our angels unaware, because she was someone who just always thought of everybody else. And in this case, she'd think about me on Mother's Day, but she would do things like this for so many people, just always aware of people around her and hoping to make their day and just shining God's light on
those that she would, and even if she just saw somebody on the street, she wouldn't hesitate to say hello, or if we were at the market, and she would see the guy checking us out or bagging the groceries, she'd make sure to say thank you. And she saw his name tag, she would personally say, well, thank you, Jason, or thank you, Barb, or, and it was just the precious thing, because she made the trips to wherever we went, even if the grocery store special. But that's what this picture is. And her coloring, like I said, they were masterpieces. It just wasn't a regular coloring page, but she would just make it to be extra, extra special.
So some people may have the misimpression that somebody with Down syndrome doesn't necessarily function well.
Oh, that's a very wrong perception. Emily had a lot of abilities, and I think her life is a testimony to many other families now, and prior to that too, that as long as you look at your child, whether they're special needs or they're normal, that they have the gifts that God has given them, and Grace took every gift that she had and just went with it.
I want to just make a record, because now you're changing photographs, but the exhibit that was just displayed to the jury is exhibit 3.
Yes, sir.
Okay.
This is exhibit 4, Cindy, and I'm showing you. It's published to the jury on the screen, and I just asked you about some people's maybe misimpression about functioning of a Down syndrome person. Tell me what this picture is.
This is a picture of our daughter Grace at a violin recital, and that's her teacher, Mrs. Wendell, who just adored Grace, and she made every year with violin lessons so extra special. She saw and learned that Grace loved Elvis, so every violin recital, whether she played 2 or 3 songs, one of those songs would always incorporate an Elvis song. Thus earlier, I believe you heard that she played her violin for her sister's wedding. And so this is a special photo. But Grace, she actually learned how to play piano first, and then she got the opportunity to try guitar, because we had a guitar, and I said, Grace, why don't you try guitar, because we didn't have a violin. And so she took the opportunity to try and learn that, but her fingers just couldn't reach around the neck of the guitar. And so then she said, Mom, I think I can do the violin. And she sure could. Her uncle had told her, Grace, you know how hard it is to play violin? She says, he told her how he plays accordion, and how with accordion, you have to look at the music, you have to push the buttons, you have to do the squeeze box. And he said, Grace, you're doing that complicated instrument just like I do with my accordion, because she'd have to move the bow, and she'd have to read the notes, and she'd have to put the strings with her push the strings with her fingers. But she was able to do things like that. She was not limited, and I don't think any Down syndrome child should be limited. They can do things. They just may have to adapt, like Grace would have to adapt. She learned to put different colored tapes on the different strings, so she knew where the fingers should go. But she just loved playing violin, and we miss her music.
She also a dancer?
Yes, she was a dancer. Some of the many recitals that we would attend, Grace would just shine in her dance class. And when she would exit the stage, she would make sure she added a little flair, whether it be a blow kiss or she'd kick her foot back. But everyone would be in awe with Grace. She never did a special needs dance class. She just did a regular class. And the kids would just welcome her with no hesitation. And they helped her learn the routine, and recital days would come, and we'd think, oh gosh, is Grace gonna make sure she gets all the pieces together, all the motions, and all of a sudden she'd just blow us away. She would just get it all just perfect, and it was just a neat thing. So dancing was the second thing. So I'm thinking of violin. She learned how to play violin. She was a dancer. She was an actor. She loved to be in plays, our homeschool plays. And one of her last plays that she was in was The Sound of Music. And she had several parts. She played a townsperson, and she played one of the puppeteers.
and she played one of the people at the concert. And I'm trying to blank with what was the other part that she played, but she wanted the part where the one single lady bows during the Von Trapp family's concert, and the two directors had told Grace, "Don't be worried." She said, "You can still do your bowing thing." So she played up one of the triplets that played at the concert, and so at the end of Grace's performance, so she did that bowing thing, just like the original Von Trapp family singers event, and she just milked that up, milked it to the best that she could, and she started go off stage, and she was bowing, and then the man would try and get her off, and she'd come back, and it was just precious. So she did a lot of acting. Her other thing she loved was horse riding. She rode horse. When she was 3 years old, we just began riding horse. And
Cindy, 1 second. So let me ask you about the
Sure.
initial purpose of getting her riding a horse.
Oh, yes. As I said, Grace signed a lot of words. And when she was 3 years old, we started to have her take horse riding lessons. We learned that horse riding would stimulate the muscles for speech production. And so we sought out a place called Exceptional Equestrians where Grace would ride horse. And so we rode twice a week to begin, and Grace would sometimes ride backwards, and then they would have activities where they would maybe give them colored socks, and one of the socks would be around the arena and the other sock would be given to Grace, and she'd have to go and match the sock as she rode. Or she would be catching the ball on the horse as she's rode backwards, or play limbo on the horse as, you know, just leaning back and so on, or reaching for something that they put, or blowing bubbles. And so that were done while she was riding horse would be used to help stimulate those muscles. Well, Grace's first word was walk, and then her second word was walk on, and walk on got her to get the horse to move. And so at 3 years old, she rode horse. And so she was riding now all on her own. She would take care of the horse. She'd have to go and get it out of the stable. She'd have to clean its hooves. She'd have to brush it, saddle it, and get on, and she would ride all on her own. And that was just another wonderful thing that we had put in our path. People would ask us many times, boy, Grace can really talk well. Her speech is really clear. And then we'd tell them about the hippotherapy, because that's what it was called, hippotherapy, when you ride horse. Hippo is a Latin word, and so hippotherapy was what that was. And so Grace first started where she had just a sidewalker with her on the horse, and she would go around the arena and do the different activities. They'd play music, and that would help her too, because the music stimulated the brain also, and the muscles on the horse, all that stuff kind of intertwined with each other. And so when people would ask, like I said, boy, Grace really talked, she would say, I'm a jabberbox now. And she would claim it was because of her horse riding, and then also because of God watching over her. But it was pretty amazing. So she slowly dropped the signs, because she said, she said, you know, had learned about 150 signs, and slowly she would drop the sign and say the word, and all of a sudden we had our jabberbox on her hands, and she would just love to talk and also sing. She loved to be in choir. She, even in church, there was another place she'd bellow out songs. And then at times she would even do some of her signs that she learned while she was singing in church, because a lot of the signs she remembered. And so she had her dancing, her violin, her horse riding, and then just many other numerous things where, you know, she, like I said, she loved learning about Elvis, and she loved to just learn and do different things.
All right, Cindy, one other thing that comes to mind, she was this country girl riding a horse, the lawnmower.
Yeah, she loved to ride the lawnmower. When she was little, she would ride with me in the front of the lawnmower, and she thought that was pretty cool. But then when she got old enough to actually drive her own lawnmower, because she knew how to ride or drive the golf cart around, and so we got her a little lawnmower so she could help us mow the lawn. And so Grace knew all the safety features on the lawnmower, so we felt fine, you know, letting her drive the little tractor lawnmower. And she would mow. kind of carve out a section so she would be able to mow the lawn for us. And one day I was watching her because it was so cute. I'm like, I'm progressing on my side that I'm mowing, and she's kind of taking a little bit longer on her side. And then I realized what was happening. She was mowing 3 of the sides, but the 4th side she wanted to hit the willow tree. So she always came back and she'd hit the willow tree, and then she'd mow the 3 sides and come back and hit the willow tree. But mowing lawn was one of her joys with Mom, and then we'd wave to each other as we were on the lawnmower, and it was just one of those special things. But she knew how to use it going forward, backward, engaging the blades and everything with it. So it was another thing that she was able to do.
All right, take a breath.
Okay.
I'm going to show you another picture. I've shown what's Exhibit 5. It is up on the video screen for the jury to see. Cindy, tell us that picture.
One of my favorite pictures. It is, again, at a violin recital at Christmas time where we would go to the nursing home. And so not only would Grace get to play for the residents, but then we would actually get to interact with several of the residents at the nursing home. And here it was just a precious moment. Grabbed it so we could use it in our Christmas card.
There are 2 people in the photo, or are you?
That's myself, a little bit younger, thinner, and then my husband, Scott, Grace's mom and dad.
Do you know what year that photo is?
Gosh, I'm guessing that she's probably about 15, 16 here.
I've put up the next exhibit, which is Exhibit 6. And first, I just want you to give me the short answer on to identify what is this.
This is one of Grace's papers that she wrote for a class that we were doing. It was a writing class, and she decided to incorporate her vocabulary words in her writing with us so she could do 2 things at once. That was one thing she always thought about is, how can I get my work done a little bit faster? And so she said, I'm going to do my vocabulary words in the writing. So that's what this is.
Okay.
It's a letter or paper that she wrote on her future.
What is the date that she wrote this?
This was June 5th of 2020, so the full school year before we lost her.
Tell me about Grace's school. She was still in school in 2020?
Correct. Having special needs, Grace is able, and also so are other special needs children, they are able to attend school 2 extra years. And so Grace just loved learning. And as I stated, we had homeschooled, and she just blossomed with every subject. And she had friends that were going to be graduating earlier and some that were going to be graduating later. And so she wanted to keep learning and so on. And writing was one of her gifts that she had. She took the opportunities to write, and in this letter or paper that she wrote, it incorporated all of her thought, hopes, and dreams. You know, it's kind of ironic that following fall we lost her because she was dreaming about what she was going to do in her future.
All right, now again, I'm going to ask you to slow it down, take a breath, and I'm going to want you to read this. I have a hard time.
Okay, you have to just, I have to be able to read, just need bigger for me.
Just 1 second. Will you be able to do that for me?
Yes, I will be able to.
And I'm going to ask you to just do it without any commentary if you can. If you can get through it, I want you to read what Grace wrote about her future the year before she died.
So it was titled My Future. For the final paper in my writing class, Mrs. Rosenthal asked us to think about our future. What will I endure? What will it be like? Welcome to my future land.
And Cindy, if you need to slow down, you can.
Okay. To commence, I'll be 18 years old on September 22nd, 2020. Once my parents teach me to drive, I'd like to have a red convertible with 2 white stripes. Someday, I'll be married to a handsome husband and have lots of kids. We'll inhabit in my living space built next to our pond. We'll be compatible and get a yellow lab puppy, and I'll name him Thor. Before I get married, I plan on working at Freedom Foods, stocking shelves. This work will help me get skinny so I can wear a bikini. Just kidding. I'll look better in my suit. I will continue to be a proud aunt. My nephews, Caleb and Riley, will be very skillful. Riley will be designing a myriad of squirrel feeders, couches, and crosses by my Uncle Travis's grave. Caleb will be a snowboarding professional. His mom snowboards a lot.
Just give me 1 second to move up the rest of the letter.
I might obtain work at the Pine Tree Supper Club, waitressing, and might serve the food. Maybe I'll embark on a trip to Memphis, Tennessee, and work at Graceland, since I am a big Elvis fan. I could give tours with fervor and tell about Elvis and Priscilla. I could work at the guest house at Graceland and make the beds and straighten the towels in the bathrooms. In my spare time, I'd like to help with adopting pets. I really aspire to play violin in it someday too. How's that? When I reminisce years from now, I hope many of my hopes and dreams have come true. Don't you?
Could you really have done that?
I believe she could have reached all those goals. Her playing in orchestra is the only one I kind of question, but I think that if she had minimal speed parts, she played more of in a tempo that was easy to keep up with. But I believe she could have. She did get a couple of things. She accomplished a couple things there with her puppy Thor that she got that Christmas before she died. And she did learn how to drive around our property. And she
have lived on her own someday?
Yes, she had planned actually to live in our little living space that we made for her. 2 of her friends, she had planned that 2 of her friends, Ellie and Rebecca, were going to be moving in with her, and they were going to have the apartment together. And she was really looking forward to that. We had just started to decorate out there for her.
Did she write this paper just before graduating?
It was the school year just before she would have been graduating. So in 2021 was the year she would have been graduating. It was that year prior to that.
She died October 13th, 2021.
Correct. We had just started our new school year. And she was very excited about all the cool classes that she was going to be taking. We had a theater class that we were enrolled in. We were learning about the stars, the planets, and everything that year. We were learning all about the wars. That was one of the history classes she had picked. She had a really, really cool dad that was teaching that class, and Grace was so excited about that. And she would actually challenge him in class, and she would correct him because she knew geography so well. And so when he would be talking about certain things with the war, she would say, I'm trying to think what his name is, Mr. Gare. She said, Mr. Gare, are you sure that's where that area is on? And she would correct him. So it was pretty precious.
So graduation, she did or didn't graduate?
They did include her in the graduation ceremony with our with our groups. There was 2 separate ones that Grace was able to be part, and they included her in the program, and let her have a write-up in the program. And in one of the programs, they had a picture of Grace with her. They photoshopped it. It was Grace in her graduation gown with angel wings.
They included her in the graduation ceremony.
She was so looking forward to graduating. It was one of her hopes and dreams too, even though she didn't have that in her paper, but she was so very excited about graduating and getting a job. And
you've told me a lot of amazing things that she could do.
mm-hmm.
I want to ask you about something you didn't allow her to do. And this is about the being alone. Tell me about that.
Correct. We allowed Grace to do a lot of things, but never ever did she go anywhere where she was alone. She always had an advocate with her. She always had a friend that knew her, or our mom and dad, us with her, or her sister or brother. But Grace was never ever left alone until we ended up leaving her at St. Elizabeth's Hospital and Scott was taken out.
So the first time in her life that she had ever been alone was the day that St. Elizabeth's Hospital kicked your husband out.
Correct. I was very worried because Grace had never been alone before. And that's how it was so very important for us to get Jessica in there with her.
It was important for you to get Jessica.
Correct. We thought within, an hour we'd get Jessica in the room after Scott was removed, and I couldn't go in. At least I felt I couldn't go in because I had COVID symptoms, and now as
you could go in after she died.
Correct. Right here.
I heard in the opening statement that the day your husband was kicked out, there were no administrators around, and it sounded to me like it really wasn't a big deal that nobody else could get back in for 2 more days to be with Grace.
It may not have been a big deal to them, but it was a big deal to us, and it was a big deal to Grace, because to leave Grace alone was, as a mom and dad, we're very worried about her because, one, she's got a BiPAP mask on and she can't communicate with that on. I think she even tried to sign to the nurses at one time or other because she knew that she had to communicate. No, she signed to Dad a couple times when they were in the room together. She used her resources and tried to communicate.
It was a big deal to you?
Very big deal. I was very worried. Luckily, we had our own iPad in the room. So the first day that she was alone without us there, we did have communication with our iPad. It wasn't the hospital's iPad. The only time that our iPad was used, and never was their communication with use of their iPad.
Okay, so let's slow down here. And let me start to ask you about how Grace ended up at Ascension St. Elizabeth's in October 2021, okay? Mm-hmm. So I'm going to start.
Dr. Mary Nordstrom.
And who's Dr. Mary Nordstrom affiliated with?
She's part of St. Elizabeth's Hospital. We've had her as Grace's primary care physician for years. And we would see her every year for a checkup. Or if we needed anything, but she loved Grace and Grace loved her.
Was she your pediatrician also?
Correct.
So long-standing relationship?
Very long, correct.
Was Grace on any prescriptions? Tell me what prescriptions she was on prior to October 2021.
She was we only had a prescription for amoxicillin, and that was and we used it for a rash that she had, so we had it as needed. Other than that, Grace was not on any medications. We took supplements and
How about, did she have some treatment for sleep apnea?
That was much later. We had just gotten a CPAP machine shortly before her and I, gosh, probably maybe a year to 2 years prior, I think.
You have a skin rash?
Yes, that's the only reason why we had the amoxicillin for her. We had no other prescriptions for Grace.
You gave her the prescription that was recommended by the primary care doctor?
Correct. She actually had a dermatologist that had prescribed the amoxicillin. Prior to that, when she was little and she had like dry skin stuff, things like that, Dr. Mary Nordstrom would, make sure that we had, a needed rash salve or whatever we needed. But then as she got older, we sought out a dermatologist for her skin.
And then the sleep apnea later?
Correct, yeah. So then we had, she had started to snore like I do. And so we had just learned about the CPAP. We had both just gotten our CPAP machines in the past year and a half, I believe it was.
How did your family make medical decisions as Grace was growing up?
We made our decisions just like any other family would make decisions. We, talked about things. If Grace needed, a Tylenol for headache, she would just say, "Mom, can I have one?" Or if she wanted one, I would, would offer it to her. If she wanted it, she'd take it. But it was, as a family, we always just decided, just like any family does, if you're not feeling well.
All right, well, let me ask you then, we're coming up to October 2021, and I want to ask you about initial symptoms in maybe late September or early October, okay?
Mm-hmm.
What can you tell the jury about that?
Around September 28th, I think it was, her and I both started to have allergy symptoms. And as I look back at pictures, Grace had allergies almost every year around that time. She had her red nose, her watery eyes. She was kind of tired. I was tired, and it was just more allergy. So, as I said, it was just allergy symptoms.
Well, what would happen next?
We had a wedding to go to. My niece was getting married on Friday night, October 1st. And so we just didn't want to spread the COVID if that's what Grace had. We didn't know that. I still, okay, we're just, going to test just in case. And so we did. And so Grace tested positive that night before we were going to go. And so then we did not attend the wedding, but her symptoms were just, like I said, as allergy symptoms.
Well, do you remember the date of that?
That was October 1st. It was a Friday.
You were away from the microphone a second. I believe you said October 1st.
Correct. Yep, correct.
So you didn't go to the wedding. She had tested positive.
Yes. Mm-hmm.
What did you do then?
As soon as we knew that she tested positive, then we started to make sure that we just the natural things that would help, so we were taking supplements and things. And
did you monitor her oxygen?
Correct. We did start to monitor oxygen saturation with the pulse ox at that time. Prior to that, we didn't, but Grace's oxygen was normal at that time.
So the days progressed during her oxygen. Was there some then cause for concern?
Yep, it was just one night when I slept by her, and because Scott, we didn't want to give Scott whatever we had, because I was kind of having some symptoms at that time too, thinking it was just allergies, but then Grace tested positive for COVID, so I thought, okay, well, maybe we have COVID, so we kind of slept in the same room, so we didn't get Dad sick, and so I was just monitoring hers and my oxygen saturations, and Grace's just that evening, it hung between 87 and 91, and I couldn't get it above 91, so we had learned about the COVID. We had gotten to supplements and things that would help our bodies rebound. And so we ended up just starting the things that we felt were going to help us get better.
Okay, but her oxygen saturation, then it dropped below 90 for some point of time.
Just periodically off and on, but we had been watching following the front lines doctors' recommendations for COVID. And so then one of those things said that if our oxygen below 94, that you should, go in and get checked. So that's what we did. We called Dr. Mary Nordstrom's office right away.
All right, and this is her primary care doctor?
Correct. Yep.
Affiliated with Ascension St. Elizabeth's?
Correct.
And what did this doctor advise that you do?
When I called her office had said, if Grace tested positive with an at-home COVID test, that I couldn't bring her in. And so that we had to go through the urgent care, Ascension's urgent care. And so then that's what we proceeded.
One thing at a time.
Mm-hmm.
So that you called the doctor's office, your primary care doctor you told us about before, affiliated with Ascension St. Elizabeth?
Correct.
And they advised you to bring her into urgent care?
Correct. They said I could not come to Dr. Mary Nordstrom's office, but that to go to urgent care.
Did you follow that recommendation? What did you do then?
Scott drove and I sat in the back road to the clinic, and I just stayed in the car because I was, like I said, coughing and having a little bit of incontinence, so I just had Scott take her in. And so he took her in, and we were just some oxygen, supplemental oxygen, because she was not having any trouble breathing or anything. It was, like I said, it was like allergy symptoms. Same thing with myself, but then we had just trusted the oxygen pulse ox thing, and so it's the only thing that we really needed.
Okay, one moment. Judge, I'm looking at the clock, and I want to be sure my clock is correct. Is it 11:20? Okay, how much? Okay, thank you, sir. So you got in a car as a family, your husband, her dad, and you drove to the urgent care clinic. That's what you told us?
Correct. Mm-hmm. We did.
You didn't go inside, your husband went inside with her?
Correct.
You sat and waited in the car. What did you then learn?
I learned that while Grace and Dad were in the urgent care, that they wanted to take Grace over to St. Elizabeth's emergency room to do another test that wasn't able to be performed at the urgent care.
All right, so then did you all get back in the car and drive over to the urgent care?
No.
I'm sorry, drive over to the emergency room?
Oh, no, we could not actually drive. I was thinking that we would just drive up, but since they were in the urgent care for about an hour and a half, I think it was, just before we were told about this test, I learned that they had put oxygen on Grace. So now since they had put oxygen, giving her a nasal cannula in there, we could not ride together as a family over to the ambulance had to take Grace. And so I told Scott at that time, I said,
Just 1 second, I wanted one point at a time so we can follow the story. You didn't drive over to the hospital as a family. At this point in time, it was determined she had to go in an ambulance.
correct.
Okay. Did she go in an ambulance?
She did, not by herself though.
Okay, she didn't go by herself. What do you mean?
I wasn't gonna let Grace go by herself, and neither was her dad, so he had said, well, if she's going by ambulance, I'm riding with her. And so then he rode with her over to the emergency room, and then I followed with the car, family car.
Okay, and this goes back to what you told us a few minutes ago. She had never been left alone a day in her life.
Correct.
So even to the point going from the urgent care to the emergency room in an ambulance, her dad was with her.
Correct. Yeah.
The ambulance drove to the hospital.
Correct. I had learned that when they had left, by getting a photo from my husband snapped one as she's loaded into the ambulance with her thumbs up, and it was pretty amazing. I guess I'm just going to follow the emergency room vehicle or the ambulance over.
Okay, so
Which I did.
where did, you followed it over, you didn't go home?
Followed it because the plan was just to get Grace another test. That's all they had.
What did you do when you got there to the hospital?
I stayed in the parking lot for a couple hours waiting for them to finish up with their test.
Okay, so the ambulance took Grace into the hospital?
Correct.
And your husband then came back to the car with you because nobody's allowed in the hospital at COVID time?
Nope. In there with Grace. He wasn't going to leave her side, and so he was in the hospital with Grace the whole time, and I just in the vehicle by myself.
And you're sure of that? Your husband was allowed in
Mhm.
at that time?
Yep, he was allowed in at that time.
What did you learn about the emergency room visit? What was going to happen next with her? Was she going to come home or something else?
After several hours, I learned that they wanted to keep Grace overnight for observation and put her on a steroid for maybe 2 to 3 days. And I was under the impression that we could possibly bring her home after they just did the one night of observation. But that's not ended up not what happened.
Well, what happened? How long was she kept at that time?
She was kept in that hospital then until she died.
Is this a good time to break?
Would be, yes, Your Honor.
For the jury, at this time, we're just going to take a lunch break. I was notified that I think most have arrived. There might be a couple that are missing that you can share or somehow work it out. But just a reminder, so during this lunch break, if you can take with you the stuff that you brought into the courtroom, including your notebooks, and then bring the notebooks back in with you. We'll let the bailiffs know exactly what time are going to get started, but I've heard what you guys need or what you prefer. Thanks for your attention this morning, and just a reminder not to discuss this case or anything to do with the case with anyone, including each other. The jurors are excused, and Ms. Schara, you may step down.
Okay, thank you.
That's whatever. Received. Just a note that you'll have your witness back here at whatever time we decide to start, Ms. Schara.
Yes.
Okay, and then how long do you guys need? I know the jurors said 45 minutes, so does anybody need more or something different than that, or is 45 minutes good?
From my perspective, should be fine. That's fine.
Is that good with you?
That works.
Okay, so looking at the clock, why don't we just say we'll get started at 12:15 on the courtroom clock? Is that good?
Sure. That works.
We're adjourned.
the hospital on October.
Correct.
So that
That was the case.
okay, what was the result? To be
Jessica was supposed to be able to be there as her advocate and power of attorney.
So you had to hire a lawyer to get her power of attorney already
Correct,
into the hospital.
correct.
So that brings us to October 11th.
Yes,
And at some point in time, then Jessica again presented to the hospital after having been rejected. She again presented to the hospital on October 11th, right?
yes.
Do you know about what time she was able to get in? Morning, afternoon, evening?
She wasn't able to get in until 2:45 that day when visiting hours had started already at 11, but she should have been able to be in the doors of the facility right away in the morning.
Time out, I'm just asking you at the time, and you said 2:45, that's
Correct.
PM.
Right, in the afternoon. So PM.
Your husband was forced to leave the hospital the morning of October the 10th,
Correct.
around what time?
It was around 8 o'clock in the morning.
And Jessica presented multiple times at the hospital, finally got in at 2:45 on the 11th.
Correct. So when we,
Just rephrase it.
Sure, and I was rephrasing her prior testimony. She already told me that she got in at 2:45.
correct.
Is that the time that what time do you believe she got into
I
hospital?
believe she got in at 2:45 as well.
So I'm going to ask you to do some math.
Okay,
I'm not very good at public math. This is public math. The morning of October 10th, 8 a.m. to the afternoon of October 11th at 2:45, how many hours is that?
31 hours that Grace was without an advocate in the room with her.
Okay, October 11th, Jessica's at the hospital.
Correct.
How long did she get to stay in the hospital? She stayed until Grace died?
No, she was not allowed that evening at 7 p.m. She was told visitation hours were up, and so she had to leave. And again, Grace was by herself.
So you referred to visitation hours here again, and I want to be sure I'm understanding you. That is how Jessica was treated, as a visitor or as the power of attorney?
It as a power of attorney, they were treating her as though she was just a visitor, and so they kicked her out at visiting hours when they ended at 7 p.m.
That's October 11th?
Correct.
And then let's go then, the next day is October 12th. Was at some point in time Jessica able to return the next day on October 12th?
She was.
Do you know what time?
I believe, again, she was not able to get in until 11 a.m.
Do you know why it was 11 a.m. that she couldn't get back to?
I think that there were some issues with the communication between the attorneys and the hospital again. They would not let her in earlier than
Do
that.
you know what time visiting hours started on October 12th?
I believe it was 11 a.m.
They let her in at visiting hours.
Correct.
Again, here's math. So the evening of October 11th at 7 p.m. to October 12th at 11 a.m., how long is that Grace is left alone again for the first time in her life?
It was 47 hours, so it was another six, my math isn't so good.
Just stop, we'll do this. October 11th at 7 p.m. when visiting hours ended and she was told she was a visitor, so had to leave, to October 12th at 11 a.m. when visiting hours began again and she could enter as a quote visitor.
Correct.
That's how many hours?
Okay, so I'm sorry, Joe.
Yep.
I'm sorry.
The night at 7 p.m. till the next day at 11 a.m.
Oh. For another 14 hours.
If I told you 16
Okay, thank
would be the correct mathematical answer.
like Grace, she didn't like math. That wasn't her strong sort. So strong class subjects.
So 47 hours in total.
It was 47 total that we had without advocacy for Grace.
So Jessica then is in the hospital with your daughter on October 12th.
Correct.
Do you remember some things about Jessica texting pictures back to you that day or sharing videos of some sort?
Yes, as soon as she was able to get in, she sent me a couple pictures of her and Grace and just letting me know that she got in and that Grace was doing fine and that she was there to advocate for her finally. Allowed to be in that advocate.
Did Jessica and Grace have some video call with her nephews?
They did. And Grace was so funny because she knew with the BiPAP mask, they couldn't hear very well. So she had to talk really loud over the BiPAP mask. And so she said, "Hi, boys." And then she waved with her FaceTime call with the boys that day.
What do you remember about oxygen levels on the morning of the 13th now? This is the day Grace died.
Correct. That morning, I learned that Grace's oxygen saturations were in the high 90s. Overnight.
And one second, is that good?
That's good. That's very good. You want it to be in the 90s, and I've even learned that, you know, even close to the 90s is still good when it's like the high 80s. But that morning, Grace's were up in the high 90s. Jessica had gotten, I had learned that Jessica had gotten Grace to be able to lay in her belly, and that was one way to increase your oxygen saturation, was to keep yourself laying on your belly. And so Jessica had encouraged Grace, and Grace did that, and overnight then her oxygen saturations were wonderful.
So when you say to overnight, to the morning of October 13th?
Correct.
Jessica was even able to lie in the bed there with her, cuddle in the bed with her?
It's kind of funny because overnight Jessica shared, I had learned that Grace was tooting. Overnight, Grace always said that boys fart and girls toot. And so she had been tooting, and she kept apologizing all night long to Jessica, her sister, said she was sorry that she was tooting. And so Jessica just, like I said, laid by Grace through the night, and that was one of the things that she shared had happened.
You mentioned the word proned, and explain to me this concept again.
So prone is when you lay on your belly, and that laying on your belly was a technique that was learned that would help increase the oxygen saturations. And so that's what Grace did. She laid prone that evening, and her oxygen saturations had gone up into the high 90s.
And Jessica was able to do this here in person, couldn't do that over an iPad.
Correct. Right. She was able to encourage her to do that.
So with the oxygen saturations high that morning of the 13th, Jessica wanted to take a shower. What did Jessica want to do?
Yes, she felt that she was going to be there with Grace the weekend because Grace was doing so well, and we had just a few more days that we thought was the plan, and so she thought she was going to go and take a shower. And Scott was able to take a shower in the room, so Jessica just told the nurse she was going to take a shower.
And what happened about Jessica trying to take a shower in the hospital?
I learned that all of a sudden, when Jessica wanted to take a shower, that the nurse told her, "You can't take a shower in the room."
Why?
Well, the thing that was explained to her was that she wouldn't be able to wear the PPE in the shower, which is the protective, the yellow gowns and everything that you would put on if you're trying to keep some germs out of something, but
So did she get a shower?
hospital, she had to go home that morning. Nurse McGinnis wouldn't let her take a shower in the room.
Where does Jessica live?
Town, so it was just maybe 10 minutes away from the hospital.
What did she do after she got her shower that you know?
Then she came back to the hospital.
And was able to enter again?
Correct.
Be with her sister?
Correct.
I want to ask you about some conversations with Dr. Gavin Shokar. Okay?
With Jessica and Dr. Shokar, you mean when she got back, or?
No, I want to ask you questions about conversations that you may have had with Dr. Shokar.
Okay.
Okay? October 12th in the afternoon, did you receive a call from Dr. Shokar?
We did.
Had you ever talked to Dr. Shokar before?
I had not.
Had you ever met Dr. Shokar before?
I had not.
This is a new name to you? The phone call comes in and...
Correct. The only other doctor I had received a call from was Dr. Baum, and he was the doctor that was now going on vacation and just said that a new doctor was coming on board, so.
Okay. First time you ever met him?
Correct.
And didn't even meet him, actually, it was just over the phone, he called you? What was Dr. Shokar asking you for in that call?
That call again was asking us for a pre-authorization to put Grace on a vent if something would have happened in the middle of the night, is how it was always presented to us.
You said on a vent, and I want to be sure the record is clear. What does that mean?
Being put on a ventilator means having
A ventilator.
Yeah, being put on the ventilator. Yeah, breathing machine.
He was asking you to put her on a ventilator at that moment?
He wasn't asking us to put her on it. He was just asking for another pre-authorization, which we had been approached several times.
So pre-authorization, what does that mean?
So that they had the kind of like our okay to do it whenever they felt it would be needed. And they always stated it as though it would happen, these things would happen in the middle of the night when we can't get a hold of the family.
Okay, but hold on.
Pre-authorization.
So he wasn't asking you to put her on a ventilator then and there. He was saying, sign this, give us this form and authorize us now to do something later if we need.
Objections overruled because it's been answered. But just try to avoid asking leading questions in direct examination.
Yes, Judge. What was your response to his request for the pre-authorization?
We said no.
We being who?
And I.
Okay.
Scott was home at this time.
Well, was somebody who from the family was there in the hospital?
Our daughter Jessica was still there at the hospital, and she was Grace's power of attorney, which, you know, she was the advocate for Grace and the power of attorney.
So you mentioned this before about the doctor told you that the need for a pre-authorization was to have, in case something happened while you couldn't reach family. Did I hear you right?
Correct.
Your family was there?
Yes, Jessica was our family. She was Grace's sister and Grace's power of attorney.
So is it part of your decision that you didn't need a pre-authorization? Because why?
Because she already had family there and somebody that could have been reached and asked that question if it would have been an issue.
What did Dr. Shokar tell you about placing Grace on a do not resuscitate order?
Nothing.
I mean, I'm going to actually take a step back from that and ask you this. What did Dr. Shokar tell you about Grace being in the ICU, the intensive care unit?
Nothing. We did not know.
You didn't know what?
Oh, that she was in an ICU.
What did Dr. Shokar tell you about Grace being on a medication called Precedex?
Nothing.
What did Dr. Shokar tell you about that medication, Precedex, possibly being a reason for Grace being in the ICU?
Nothing.
What did Dr. Shokar tell you about the possibility that Grace had been given too much Precedex a few days prior?
Nothing.
What did Dr. Shokar tell you about his turnover with the prior doctor and what that doctor passed on to him about Grace as her attending physician?
Nothing.
Well, you said that Dr. Shokar didn't say anything to you about a DNR order? Who else? I'm sorry, you said that or didn't say that?
He did not say anything about a DNR.
Who else from the hospital told you that Dr. Shokar had designated Grace as a do not resuscitate?
The time that we heard it was when the nurses yelled out to us when Grace was dying.
That's the next day.
Correct.
So up until that point in time, no one?
Knowledge of a DNR. None.
Would you and your husband, would your family place your daughter on a do not resuscitate order?
We would not.
Well, under what circumstances would your decision of that importance?
Vague, overly broad, overruled.
I would think if there was some situation, like if she,
I'm sorry, hold on. I don't know if Judge, am I hearing this differently than you are? Because some of her words I just don't hear. Is that the microphone issue?
Different, but it's doing good. I think with these microphones, it's just kind of stay when it's working. I don't know if it's being close, but you start turning and looking at the jurors, it's going to not catch you because you're speaking on the side of your mouth then.
I'm going to ask her the question so we can get the full. What I'm asking you is about the circumstances under which your family would make the decision to place your daughter on a DNR. Who would be involved in that kind of a decision?
well, if we ever did something like that, we would have family, attorney. I would imagine that we would also have a pastor, and, doctor or something if there was a situation of that sort. So if somebody, had that kind of a situation where you would think that would deem that possible, like if somebody was maybe a vegetable or something, but it's not something we would ever have thought of on Grace, because she was just such a gift, and was not even something that we had thought about.
You told me this. You had never met Dr. Shokar before.
Never met him, just via the phone.
And he's asking you about, supposedly, do not resuscitate order. You never met him?
He never talked to us about it, do not resuscitate.
So when I was asking you what was a broad question, admittedly, because I want to hear your answer, is that the circumstance under which you would place your daughter under a do not resuscitate order on a phone call with someone you've never met?
I would hope not. I would hope that you would be, it would be more personable. The person would be there talking to you, and you'd have the right team around you to make such a decision.
And what team did you have around you in terms of pastor, primary care doctor, lawyer, anybody?
Yeah, we weren't around anybody, and that would even remotely give that inclination in our mind.
And you're saying that he didn't ask you about a do not resuscitate order?
Not.
And if he had, you would bring those other people in?
Right, they would definitely have been consulted or around us. I wouldn't do it over the phone. I wouldn't be telling somebody that they can put a DNR on my daughter in that way.
How much time do you think you would need to make the decision to place your daughter, your 19-year-old daughter on a do not resuscitate order?
Put a time on that.
Quickly or a long time?
It would be a long time. It would be a terrible thing to or have to decide.
Do you recognize the gentleman right next to me?
Yes,
Who's that?
my husband and Grace's dad.
You know your husband better than anybody on the face of the earth. At what point in his life would he decide to designate your 19-year-old daughter as a do not resuscitate?
Never. I don't think he would ever.
Same type of team would be involved, do you think?
If that was the situation, yes, it would be something we could make lightly. Seeking other people to help with that.
That was a call with Dr. Shokar the afternoon of October 12th, the day before your daughter died.
Correct.
First time you ever heard the name Dr. Shokar in your life.
Correct.
The next morning, did you get another call?
We did.
From who?
Dr. Shokar once again.
What did Dr. Shokar tell you about Grace's condition at that time?
The morning of the 13th, he told us that Grace had such a good day that he'd like to get her up out of bed. He'd like to get her some nutrition so we can get her out of there in a couple days, 2 or 3 days.
Did he talk to you in terms of feeding her? You said he wanted to feed her. What did he tell you about feeding her?
Correct. He said he wanted to get some nutrition and that he would like to do a feeding tube, an NG tube, to get Grace that nutrition.
Would you tell Dr. Shokar about the feeding tube?
Seth and I had decided this, that we'd like to get her some nutrition, and so we approved the feeding tube. And I remember asking him, would be doing the procedure, would he be doing it? Because I knew with Grace's nasal passages being narrow, that I wanted somebody that really knew what they were doing.
Did Dr. Shokar discuss some other procedures or objects that day with you?
After this talk about the nurse doing the feeding tube, he just led into kind of an odd conversation then that if Grace takes a turn for the worse and her heart stops and we can't get it started again, would you want us to keep working on her? And my husband and I were both caught off guard.
Why were you caught off guard?
Like he just said how good of a day she had, and she'd like to get her, get some nutrition and get her out of bed. And so we were like, where is this coming from? It was just so out of character and it just didn't make sense.
Didn't make sense to you what he was saying?
No, it was like, well, where is this coming from? And I believe my husband actually had stated something like that. Where is this coming from? He just said she's doing great and you want to get her up and out of bed and you want to get her feeding tube to start nutrition. So he also said he wanted to get the bowels moving. So that was another reason why the feeding tube. Then, think about her tooting in the bed. So I'm like, okay, her bowels were moving. And so this was going to help just facilitate all that.
What did Dr. Shokar mention to you again about a pre-authorization for a ventilator?
He again asked us if we would pre-authorize a ventilator for Grace. And both my husband and I said, no, we would not.
Same answers you would have given me before, my question?
Correct, right.
Who was there with Grace?
Jessica was there.
Needing this in the middle of the night immediately, because no family was there.
Right, and there was family there, so there was no need for a pre-authorization.
Did he ask you to put her on a ventilator at that point in time?
No, he did not.
Was there any point in time which he asked you to put her on a ventilator?
No, he did not.
He asked you about the pre-authorization for one, and you didn't believe it was necessary to do that, given your daughter being there.
Correct. She, like I said, her oxygen saturations were in the high 90s. He's talking about getting her nutrition, talking about getting her out of bed. And so that wasn't even anything that we were even considering at all, that was a need, and he didn't mention that.
What did Dr. Shokar tell you in this phone call about placing Grace on a do not resuscitate order?
Nothing.
What did Dr. Shokar tell you in this phone call about Grace being in the intensive care unit?
Nothing. And her room, she never changed rooms. She was just in a typical room. So the knowledge of an ICU was like, what are you talking about? But he never told us anything. So we learned this much later.
So when you say what you're talking about me, not Dr. Shokar. Okay.
Correct.
What did Dr. Shokar tell you in this next phone call on October 13th, the day she died? What did he tell you about her being on prosthetics?
Nothing.
What did he tell you about the prosthetics possibly being a reason why she was in the ICU?
Nothing.
What did Dr. Shokar tell you about the possibility she had been given too much prosthetics?
Nothing.
What did Dr. Shokar tell you about Grace wanting to get out of bed and go to the bathroom?
Nothing.
What did Dr. Shokar tell you about Grace being put in restraints because she wanted to go to the bathroom?
Nothing. I learned that when Jessica returned from her shower, she was getting her PPE on in the hall, and she overheard Dr. Shokar and and Nurse McGinnis saying that the family's not going to like this. And I learned that Jessica's question, what is the family not going to like? And then it was explained to her that Grace got put in restraint.
But what I'm asking you about is this call Dr. Shokar had with you. Did he tell you anything about what, if anything, about Grace being put in restraints?
No, we had nothing. No, nothing about it.
I'm going to ask you about the next video call that you got again on October 13th, then, the day she died.
Okay.
What did you learn about Grace's condition at that time?
I believe this is the time when Jessica calls us with FaceTime. She's telling us that the nurses will not come in to help Grace. That Grace is...
Time out, one thing at a time. It was Jessica, your daughter, calling you?
Correct.
Is that what you said?
Correct.
What was Jessica telling you about Grace's numbers?
Her numbers were tanking on the monitor. They were dropping.
Okay, and what did she tell you next?
Next, she told us that she's trying to get the nurses in there, because we said, well, get the nurses in there. And she said, I've been trying, and no one will come in.
Who could you see during this video call on October 13th?
First, we saw Grace in the monitor, and then as Jessica carried the phone over to the hallway, we could see there were nurses in the hallway.
What did you do in response you were seeing on this video call on October 13th?
And asked, along with Jessica, to please come and help.
Who did you ask?
We just, I'm trying to think at this time when Jessica went into the hallway, I think it was after Grace's numbers dropped totally, and then we were just yelling to come and help our daughter, because nobody was helping her.
To who to come and help?
To whoever was there in the hallway, and
just saying, please come and help our daughter, save our daughter, because the numbers were tanking.
Did you see
Jessica
people?
and Jessica had tried to get somebody in there, nobody's coming, so we're yelling now, please come and help our daughter.
Was your husband on this call also?
He was, correct. We were at home.
So when you're saying we, this is what I'm trying to get.
Correct. My husband and I are at home on the FaceTime call, and our daughter Jessica is at the hospital with her phone FaceTiming us.
Well, what then did the hospital staff do in response to what you asked?
As I stated, nobody was coming in, and all of a sudden Grace's numbers totally dropped, and she's bottoming out, and we're just yelling, please come and save our daughter. And then they yell back to us that she's DNR.
She's what?
Not resuscitate, DNR. And we're saying she's not DNR, come and save our daughter. Help give Grace whatever, to reverse whatever you did, because we had known they gave her morphine. But nobody came in to help Grace at all.
1 second. Is this when you referred to earlier being the first time you heard that your daughter was designated do not resuscitate?
Correct.
On the video call in front of you as she died?
Correct.
And your response to being told she was do not resuscitate was what?
She's not, do not resuscitate, please save our daughter. And I even asked, I said, are you not saving her because she has Down syndrome?
At some point in time, somebody called it?
Yeah, there's a nurse in the room, and a head nurse. This nurse, I remember her name was Nurse Joe, and then the head nurse told her to call it. And so then at 7:27, Grace was called that she was dead, and then one of the nurses yelled out that she's with Jesus now.
So called it means what?
Pronounced her death.
You were on the video call watching this?
Correct.
Do you know how many times you would have responded and said, say?
It was several times. It was like a 9-minute window that we had when we were talking to Jessica, trying to get somebody in there.
Do you know how many times you said, no, she is not DNR? She is not do not resuscitate?
I think we recited it several times between my husband and Jessica and myself. We just kept telling she's not DNR, she's not DNR, please help our daughter. And nobody stepped foot in the room. And I learned that there was so many nurses out in the hallway because there was shift change. And yet nobody came in. So there was plenty of staff that could have came in to help her, but nobody came in.
This is the second floor of the hospital?
Correct.
The room is on the first floor?
Now, as I look back, I think I wish I would have called 911. Maybe they would have came to help her. But that was, in hindsight, you're in a hospital, so you think that they're going to come and help her. But nobody did. And as we've learned that there's the reversal drug, but our care that could have helped Grace with what they gave her.
I'm just gonna ask you, just take a breath and catch your breath, because I have more questions for you, okay? Is there a box of tissues for her? So I should know better than to ask whether you're ready, because no one's ready for this, but we're gonna go, okay?
Yes.
What did you do when you found out that Grace died?
I just fell to my knees. I just cried. It was like so surreal because she was just alive that morning. She was doing great. And it's just like, what happened?
Where did you go next?
And my husband drove me to the emergency room. And that's when I met our pastor. But not the emergency room, but the emergency room entrance so we could get up to Grace's floor. And claim her body so that we could take
You
it to
had
the,
signs of COVID at this time?
excuse me?
You had some signs of COVID at this time?
I still did, yes. But I was totally permitted to walk through the doors of the hospital without a problem. Nobody questioned me whatsoever.
Could you walk under your own power?
I was pretty well in shock, and so we got a wheelchair right away upon entrance. And then our pastor pushed me through the hallway to get to the room that Grace was in, room 2029.
You went into the room?
I did.
What did you see?
And so Jessica in the room, laying with her sister, just holding her. She still had the BiPAP mask on because Jessica was hoping somehow Grace was still breathing. When I saw her, though, I knew she was gone. Her body was already yellowy. And then I took the mask off, and Grace's mouth was wide open, like she was just waiting for air.
What did her face look like besides her mouth?
Like I said, her mouth was wide open, and she was yellow, and it was just lifeless. A girl that just had so much love and life to give was no longer there.
Was her face clean?
No, when I took her BiPAP mask off, she was so bloody by her nose.
I'm sorry.
She was so bloody by her nose. Her nose and her face were all full of blood. It's like, what happened? And then I realized it was all from the NG tube.
I'm sorry. You can take it just 20 seconds if you could to catch your breath, because it's hard to understand what you're saying, and that's okay.
When I took the BiPAP mask off,
Mrs. Schara, just please give me 10 seconds. Go ahead.
when I took the BiPAP mask off, you could see Grace's body was yellow, but then her whole face was all bloody around her nose and everything.
And her nose, do you know why?
I believe it was because of the NG tube that was put in. And I remember, as I stated earlier, that I told Dr. Shoker that I was concerned who was going to be doing the NG tube, the feeding tube, because of Grace's narrow nasal passages. And so it looked like whoever did the feeding tube didn't even clean Grace up. She was just her face was all bloody, so I grabbed a wet tissue and wiped her face off a bit, because it was just hard to see her like that.
Were she still connected with some IVs?
Yeah, she's still in a couple IVs, and I believe I asked to take him out. He was a paramedic, and I told him I don't want to see her with all those things in her arms and stuff anymore. So he'd remove them.
Did some hospital staff come in to clean her up then?
Yes, and then 2 nurses came in, one to mainly gather her belongings, and then another one came in just to clean up Grace. And then I believe there was another nurse that came in to help put Grace in a body bag. The 2 nurses lifted her into the body bag.
Time out. They're in the hospital room while you're there?
Correct. Correct. So we had a little bit of time with Grace's body, but it wasn't very long. And then the one nurse came in and got her wiped up a little bit. And then the next day I knew there was another nurse that came in. I don't remember, but it was the same nurse that helped put the belongings in the cart or not, but it was the 2 of them had to lift Grace's body into the body bag or manipulate the body bag so they could get her in.
Did something happen with her toes at the time?
They had to put a toe tag on Grace's body as well.
This is all while you were there in the hospital?
Correct.
In the hospital room?
In the room. And then the girl that was putting her in the body bag, the other one just mainly left after she helped lift her in the body bag. She started to tie up the body bag like it was a present. She made a pretty little bow on it. I tied it shut, and I thought to myself, why are you being so particular now about putting her in this body bag and tying this bow on it when you wouldn't even take good care of her? And so that I just wanted to see her one more time. They asked if I would undo it for me. I could see Grace.
Let's slow down again, because I'm not sure I hear you correctly, your words. You told us about the body bag and it was wrapped up.
Correct.
Then you said something else. What did you say?
I wanted to see Grace's body one more time. Once they closed up the body bag and they tied it shut, I just wanted to see her one more time.
Okay. Did you ask?
I did ask. I said, can you just let me have look at her one more time?
What happened?
The nurse said no. She could not open it back up.
Is there an undertaker that came?
Yes, there was an undertaker that came.
How much time did the undertaker spend there with you?
He was there at least an hour with us.
From when you got in the room until when you went home later that night, about how much time passed?
It was several hours. Probably got in there at the hospital by 8 o'clock, and we didn't get home till after, I think it was 12:30.
So all told, you're in that room with your dead daughter in a body bag for how long?
At least 4 hours, I would say.
Okay, so long time.
Correct.
Too long.
Correct. Especially in the place that just took your daughter's life. I mean, it just was not a place you want to spend with your daughter.
All right, well, then Dr. Shokar's interaction with you, I want to ask you about that. What did Dr. Shokar do when he came in the room to see you after she died?
We didn't see Dr. Shokar.
Did Dr. You're telling me you didn't see him at all?
Correct. Did not see him.
Did he have anything to say to you? What did Dr. Shokar have to say to you after she died?
Nothing was said to us.
What kind of words of condolences did Dr. Shokar have for you after your daughter died?
There was nothing. No one actually said anything to us.
Holly McGinnis, Nurse McGinnis?
She didn't say anything.
Let me ask the question, okay? What did Holly McGinnis say to you after your daughter died?
Nothing.
What Says, did Nurse Holly McGinnis have to offer you there in the room that you were in for 4 hours after your daughter died?
Nothing. Or to be seen.
Do you know where they were? When I say they, Dr. Shope, do you know where Dr. Shopar was?
I learned that they were no longer at the hospital.
They didn't.
Yes, we were.
Did, by a nurse?
She was a nurse.
She wearing a uniform?
So they all had their PPE on, so, but I believe she was a nurse, or maybe some other level. She was a nurse.
Well, there were no visitors allowed in the hospital at this time, so it was either hospital staff or patient.
Correct. Yep, correct. I believe she was a nurse because she was the same one that came in and helped put the items on the cart that were in Grace's room, because Grace had been given a lot of cool gifts, so she had crafts to do while she was in the hospital. She loved to color, and she had an Elvis coloring book somebody gave her, and she had a couple of the felt pictures. One was a huge butterfly, and she had balloons and some flowers, and so she had been showered with gifts, and so the nurse came in to put those on a cart, and this was the same person then that took us down.
Do you remember anything about that as you walked out with this nurse?
I do. I remember she stopped at a desk on the way out and gave him a manila envelope. She escorted us the rest of the way down with the undertaker down to the lower level first to have the undertaker put Grace's body in the hearse. And then she continued to take us up out the emergency room exit.
Did she say anything to you that hit you at the time?
Was.
Overruled.
She helped us outside the emergency room doors, and we were loading up the items that were on the cart. She leaned down by me and she said to me, she said, "Mrs. Schara, several other nurses don't believe Grace should have died tonight." And when she said that, I knew something happened, because how could Grace have been done by that evening?
I want to interject. I didn't know what the answer was going to be. But I'm going to, for the jurors, so there is an objection on hearsay. Hearsay is a complicated rule, but you start with the premise of in a court, you don't allow in a statement that was made by somebody outside of court, by a different person in court. But there are some exceptions and exemptions to that rule. And when that objection was made, I overruled it because I thought to myself, that statement I'm going to allow the impact that it had on Ms. Schara. And that's one of the exceptions, that it can be offered to show the impact on whoever heard it. And after listening to the answer, and I think the answer is something to the effect of, me and other nurses did not think that Grace should have died. I want the jurors to not take that as a true statement, or it's the truth of the statement, because that would be hearsay. But take it to the sense of whatever impact that might have on Ms. Schara. And don't believe that that statement is true or untrue. It's not being offered for the truth of the matter asserted. Any issues with that, Mr. Crickolian? Were you the one who objected?
I was the one who objected, Your Honor.
Okay, so I don't know if you want to, any issues with that, or you want to wait till the next sidebar or the next opportunity?
No, at this time, Your Honor, that's fine. We can address it afterwards.
Anything else, Attorney Boylan, on that issue?
I believe it is a admission of a party opponent or the representative of a party opponent, so it isn't hearsay to begin with, and also it's a present sense impression, so we could deal with that at the sidebar, but I'm happy with Your Honor's explanation to the jury, the truth or untruthfulness of that is not what is important at this time.
Yeah, not only is it not important, I don't want them at any stage to take that as the truth of that statement. I'm okay with you hearing it and whatever impact that has, but it's not being offered, it shouldn't be heard to be for the truth of the matter. I will say that again to you at the end of the trial, but there are times, because this trial is so long, that when I hear an objection, I have no idea what the answer was going to be. Nobody's ever brought that to my attention. So I ruled it the way I thought was the right answer, and then after I heard the answer, I thought, well, I'm only partial. I just thought I'd correct it for you guys right away. While I'm talking, we're going to get something out of the air because there's been like 3 or 4 objections on leading. And so it's improper for a party to ask leading questions of their own witness. A leading question is something where you're kind of steering them or leading them to a certain answer. I usually allow it because of a couple of things. Number one, it just saves time. It gets the attorney to get a witness who may be emotional or having a hard time. You just focus in on something. And number two, you guys are all really smart, and you're able to see if the attorney is leading them into an answer that the attorney is trying to get them to say. And if that's the case, you say, well, I'm not going to give a lot of merit to the answer because it's like leading. He's trying to force her to say something. So for the most part, throughout the rest of the trial, just so everybody knows, I'm probably going to overrule those unless I think it's really unfair, and that'll happen both ways because I think this jury is smart enough to understand it, but you can still make your objections on it. Okay, Mr. Boylan.
And Judge, I want to be sure I understand your ruling correctly on the hearsay in terms of the admission of a party opponent, but the larger principle that you are.
Well, I'm not sure this is a party opponent. I didn't want to argue with you.
We'll do that. We'll do that.
Person hasn't been identified.
Yeah, yes, I understand, Judge. So that will be later, but the court's admonition to the jury about truthfulness is not that it is untrue. It is not that it is true. It is neither one. The jury cannot take that for its truthfulness or untruthfulness. Is that what I'm understanding?
You got your hand up.
Yeah, this is a completely inappropriate,
Yes.
in my opinion, appropriate conversation to be having in front of the jury.
I agree. So right now, what I'm telling the jury, and I tried to do it right off the bat, but I'm just going to repeat it. That comment about me and other nurses did not think that Grace should have died. That, no truth or untruth. As far as I know, I have no idea who said it. And essentially it's hearsay. But I'm going to allow it in to let you consider whatever impact that would have on the mom of Grace. And that's it. It's not somebody admitting anything, because I have no idea who that someone is, and it hasn't been established. And if that changes throughout the trial, then we'll do it that way. And I don't want there to be a suggestion that, because I think that's just unfair. Okay.
Fair enough, thank you.
Can I interject something?
No, I'll have the next question for you, which is I want you to tell us about life after Grace's death.
Somebody have to go to the bathroom? Okay, just don't, if you want to bring it over, keep going, Mr. Boylan.
So the same question is there. I would like to ask you about, tell us about life after Grace's death.
I guess the best way to describe life without Grace is if you can imagine not having one of your children around. The noise in the house or the activities that you would go and do with them are no longer. You go out to eat and you have one less person to sit at the table with you. You realize that your weekends are empty because the one that you lived your life for is no longer there. life goes on for at most everybody else, but your life kind of stops and yours is at a standstill. And yet you trust that there is a reason for the things that you're going through, but at the same time, you find that there's a true emptiness in your life because of the joy that, in our case, that Grace brought to us, and the excitement, the holidays, the events that we would take part in, watching her perform or act and be in recitals or play a violin. They're no longer part of our life, and so it's impacted our life tremendously. It's very empty. Life is very empty. But we hold on to God's promise that we'll get to see her again, because she knew her Lord and Savior.
Mrs. Schara, those are all the questions that I have for you.
Okay. So cross-examination, are you going first, Mr. Franco, yet?
I would, Your Honor. Before I begin my cross-examination, might I request a sidebar with Your Honor? Thank you.
All right, so we're going to just start the cross-examination, but one of you handed me a note that said, please tell the judge to turn on his microphone. So I try to keep it away when I'm not speaking, but I'll remember that when I'm speaking to do that. And so I hate to have to repeat this again, but I'm going to. Because one of you didn't hear it, and I told the attorneys that I was going to do this. During the direct examination of this witness, there was a question asked of her about what some unidentified person allegedly told her as she was exiting the hospital. My understanding is that person has never been identified. They don't know who it is. And that causes concerns on credibility because the other side can't cross-examine that person. So the objection was hearsay. I overruled the objection. And then when I listened to the answer, I figured I need to tell the jurors how to take that statement. So the admission of the statement about this individual told me that this and other nurses did not think that Grace should have died, or something to that effect, cannot be considered by you for the truth of that statement or the fact that it was ever made by anyone. What I'm allowing you to consider it for is if you believe Ms. Schara that that statement was made to her, then the only impact of it is what impact would that have on a mom of Grace? The effect on the listener, which is an exception to the hearsay rules. So I don't want you to think that that statement's true or untrue and not put any truth into it and not consider it really for any other reason than the impact on Ms. Schara. I think I addressed in the second issue during our sidebar, but we'll make a record of that at the next time the jury breaks. Okay. Are you going to do cross-examination first, Mr. Franco? Yeah.
Yes, Your Honor.
All right, go ahead.
Thank you. Good afternoon, Mrs. Schara. Can you hear me okay?
Yes.
Okay, thank you. If at any time you cannot hear me, please let me know, okay? Mrs. Schara, you have never reviewed Grace's medical records, true?
True.
Okay. You've never attended nursing school or medical school, true?
True.
It would be fair to state that you do not have any medical training?
What of medical training are you referring to?
Okay. Formal medical training or medical education in a medical school. Okay. You have no certifications in any medical field.
CPR, if that qualifies.
No certifications in the medical field. Employed in the home?
Correct.
You have not been employed outside the home since 1987, shortly after you became married to Mr. Schara, true?
It's around the date. I believe that's about around that time. I believe that's about around that time.
Okay, sure. You do not have any certifications in the field of pharmacology, would that be correct?
No.
You have never practiced as a pharmacist or worked in a pharmacy, true?
That.
You have never personally administered medications, including Precedex, lorazepam, or morphine to another person, true?
Correct.
Okay, thank you. You've never been trained to administer medications like Precedex, lorazepam, and morphine to another person, true? Okay. As I understand your testimony, ma'am, for the first 19 years of her life, Grace received regular medical care through St. Elizabeth Hospital, true?
Correct.
Okay. And I think you testified that her primary care provider was a doctor by the name of Mary Nordstrom.
Yes.
And Dr. Nordstrom is associated with St. Elizabeth Hospital.
True.
You got along well with Dr. Nordstrom?
Very well.
And you believe that Dr. Nordstrom had the best interests of your daughter in mind at all times?
Yes, true.
Okay. And you were happy with the care provided by Grace or to Grace by St. Elizabeth and Dr. Nordstrom up through October of 2021, true?
True.
We'll talk a little bit about October of 2021. I understand that Grace was admitted to St. Elizabeth Hospital on or about the early morning hours of October 7th, true?
Could you repeat that?
Sure, I understand Grace was admitted to the hospital, St. Elizabeth, during the early morning hours or late evening of October 6th?
Yes, that's
Okay.
true.
And as I understand it, you and your husband Scott made the decision to admit Grace to the hospital?
Yes.
Okay. Grace had gone with you and your husband to a public concert in Oshkosh on September 25th of 2021, true?
Yes.
And the Delta variant of the COVID-19 virus was going around at that time, true?
I don't know.
Okay. On or about September 28th of 2021, Grace began to show some symptoms of illness, true?
Could you repeat that?
On or about September 28th of 2021, Grace began to show some symptoms of illness?
Not illness, just allergies.
Okay. You did not contact any healthcare providers for Grace at any time between September 28th and October 6th, true?
Repeat that.
Sure. You did not contact any healthcare providers for Grace at any time between September 28th and October 6th, true?
I believe that's true.
Your husband did his own independent research into how to prepare for COVID prior to October of 2021, true?
No,
Okay. Do you recall giving a deposition, ma'am, on May 14th of 2024?
I'm not quite sure on the date, but I did give a deposition, yes.
Did you understand that you were under oath when you gave that deposition?
Yes.
Okay, thank you. Your Honor, may I approach the witness?
May I ask to see what's being shown? Oh, if it's going to be a particular page or the entire deposition?
Feel free to open that. Feel free to reference that if we need to as we go along.
If you could open that package, please, and if we could refer to page 66. Let me know when you arrive at page 66.
I'm there.
Ma'am,
Judge, before the next question is asked, I may interpose an objection about impeachment at this point in time.
The objection.
He hasn't identified any inconsistent statement she's made before that he wants to ask her about. I don't know what it is, that there's anything that she's testified to previously to have her looking back at a deposition transcript at this point.
I take it that's what you're going to do right now?
Yes, the pending question is your husband did his own independent research.
Let me just so I'm going to overrule the objection.
Okay, thank you. Ma'am, please reference, I'm going to start reading on line 6 on page 66, okay? There's a question that I asked you at your deposition, and it goes as follows. Are you familiar with the Frontline COVID Critical Care Alliance? Your answer was, did I read that correctly?
Page 66, I'm sorry, I don't see where you're at.
That is correct on line 6, ma'am.
Okay, I see what it's referenced now. Okay, go ahead.
Okay, my question to you at that time in your deposition was, are you familiar with the Frontline COVID Critical Care Alliance? Your answer was correct.
Correct.
Okay. I asked you, how are you familiar with them? And your answer was as follows. It was just something that we had been made aware of during COVID, and that there was recommendations that they were giving to help people get through COVID so that you did not. And then the question I followed up with, you said you had become aware. Who made you aware of them, or how did you become aware of them? Did I read that correctly?
Correct.
Your answer to that question was, I think we just did a lot of research. My question following that was, did you do any research? Your response was, no, my husband had looked into how to prepare for COVID if people got it. Did I read that correctly?
Correct, that's.
Okay. Thank you, ma'am.
Your question before stated it differently.
Well, please feel free to keep that transcript for reference as we go along. We may reference it again. Through this research, I understand your husband became aware of a group known as the Frontline COVID Critical. True?
Correct.
And you treated Grace at home with the frontline doctor?
Oh, yeah, if there's an objection, let's just slow down.
Is my microphone here? This is my objection because his questions to her before were nothing about this Frontline COVID Critical compliance.
But we're not gonna argue in front of the jury, so you state your objection.
My objection is that he has not presented her with testimony that's contradictory to anything she said today in court.
Immediately prior to it was, when did your husband do the research, like before this October of 2021? And her answer was no. And it seems like the transcript on page 66 was just read, that it sounds like she and/or Mr. Schara or Mr. Schara alone had done research about COVID prior to October of 2021. Is that what you were getting at, Mr. Frankowiak?
That is correct, Your Honor.
That's how I understood the impeachment, and I think that was proper impeachment.
The part about the frontline critical COVID care lines,
I
so
think that's going to be a second issue that he's getting to. So the objection's overruled. Go ahead.
Ma'am, you treated Grace at home with the frontline doctor's treatment protocols until October 6th of 2021 when your husband took her to urgent care, true?
True.
Okay. The frontline doctors recommended going to the hospital if an individual's oxygen saturation fell below 94%, true?
Say that again, please.
The frontline doctors recommended going to the hospital if an individual's oxygen saturation fell below 94%, true?
I believe that is what their recommendations.
6th of 2021, Grace's oxygen saturations were falling in the range of 87 to 91%, true?
True.
You were concerned about Grace's oxygen saturations on October 6th, true? True. You and your husband first took Grace to urgent care on October.
No,
Okay. You did not take Grace?
that wasn't first.
Okay. You and your husband took Grace to urgent care on October 6th?
But that wasn't first. First, we called Dr. Mary Nordstrom's office.
Ma'am, the question is just to confirm whether you took.
But you had asked what I first did was take her to urgent care, and that is not what we first did.
Ma'am, you've also testified that your husband accompanied Grace into the office at urgent care while you stayed in the car, true?
Could you repeat that, please?
You also testified that your husband accompanied Grace into the office at urgent care and you stayed in the car, true?
True.
You did so because you were feeling ill, having recently tested positive for COVID-19 yourself, true?
True.
You were in fact ill with COVID symptoms for the entire time that Grace was in the hospital in October of 2021, true?
No, they weren't all COVID symptoms. Like I said, they were mainly allergy symptoms.
Okay. Ma'am, if you could look at your deposition transcript at page 59, please. Let me know when you're there.
I'm there.
On page 59 of your deposition transcript, starting at line 2, do you see that? There's a question, correct?
Correct.
The question is, okay, were you still experiencing the same symptoms that you had on October 6th, on October 13th? Answer, yes, I was quite sick yet. Did I read that correctly? The next question is as follows. Okay, so would it be fair to state that the entire time that Grace was in the hospital in St. Elizabeth, you were fairly sick with COVID? Your answer was correct. Did I read that correctly?
Yes, you did at that time. At that time,
Thank you,
what
ma'am.
had said was what I was referring to, but I just really had the regular symptoms, like allergy symptoms. It wasn't like what people were saying COVID was.
Thank you, ma'am. You gave your deposition, you testified under oath, and you understood you were under oath, true?
True.
And you understand you are under oath today as well, true?
True, but what I had said there is
Urgent
different
care.
than what I've learned now, so.
Ma'am, in urgent care, it was recommended that Grace go to the emergency department to get a chest x-ray, true?
What line are you on?
Reading a line, that's just a
Oh,
question.
I thought you just had asked me to read something out of the transcripts.
I'll pose the question again. In urgent care, it was recommended that Grace go to the emergency department to get a chest x-ray, true?
That's what I thought, it was the chest x-ray.
Okay. Grace and your husband Scott went by ambulance from urgent care to the emergency department and you then followed in your car, true?
Could you repeat that one more time? Sorry.
Yes, Grace and your husband Scott went by ambulance from urgent care to the emergency department and you followed in your car.
Correct.
Okay. You again stayed in your car while Grace was in the emergency department at St. Elizabeth, but you were in contact with your husband by telephone, true?
Correct.
You and your husband made the joint decision to admit Grace to the hospital from the ER, true?
Correct.
You then drove home from the ER on October 6th and your husband stayed with Grace in the hospital, true?
Correct.
You understood on that date, October 6th, that you would not be able to stay with Grace in the hospital because you were still ill with COVID symptoms, true?
Say that one more time, please.
You believe that you would not be able to stay with Grace in the hospital as of October 6th because you were still ill with COVID symptoms, true?
That's what I said in the
Okay.
transcript.
You understood as of that date, October 6th, when you took Grace to the ER, that the hospital.
Coughing, I had, like I said, incontinence, so I imagine that they would have said that I couldn't enter.
Okay. You understood that as of October 6th, if you were symptomatic with COVID, a medical facility like St. Elizabeth Hospital would not allow you or be able to allow you onto the facility's grounds, true?
Please, repeat that, please.
Yes. You understood as of October 6th, 2021, that if you were symptomatic with COVID, a medical facility like St. Elizabeth Hospital would not be able to let you onto the premises, true? Okay. In fact, October 6th of 2021, you knew without being told that anyone who was expressing outward signs of COVID symptoms would not be permitted into the hospital, true?
Could you repeat that one more time?
Are you not hearing him?
Yeah,
Because it's going to
kind
take
of like an echo. Yeah, I'm sorry. I'm trying to adjust it here.
It's not your microphone, but I'm able to hear you.
You can
I can hear you fine, so.
Okay.
Yeah, so keep going.
Okay. In fact, as of October 6th of 2021, you knew without being told that anyone who was expressing outward signs of COVID symptoms would not be permitted into the hospital, true?
True.
Okay. Because you were ill with symptoms of COVID at all times between October 6th and October 13th of 2021, you were never personally present in the hospital at any time prior to October 13th, true?
True.
I want to talk a little bit about the events of October 10th of 2021.
Is this a good time to stop and take a break? We're at that break time for the.
This is a good time to do that.
Okay. Sorry to interrupt.
Sure.
So at this time, members of the jury, we're going to give you an afternoon break. You're probably going to get another one in a little while too. Just a reminder not to discuss this case with anyone, including each other. Take your notebooks with you back to the jury room. And then just bring them back when you come in, and it'll be, that 15-minute time frame. And when you get back to the jury room, let the bailiffs know how much time you need, and then they're going to let me know right away. And hopefully 15 minutes will be enough time. But if you need more, just let us know so I can let the parties know. Jurors are excused. Make sure you didn't step down. All right, you may be seated. I know we're going to get to that sidebar, which minutes, so I want to do a couple things first. The deposition transcript, has that been marked as an exhibit? And should it be?
I'm sorry?
The deposition transcript that she's been referencing, don't we usually mark those as an exhibit or not?
I would say no, Joe. Judge, it's only used for purposes of impeachment, and on that I would later ask to be heard, but not an exhibit, I would say.
And you don't want it as an exhibit either?
No, I would mark it as an exhibit, Your Honor.
Okay, so what's the next number that have you already identified it as an exhibit?
I have to look at my most recent, I think the one that was recently filed, it may not be on that one or not, whatever the
Are
most.
you in the 200s or the 300s? Okay, so has it been marked or not? I don't want to waste a lot of time on it, but I think we should get a sticker on it.
What was the last number? It was like 400 something? 413 was the last number.
Okay, so we'll mark that as exhibit 414.
Not correct?
Mistrial. I go, well, why didn't you bring it to my attention then before it happened right here in the middle of trial? I had no idea what any of you were talking about.
But Your Honor, and it was not known that they were going to bring it up and put it in, which was the purpose of my objection.
You made a lot of motions in limiting on stuff that they may or may not have brought up that would be beneficial to your case. Why didn't you do that in this situation?
For the same reason, Your Honor, because I did not know until she identified.
Let me just stop you for a second. There's the same reason you brought up a lot of motions in limine. I decided a lot of motions on things that the plaintiff may or may not do that you were aware of.
Correct.
So you were aware of testimony. You knew they might try to get it in. Why would you wait until the middle of direct examination to object? Or why not make me aware of it a month ago or 2 weeks ago or this morning?
No, you're right, Honor. It was not a motion in limine that was brought. There were other, I believe, issues that were dealt with, but not.
I think I had 108 motions. I'm trying to figure out why you wouldn't have done that. It seems like you're putting me in a tough spot. Like, you knew about it. You didn't do anything about it. It gets brought up in the middle of trial. I decided after it comes in, I go, geez, this is different than what I thought. So then I try to correct it in front of the jury, and then you're making a motion for mistrial. I'm saying, well, why didn't you do your job and let me know ahead of time?
Knowledge that you have given an instruction to the jury, a curative instruction, and that is acknowledged.
Understood. I'm trying to dig into why you didn't do that, and then what else haven't you done that's going to be brought up in the middle of this?
Nothing at all, Your Honor. That would be the only statement that was brought up here, Your Honor.
Okay, so there's no other motions in limiting that you think should have been made that haven't been made, that you're waiting for them to bring it up in the middle of trial?
Your Honor.
Okay. All right. Mr. Guzzi, you raised your hand. Okay, Mr. Fleiter, I think you raised your hand.
Your Honor, I withdraw.
Okay, so anybody, Mr. Boylan, it's your witness, so I'm going to deny the motion for mistrial. Not exactly sure what to make out of all of it. It seems like an odd thing that we wouldn't have, out of all the things we talked about in this case, like, why wouldn't we have talked about that one? If I could go back, 3 weeks ago when we were sitting here for days deciding that, I probably wouldn't have let it in. But I think you didn't make that motion, and it came in up at the time of trial, and I tried to correct it to whatever extent I did. So anything else, Mr. Boylan?
Yes, Judge, it did come up in the depositions. She did not know the name of the person in the depositions. It's not as if something you can put back in the toothpaste to. Once we knew her name, we would have known her name. She didn't know the name. I do want to say 90801, sub 4, sub B, this is the party opponent issue. I understand Your Honor's ruling, but to make a record, subsection 4, this is not hearsay if it is a statement by the party's agent or servant concerning a matter within the scope of the agent or servant's agency or employment during the existence of the relationship. This is why I laid the foundation with her that this individual was the same person who came into the room and placed some items around. It was the same person who walked her downstairs. She was wearing the hospital nursing gear, and there were no visitors allowed in the hospital, and therefore it had to have been an agent or servant of the defendant, of a party. And
Stop you for a second. So you're talking
90801, sub 4, sub B, number 4. And the hospital's position is that the hospital itself is the only proper party, not the individual staff, not the individual nurses with respect to the negligence. So that person, whether we know the person's name or not, what agent or servant concerning the matter within the scope of that agent or servant's employment, and therefore is statement of a party opponent. I didn't attempt to try to sneak anything in. I laid the foundation with that being an agent or servant.
Yeah, I'm not convinced that that's necessarily true based on what Ms. Schara testified to. What she said is the person was wearing PPE gear. She didn't really know. She assumed it was somebody associated with the hospital, but it could have been a pastor, the undertaker, or a volunteer. Right? That was her testimony.
I don't think she said it could have been someone else. She said it was somebody who escorted her out of the hospital, and it was somebody who had been in the room before doing some things with arranging the room.
I don't remember that. But in any event,
I respect your ruling. The point I did not understand was, and Your Honor did later say to the jury, you're not to take it for the truth or the untruth, one way or the other, and I'm happy with that.
okay. All right, good. Anything else before we take a break from the plaintiff?
No, Judge.
Yeah. And again, when I ask these questions, it's not to rush anybody. It's just to give an idea.
Depending how quickly we go, it could be maybe 20 minutes. And I mean, if I have to keep repeating, it may take a little longer, but 20 minutes perhaps.
What do you have?
10 minutes.
Back to redirect after a half hour or so?
Yes.
And then you get your second witness ready to go if we don't get to the break?
We do. May I ask Mr. Frankowiak something about where his testimony may go so that I...
Yeah, you guys can do that at the break, but let's start up at 2:15, which will give each of you like 12 or 13 minutes. Is that good?
Great.
Sure.
Thank you.
On the court clock here.
Okay, so that's fine.
Okay, good. We'll see everybody then. This is the parties are, or the attorneys are here. We're missing some of your co-counsel, Attorney Boylan and Mr. Schara, but jury's coming back down. We're going to start in a couple minutes. What do you want to say?
Judge, so I did touch base with Mr. Frankowiak during the break about where his testimony or where his questioning might next go, because I did have a concern about there was a transcript, and I believe it's up at the witness stand right now because it was an exhibit at Mrs. Schara's deposition. There was a transcript that Mr. Frankowiak's own office prepared. It's not a certified court reporter's transcript. It's the only exhibit to her deposition. This exhibit, I believe it's the only, but it's exhibit number 1. And he prepared that transcript of a podcast that she was on. Mr. Frankowiak, and correct me if I'm wrong, he said he is not going to attempt to introduce that transcript. It is not a transcript. And he also is not going to play this podcast. I don't think it's relevant at all. And I think I'm free to object to that when it comes up as relevant. I don't know if the
Stipulation of that?
I'm sorry?
Stipulation?
Yes, I am not going to introduce a transcript, nor am I going to play the podcast. I'm going to ask questions that I asked at the deposition based upon testimony she gave. That's it.
And this is where I think he can only ask her about that if she gives inconsistent testimony today as impeachment, to ask her about her prior deposition testimony. Consistent, not simply variant.
I'm not understanding exactly what he's saying. I'm just asking questions based upon testimony she gave in a sworn deposition. I'm not asking any other questions. Everything is based just on the deposition testimony she gave, so.
I will approve the stipulation. If it's getting into an issue, just ask and we'll have a sidebar. I appreciate you putting me on notice of it. Right, so we'll just talk about it. If you think it's getting anything close, just let me know.
Yes, sir.
Okay. You had your hand up, Mr. Guzzi?
So, just quick, I mean, I think the other part of this deposition transcript issue, and it's for knowledge moving forward. I mean, the transcript, I believe, can also just be used to refresh the witness's recollection. It does not have to be used for impeachment. So you can ask him if this was your deposition testimony at the time. And then if you choose to show that it's inconsistent, then you can use the original transcript. That's my understanding. I don't think it has to be just for impeachment purposes.
My understanding is in order to refresh the recollection, though, the witness would first say they don't remember what they would have testified to, and that, yes, looking at the transcript would be helpful in refreshing the recollection. And you don't get the refresh absent those two things, right?
Agreed.
So that's one approach, and then the second approach, I think, is what Attorney Frankowiak did. So there's a couple of different methods that you guys can use to get there, but some of it will be on how helpful the witness is too, and what they're doing. So, but that approach is fine as long as you lay the foundation with those two initial questions. We're ready for the jurors. If you want to come back up to the witness stand. Okay, everyone may be seated. Welcome back, members of the jury. Two of the jurors have been sitting next together since jury selection. I don't know what the two of you will do, but it's good. And just to remind you, so you know, I cut off Attorney Frankowiak in the middle of his cross-examination, so that's where we're going to pick it up. When he's done, Attorney Guzzi will have a chance to cross-examine, and then there'll be an opportunity to redirect by the plaintiffs, and then we'll move into, hopefully, to the second witness. So back to you, Attorney Frankowiak.
Ma'am, could you once again hear me just to make sure my microphone's working? Okay, thank you. When we left off, we were about to talk a little bit about the events of October 10th of 2021. You were periodically in contact with your husband by telephone between October 6th and October 9th, 2021, true?
True.
You believe that Grace was doing based upon your conversations with your husband between October 6th and October 9th, true?
True.
On the morning of October 10th, 2021, I understand you received a telephone call from your husband at somewhere in the vicinity of 7:00 a.m., true?
True.
Your husband informed you at that time that he was being required to leave the hospital, true?
True.
Your husband asked you in that telephone call if you felt well enough to come to the hospital to take his place at Grace's bedside, true?
Correct.
During that telephone call that you were not feeling well enough to do so, true?
True.
Okay. You discussed with your husband over the telephone that morning the potential of getting your daughter Jessica to the hospital to take your husband's place at Grace's bedside, true?
Correct.
You and your husband decided to talk to Jessica about potentially having her go to the hospital, true?
Correct.
Your husband returned home from the hospital on the morning of October 10th, true?
Correct.
By your personal observation, your husband was coughing and physically expressing symptoms of COVID that day after returning home, true?
Could you repeat that?
Your own personal observation that morning, your husband was coughing and physically expressing symptoms of COVID that day after returning home.
I don't know.
Ma'am, I would like to refer transcript once again, if we could, on page 107. If you could just tell me when you get to page 107.
I'm there. I'm there.
Okay, thank you. I want to reference line 17. There's a question there that says as follows. Okay, he was coughing and experiencing symptoms of COVID as of the 10th. Answer, that's correct. Did I read that correctly?
Correct. I just didn't remember.
Thank you. When your husband arrived home on the morning of October 10th, he told you that he felt as if he had gotten COVID, true?
True.
Your husband was subsequently hospitalized himself as a result of COVID symptoms about October 14th of 2021, true?
Could you repeat that?
Your husband was subsequently hospitalized himself as a result of COVID symptoms on or about October 14th of 2021, true?
I was wrong on that date. It was like 3 days after Grace died.
Okay, so when you testified your deposition the 14th, you were incorrect on that day when you...
Correct. I made a mistake. I thought
Okay.
it was the 14th.
Your husband was subsequently hospitalized as a result of COVID, true?
Correct. It wasn't the 14th though.
Okay. When your husband got home on the morning of October 10th, 2021, he informed you that one of the reasons he had been given for why he was asked to leave the hospital was that he had been shutting off alarms in Grace's room, true?
Could you repeat that slower, please?
Sure. When your husband got home on the morning of October 10th, he informed you that one of the reasons that he had been given for why he was asked to leave the hospital is that he had been shutting off the alarms in Grace's room, true?
Silencing them, not shutting them off.
Okay. Your answer is no?
I said I believe he was silencing them. I don't think the word was shut off, but I didn't. That's what I heard.
And he told you when he got home that morning that one of the reasons he was given for being asked to leave is because he was silencing alarms.
I don't remember. I'm sorry.
Okay. If you could look up in the transcript to page 109. Okay. I want to start right at the top of the page on line number 1. The question is as follows. After he got home, did he communicate to you any further in terms of why he had been asked to leave the hospital? The answer you gave was, other than challenging, I think they had mentioned, or he mentioned, that they were accusing him of shutting off alarm. Read that correctly?
Correct. It was accusing. Yep.
When your husband
you
left,
stated he was shutting them off, and here it stated that he was accused of that.
yep. Ma'am, when your husband left the hospital on the morning of October 10th, a virtual visitation plan was set up with the hospital whereby care staff at the hospital could keep you apprised of Grace's progress and condition throughout the day on October 10th. True?
Talking really fast. Can you just slow down a bit?
Sure. When your husband left the hospital on the morning of October 10th, a virtual visitation plan was set up with the hospital whereby care staff at the hospital could keep you apprised of Grace's progress and condition throughout the day on October 10th.
Correct.
Okay. You and your husband did in fact receive 3 update contacts over FaceTime throughout the day on October 10th from one of Grace's nurses, true?
Correct.
You noted that Grace was eating and that she looked good to you during these FaceTime calls on October 10th, true?
Correct.
You were able to communicate with Grace's hospital caregivers through FaceTime on an iPad, true?
Correct. Grace's iPad. True, Grace's iPad.
You had no questions that day, October 10th, for Grace's caregivers, true?
I asked them how she was doing during those calls, and they just told me she was doing good.
Okay. And you stated at your desk you had no questions for them, true?
Not serious questions, no. Just
Okay.
how she was doing.
You did not recall experiencing any problems communicating with the hospital staff over FaceTime on October 10th, true?
True.
Your older daughter, Jessica, as I understand it, was subsequently able to enter the hospital and go to Grace's room the following day on October 11th, true?
Could you say that again, please?
Sure. Your older daughter, Jessica, was subsequently able to get into the hospital to go to Grace's room the following day, which was October 11th, true?
I believe that's true.
Okay. After Jessica gained entrance to Grace's room at the hospital, you were then able to communicate freely with Jessica by phone while she was at Grace's bedside, true?
True.
Okay. Dr. Gavin Shokar was one of Grace's doctors on October 12th and October 13th, and you testified he contacted you and your husband on October 12th seeking what as a pre-authorization for the use of a ventilator, true?
True.
Dr. Shokar wanted an authorization to place Grace on a ventilator if something happened in the middle of the night when you and your husband could not be reached immediately.
I'm sorry, you can just, I can just slow down. Your words are just coming at so fast.
As I understand your testimony, you said that Dr. Shokar wanted an authorization to place Grace on a ventilator if something happened in the middle of the night when you and your husband could not be reached immediately.
Right, again, a pre-authorization.
You and your husband did not grant any authorization to place Grace on a ventilator at any time on October 12th, true?
Correct.
Okay. In fact, you denied every request from any caregiver for permission to authorize a ventilator for Grace while she was in the hospital, true?
Objection. Testimony.
Overruled. Cross-examination. Go ahead.
What was the question?
Okay. In fact, you denied every request from any caregiver for permission to authorize a ventilator for Grace while she was in the hospital, true?
A pre-authorization, true.
Okay. At no time did you authorize her to be placed on a ventilator at any time while she was in the hospital, true?
True, there was no need ever proposed.
Even on October 13th, the date of Grace's passing, neither you or your husband wanted Grace to be placed on a ventilator, true?
Same with.
Repeat that.
Even on October 13th, the date of Grace's passing, neither you or your husband wanted Grace to be placed on a ventilator, true?
As I stated, there was no instance or situation, so we were not giving a pre-authorization.
Yeah. Ma'am, the question was, even on October 13th, the date of Grace's passing, neither you or your husband wanted Grace to be placed on a ventilator, true?
And I'm saying again, there was, the way that's worded, sounding as if there was a situation where she would have been placed, and we were never told that there was a situation.
Okay. Ma'am, if you could refer to page 141 of your transcript. Let me know when you get there.
I'm there.
Okay. Starting at line 1, it says, question, and based upon your previous answers that you did not give him pre-authorization on the 13th either for the use of the ventilator. Your answer was correct. The following question was, okay, did it continue to be the case that you did not believe that she needed to be on the ventilator? Your answer to that question was correct. Did I read that correctly?
Correct. We were never told that the situation was at hand.
Ma'am, on October 13th,
Objection?
ma'am, by October 13th,
Objection on what basis?
Completeness?
You can redirect on that.
Thank you, Judge.
Go ahead.
by October 13th of 2021, a decision had already been made by you and your husband that under no circumstances would you permit Grace to be placed on a ventilator in the hospital, true?
Could you repeat that, please?
Sure. By October 13th of
Just
20.
do something, so can you just close the transcript, because it looked like you were reading it as he was asking you the question.
Because I'm trying to follow along, because it.
But he's not asking from there anymore, so if you can just have her close it when you're done with it.
Okay.
As then she can focus on your question and we don't have to repeat them.
Absolutely, absolutely. I'm not asking any questions about the transcript. This is a new question, okay?
Okay.
All right. By October 13th of 2021, a decision had already been made by you and your husband that under no circumstances would you permit Grace to be placed on a ventilator in the hospital, true?
No, I guess I'm confused on what you're saying there.
Okay, well, can you reference page 148 of your transcript, please?
I thought you weren't in the transcripts any longer.
I now am. I've asked the question and I just want to reference that particular page, page 148.
I'm there.
Okay, I'm referencing page or line 10. There's a question starting on line 10, and that question is as follows. And the decision had already been made that under no circumstances would she be intubated or put on a ventilator, even if she were to have some sort of arrest or stop breathing. Your answer was correct. Did I read that correctly?
You did.
Okay.
Action rule of completeness. On redirect.
You'll be able to do redirect. If you're done, just tell her that you're done. Close it.
May close the transcript. Okay. Ma'am, after Grace's death, your husband commenced a GoFundMe campaign to raise money, true?
Objection vague, relevance.
Cross-examination, go ahead.
Could you state that again, please?
Sure.
What date you said?
After Grace's death, your husband commenced a GoFundMe campaign to raise money, true?
True.
Your husband also started a website for Grace after her passing?
True.
Shortly after the GoFundMe account was started, your husband's death on GiveSend, true?
True.
The purpose behind the GiveSend Go fundraising campaign was to encourage giving to Grace's cause, true?
True.
Grace's cause was to help others to know what was happening in hospitals during the COVID pandemic, true?
True.
You and your husband believed that protocols were being followed by hospitals during the COVID pandemic that did not heal people, but instead ended people's lives, true?
True.
One of these protocols about which you were trying to get the word out was the use of ventilators in hospitals for the treatment of COVID patients, true?
True.
This was a protocol that was hospitals during the COVID pandemic that you and your husband believe was not helping patients live, true?
Could you repeat the question?
This was a protocol, the use of ventilators, that was followed by hospitals during the COVID pandemic that you and your husband believe was not helping patients live, true?
True.
One of the things you and your husband were raising money for was to get the word out about those protocols being followed by hospitals, like the use of ventilators, true?
Repeat it one more time. Slower, please.
One of the things you and your husband were raising money for was to get the word out about such protocols being followed by hospitals, like the use of ventilators. True?
Not sure. I don't know for sure what the total reason was.
Okay. Ma'am, you and your husband found information and statistics that led you to believe that ventilators were killing people. True?
Repeat that, please.
You and your husband found information and statistics that led you to believe that ventilators were killing people. True?
Correct.
You information and statistics on what you describe as alternative media sources, specifically Substack and Rumble. True?
Objection, relevance, hearsay, multiple hearsay.
Ruled on relevance, and that was already dealt with on a pretrial motion. Not sure what hearsay.
He's going, I believe, is going to ask about some other internet something, which would be asking her to talk about some hearsay that's out there.
I think the question had to do with the impact it's going to have on her. That's how it's relevant, because she had listened to stuff and her husband believed stuff. Is that where you're going?
Yeah, I'm just asking where she found this, or trying to find out where she found this.
So again, you go back to hearsay, members of the jury, and I will allow it if it's intended to show the impact on in this case, Ms. Schara. So the objection's overruled on hearsay as well.
To the relevance as to the timing, this is after her daughter was in the hospital. The impact on her, the relevance of the impact on her in 2014 or 20.
Yeah, I think that was
2024.
dealt with in a pretrial, but we can take it up after the jury leaves today.
Thank you, Judge.
Sure, go ahead.
This information as statistics on what you describe as alternative media sources, specifically Substack and Rumble. True?
True.
In conducting research on these hospital protocols involving ventilators, you and your husband deliberately avoided consulting any mainstream media sources which you considered to be untruthful. True?
Repeat the question, please.
In conducting research on these hospital protocols involving ventilators, you and your husband deliberately avoided consulting any mainstream media sources which you consider truthful. True?
I don't know. You're stating deliberately. I don't think we deliberately did that.
Page 196 of your transcript, please. Let me know when you're there.
I'm there.
Okay, starting at line 20 on page 196, there's a question that says, when you say truth source, what do you mean by truth source? Your answer was a source where you can actually get the truth, the news that's truthful. My next question was, okay, is or are there any sources that you know to be untruthful and would definitely avoid so as to avoid untruthful news? Your answer was all of the regular news stations. My answer or my interjection was oh, and your completion of your answer was they're not reporting the truth. My next question was like CNN, ABC, NBC, the big ones like that. Your answer was, yeah, right. Did I read that correctly?
Yes.
Okay. So the mainstream media sources you and your husband avoided, including the likes of media sources like CNN, ABC, NBC, the big ones like that. True?
Repeat the question, please.
The mainstream media sources that you and your husband avoided, including media sources like CNN, ABC, NBC, the big ones like that. True?
True.
Okay. You avoided these mainstream information because you and your husband believed they were not truthful about what was going on in hospitals during the COVID pandemic. True?
True.
Okay. In December of 2023, you gave an interview on something called the Mothers for Justice bus tour. True?
True.
Okay. You were interviewed at that time with another woman named Rebecca, who had a website that she maintained entitled deathbyhospitalprotocol.com, true?
True.
Rebecca talked to you about that website when you met her during that interview in December of 2023, true?
Objection, hearsay.
Just tell me what the question was again.
Yeah, the question was simply whether or not Rebecca,
Read it back.
yeah, whether Rebecca talked to you about
Let
the
me just
website.
have the court reporter read it back. That way we see if she's actually doing this right. Objection overruled. Go ahead and answer.
The question was what?
Did Rebecca talk to you?
Oh, yes, true.
You understood that this website, deathbyhospitalprotocol.com, constituted an attempt to put the names and faces of healthcare providers on a website so that they could be portrayed as murderers to let everyone know that's what they do, true?
Objection, and Judge, I'd like to be heard either outside the presence of the jury or to refer to a prior motion and ruling.
Counsel may approach. So what we're going to do is just
All right. Okay, thank you.
maybe seated, and counsel, you can go back to your table and we'll just talk. So I think what you referenced in the sidebar, and then you guys weren't able to hear me and I was hesitant to speak up louder, was Mr. Boylan, you said that Dr. Shokar's motion in limiting, I think you referenced number 22, it was stipulated to that there was going to be no mention of murder or anything like that. That's what your basis was that you said at the sidebar?
Yes, Judge, and by anybody, because
Yeah,
together,
we'll argue in just a minute. And then my response was, well, in fairness, I kind of thought that their motion was to prohibit plaintiffs from doing that. And you said at the beginning of that hearing, there was an agreement, and I think you're probably right about that. By one side, it would mean neither side would do it. And that was kind of the extent of our sidebar, correct?
yes.
Okay, so go ahead and argue.
And also, they are now asking the plaintiff's first witness to talk about this. So even if it did only apply to the plaintiff, they're asking the plaintiff's first witness to talk about this. But I do think it applies to everybody. I thought in fairness, it would apply to everybody.
Okay, and Mr. Koliak.
Discussing this, and I had indicated that I had not made that motion, and that I did intend to cross-examine the plaintiff with regard to things like beliefs and things of that nature. And I believe it was decided at that time that I would be allowed to do so, that it's not, that the decision on any other motion in limine brought by any other person would not preclude me from doing that. That was my understanding of the holding because I remember actually bringing it up and saying I did want to cross-examine on things like that.
Okay, Mr. Guzzi.
Andy, one of the bailiffs should be here.
Maybe Kevin.
Missed the exact question, but this is my motion. I think motion in limine. Motion in limine refers to reference, argument, or suggest defendants murdered, killed, or in any way intended to cause harm to Grace Schara. Now, maybe I didn't hear the question right, but I thought it was directed in a more global sense about theories of hospitals' protocols in general, not with regard to safety, but it may not have heard the question exactly.
I'm trying to understand what you're getting at with this whole line of question, that she was on some website or part of some group that was advocating and publicizing medical personnel that had murdered patients. Is that sort of what you're getting at?
You understood this website was constitute an attempt to put names and faces of healthcare providers on a website so she could portray them as murderers and let everyone know what they're doing. Now, one of the follow-ups, and it will come up with other witnesses, is that one of the witnesses, I believe it was Jessica, did place the name and face of Nurse McGinnis and Dr. Schara on that website. So, I mean, that's what the series of questions is working toward, is bringing that out.
Tell me the relevance of all that in this case.
Well, the relevance, it goes to where the plaintiff is coming from with the allegations in this case, that they believe that there was some part of some larger conspiracy.
Okay, Attorney Boylan, your response?
In terms of the hospital's argument that that's not its motion, the motion by Dr. Schara number 22 wasn't its motion. The hospital did not oppose the motion. Oppose this motion because we want to bring in this information, and we should be able to bring in this information. Number one, so it should bind the hospital. It was a stipulation. It was a granted motion. And in addition, in terms of Dr. Schara's position that, well, this isn't about talking about murdering Grace, it's talking about murdering somebody else, well, then it doesn't have any relevance here at all. It's so, but I did not believe we would be here at trial talking about using the words murder, killed, and I believe that was resolved by Dr. Schara motion number 22. If it's about somebody else, it's not relevant.
Your Honor, if it will move things along in this case, I only had a couple of questions on this topic. I can forego those questions to eliminate this issue's witness.
Are you going to then bring it up with Ms. Vanderheiden?
Yes, I had planned to do it with the individual who actually did put those names out there, which was Jessica.
And the relevance of that, since she's not a party, is what?
Well, the relevance is that the family has testified that they share the belief, or they're coming from the same position.
Okay, well, so you want to move on and not address it with this witness?
I can forego that question to that series of questions with this.
So we can bring the jury back in, so.
Judge, may I? Because
we can always argue about it later.
Not about this issue, but what is coming next also will be irrelevant. And I just want to be, the jury come in, out, in, out. I think whatever is coming next from this podcast he's asking her about is all going to be irrelevant.
I'm sorry, I'm misunderstanding what the question is. I didn't hear the objection.
Podcast is going to be irrelevant is what I heard you say.
Yes, Your Honor.
I don't believe that's to be the case. I asked questions. I'm not referencing a podcast, a transcript, or a podcast itself. I asked questions based upon things I learned by reading sources, and she answered those questions at the deposition. I believe that's proper. It's as if I took notes after watching a news story.
Bill, can we just keep the door closed? You stay in here, and then when we're ready, Bill.
For example, if I watch a podcast and I obtain information, I can ask a witness about what's on that podcast. If they were giving an interview of some sort, there's no problem with that. They answer the question at a discovery deposition. I can ask them what they said to me at the deposition.
As long as it's relevant.
There's going to be no relevance.
I have no idea what you guys are talking about. I mean, that's the truth.
deal with the substances.
There will be testimony about an interview that was given by this witness at a thing called the Mothers for Justice bus tour, which we've just brought up.
That before.
Right, and it will have statements that she made, for example, beliefs that she has about things like COVID, whether she believes in COVID, whether she considers the vaccine a vaccine bioweapon, things of that nature. That those were things that were said in that that
I'm going to allow that. May bring the jury back in.
Can I clarify something?
All right, and maybe seated. Thanks, members of the jury, for understanding that. And there are times where, Bill, that we're just going to have to do things like that. And the first of them in this case. Attorney Frankowiak, you were still doing cross-examination.
Yes.
Continue. Ma'am, we've discussed your deposition that you gave back in May of 2020. You testified at your deposition that what we were calling COVID during the COVID pandemic was not really COVID, did you not?
Correct.
Okay. You told me at your deposition that COVID was just
True.
your position that COVID was really nothing more than simple colds and flus and was simply being deemed something more than that, true?
True.
Okay. You told me at your deposition, for example, that some interventions that were put in place in an attempt to slow the spread of COVID, such as masking and social distancing, nothing more than fear tactics aimed at deliberately causing fear in the populace, true?
True.
You told me at your deposition that God made our bodies so we don't need to wear masks and that our bodies will heal themselves, true?
True.
You told me at your deposition that you believe that these COVID deaths that occurred in hospitals during the pandemic were actually caused by the hospitals, and those individuals who died with COVID symptoms in hospitals would have survived if they had just stayed home and taken supplements in order to get better, true?
Are you reading right out of the deposition? Because I don't recall exactly how I said that.
Okay.
Reading.
Sir, did we 280 of your deposition? Let me know when you're there.
I'm there.
Okay, on page 280, starting at line number 9, there's a question that begins as follows. That, to me, sounded like that overall, you believe that people who contracted COVID were better off staying at home than going to the hospital. Your answer was as follows. Yes, I believe that's true. I believe that what happened to them in the hospital caused their demise versus if they would have stayed at home and tried to get themselves well using different supplements and different meds at home, would have survived. I think that's obvious. Did I read that correctly?
Correct. That's what I said in deposition, not what you stated in the question.
Okay. Ma'am, your daughter Grace was never vaccinated against the COVID-19 virus, true? You have referred to the COVID vaccine as a bioweapon, have you not?
Correct.
Okay. You referenced the COVID vaccine as something that was used to kill people, true?
Objection. Last discussion.
Overruled. Go ahead, Nan.
Repeat the question, please.
Sure. You referenced the COVID vaccine as something that was used to kill people, true?
True.
You believe that the COVID vaccine is a bioweapon aimed at causing children to die of myocarditis, true?
True.
You told me at your deposition that you believe this vaccine or bioweapon is being used deliberately to sterilize the population, true?
True.
You believe that young men who have gotten the vaccine are no longer able to father children, true?
True.
You believe that women who have gotten the vaccine are miscarrying as a result of the vaccine, true?
True.
You referred me at your deposition to a website for the Children's Health Defense, which you believe showed how many children have died as a result of vaccines, true?
True.
Okay. During your interview on the Mothers for Justice bus tour, you illustrated your belief about what the government was doing with the vaccine bioweapon by recounting a story of a specific example of blood testing that you personally observed involving a woman by the name of Rosanna Fiorazo, true?
No, it was not a Mothers for Justice bus tour.
Okay. Have you ever illustrated your belief about what the government was doing with vaccines by recounting a story of a specific example of blood testing you personally observed involving a woman by the name of Rosanna Fiorazo?
Could you slow down and repeat it, please?
Sure. Have you ever illustrated your belief about what the government was doing with the vaccine bioweapon by recounting a story, specific example of blood testing that you personally observed involving a woman by the name of Rosanne Fiorazo?
Yes.
You told me at your deposition about this personal experience that you had with Rosanna Fiorazo, true?
True.
You and your husband know Rosanna Fiorazo's husband, David, true?
True.
In fact, you and your husband authored a chapter.
True.
The name of that book is Assault on the Image of God, Understanding and Responding to Attacks on the Bible, Human Life, and the Church, true?
True.
Rosanna was a Wisconsin woman who received the COVID vaccine in order to be permitted to fly to visit some family in Canada, true?
True.
You recounted to me at your deposition that Rosanna was experiencing some memory problems, so her husband requested that you accompany her to have her blood tested at a place that does blood reading, true?
True.
You personally accompanied Rosanna to this place that did blood reading and which was not a hospital, true?
True.
You sat with Rosanna while the technician who did the blood reading put the results up on a TV screen for you and Rosanna to see as she read the blood, true?
True.
You told me at your deposition what you saw on the screen at that blood reading, true? You told me that you saw nanotechnology in Rosanna's blood, things that looked like little spaceships with antennae in the blood, true?
The shapes of them looked like that. They weren't
Okay.
spaceships.
You told me that you also saw graphene, pieces of metal in her blood on that TV screen, true?
True.
Graphene is in fact a metal, true?
True.
The lady who performed this blood reading said that this was graphene in the blood that you were seeing on that screen, true?
True.
You believe that this nanotechnology and this graphene that you were seeing in Rosanna's blood was placed as part of the COVID vaccine bioweapon that she had received, true?
True.
You told me at your deposition that you were concerned enough by what you had seen at this blood reading place to have your own blood tested, even though you had never received the vaccine, true?
True.
You got the results of this blood testing back on your own blood, and you learned that you did not have any nanotechnology in your blood, but you did have some evidence of graphene in the blood, true?
Correct.
You understood that you supposedly had graphene in your blood as a result of what you described as a phenomenon called shedding, true?
True.
You described the term shedding as describing a phenomenon whereby anyone who received the COVID vaccine for a number of days after receiving the vaccine could shed graphene into the blood of anyone who happened to be standing near that person, for example, through sweat. True?
Objection, Your Honor, at this point, how long this has gone on, I also believe this is subject to prior rulings.
Go ahead and answer about the question about the sweat and getting it from others.
I'm not sure if that's how it was stated in my depositions. That sounds much more different than what I described.
If you could reference page 245 of your transcript.
Okay.
Starting at page 1, the question was posed. So shedding, what do you mean by shedding? And your answer was as follows. When people were standing next to each other, I don't know the technical stuff, but if you were within somebody within so many days of them getting the vaccination, the body was, through their sweat, was able to pass some of this, like I said, I don't know the exact description. CHD has a description of it. Did I read that correctly?
That's what's written here, yes. That's what's written here.
I'm sorry?
That is what's written in the deposition.
Thank you. You can close the transcript. I don't have any further questions there. CHD is the Children's Health Defense website?
Correct.
Okay. You believe that you must have been standing in close proximity to someone who had received the vaccine at some point, such that some graphene was shed from that person's blood to your own?
As I said in my thing, I don't know how it works. I don't know how the graphene, but it's through the.
You told me at your deposition that there were certain ways to detox, i.e. to get the graphene out of your blood. True?
True.
You mentioned to me at your deposition that you can detox from the graphene shed by those who had received the vaccine by drinking dandelion root tea or by taking baths using certain items. True?
Just repeat that again.
Yes. You mentioned to me at your deposition that you can detox from the graphene shed by those who had received the vaccine by drinking dandelion root tea or by taking baths using certain items. True?
True.
Okay. At your deposition, I asked if you could kindly identify for me the name and location of the place where you went to have your blood tested. And you told me in your deposition that you could identify the place, but you would not do so. True?
I wouldn't because you were badgering me.
Okay. Prior to October of 2021, you were the one who was most involved with providing for Grace's needs on a day-to-day basis. Would that be a fair statement?
Say that again.
Prior to October of 2021, you would have been the one most involved in providing for Grace's needs on a day-to-day basis. True?
Correct.
Okay. That was because your husband had a job the most time with her on a day-to-day basis. True?
True. She was my student.
Okay. That's all I have for you, ma'am. Thank you.
Attorney Guzzi, cross-examine.
Thank you, Judge. Are you able to hear me okay?
I am.
All right. You testified in your, you testified earlier that Dr. Shokar didn't inform you as to Grace being in the ICU.
That he did not inform me?
Did not inform you.
Correct. Correct.
You also testified that Grace never changed rooms while she was in St. Elizabeth, correct?
Correct.
So your husband, Scott, was in that same room from October 7th through the 10th, true?
Correct.
And your daughter, Jessica, was in that room several times during Grace's hospitalization.
Correct.
Certainly, they told you that she was in the ICU.
No. No.
They never told you that.
No,
You also testified that you're qualified in CPR.
I take CPR to keep myself,
I'm sorry, were you finished?
you just asked me if I take CPR, correct?
Asked if you testified that you're qualified in CPR.
I have been, yes, meaning I take the classes,
So you know the purpose of CPR,
correct?
and you know how it works, right?
If I would come upon somebody, yes, I would know,
You know that you have to do chest compressions, right?
correct,
And you'd be working on the patient to try to revive them,
correct,
right?
correct.
So when you had your conversation with Dr. Shokar, both on October 12th and October 13th, I think you told us that Dr. Shokar was asking if there was a scenario in which Grace experienced cardiac arrest, would you want them to keep working on her? You recall that?
He didn't say cardiac arrest.
He did say though, didn't he?
He said if her heart stopped and we couldn't get it going again, would you want us to keep working on her?
So he may not have said cardiac arrest, but he did say heart stops, right?
Yes,
And with your qualifications in CPR, you know that those are the same thing, don't you?
yes,
When he was, you knew exactly what he was talking about, and he was talking about CPR.
it was an odd situation. He just talked to us about putting her on, getting her stuff. So it was
Being non-responsive.
correct. What'd you say?
Ruled. It was non-responsive. They heard it, but keep going.
You knew that, right?
I didn't think of it in that way at that time, at that moment. We were just talking to, getting on a feeding tube and everything.
But you were thinking in your mind something along the lines of, if she's already gone, it's futile. That's what you were thinking, right?
Yes,
Did you tell Dr. Shokar that?
no,
At some point during either the conversation of the 12th or the 13th, you and Dr. Shokar, Mr. Schara and Dr. Shokar discussed a tracheotomy.
we did not discuss a tracheotomy.
Okay, in the context of the conversation, Dr. Shokar brought it up.
He mentioned those who get a ventilator most of the time get a trach.
You have an understanding of what a tracheotomy is?
Yes, I'm actually advocating for a lady that has a trach right now.
And so you know that a trach, that's an incision directly into the windpipe and the tube goes down, right?
Correct.
You understand it's a surgical procedure.
Correct.
You understand that it's done under general anesthesia, right?
Not always,
Local anesthesia?
not in an emergency.
Sure, that would be called a trach, right?
I believe so.
That's not what we're talking about in this case. That's not.
He just mentioned the trach and the way that he said, most people that get a ventilator get a trach. That's all he said, was not a discussion.
And you also knew that that procedure leaves a permanent scar.
Yes,
investigating why. Now talking to the family before.
And with our daughter being there also. When you say your daughter, which one?
Jessica.
Yeah. So when the attorney for the hospital wanted to say, oh, you decided not to put her on a ventilator. Well, you explained in your deposition, right? Because my daughter Jessica was there. And if that call, we could make it then and there, right?
Correct.
Overruled.
You were asked to go to page 197 and 198. Whoops.
Okay.
Okay. Go to page 197 and 198, and you were asked about different news sources that you use.
Correct.
And the words used were that you said you deliberately avoided certain news sources.
That's what the other attorney stated.
Is in your transcript right there on those pages, do you say that at all?
I don't see the word deliberately.
Do you see anything about avoiding?
No, I don't recall saying avoiding either.
You had news sources that you liked to watch and consult.
Correct.
You didn't testify at all that you either deliberately or avoided the others?
Correct.
You might not like them, but deliberately avoid them, and that's not in that transcript, is it?
No.
Am I correct?
I do not see that.
Page 280. I'm going to go to each one that you were asked about.
And there.
Okay, and you were asked on page 280, and in the bold here, starting at line 15,
okay.
Please forgive me for my skill at, or lack of skill at getting the size right. You were asked about people's demise in the hospital, and it was suggested that you said that everybody that died in the hospital was for this reason. This particular snippet was read back to you. Do you see that on line 15?
Correct. I see it.
What you were actually being asked about was a continuation of the testimony up at the top of the page, where you were referring to some people. You said many people who had symptoms went to the hospital and didn't need to. You thought many people, right?
Correct.
You weren't talking about everybody on the face of the earth, were you?
No.
He asked you only about line 15 on down and made it sound like you're talking about everybody.
Correct.
That's not what you said, is it?
No, it is not.
I'm going to ask you to go to page 238.
I'm there.
And on 238 and throughout your deposition testimony, earlier on, what date was your deposition? It's on the top right-hand corner.
May 14th of 2024, so a year away already.
So at that time, and he attacked you here at the trial, attacking you about this term bioweapon. Do you remember this?
I do.
And mentioned the word bioweapon a number of different times to you, right?
He did, yes.
Attorney or the hospital, I'm just going to say the hospital mentioned to you on cross-examination many different times, right?
Yes.
Line 17 to line 19. Could you please read me just read from the transcript line 17 to 19.
I was kind of hoping, unfortunately, I've had the vaccine and I'm a little concerned I might be sterile. Is that true, Frankowick?
talking about the bioweapon, and he said that he had the vaccine and he's concerned he might be sterile?
Correct.
You were asked some medical questions, twisting you up a little bit. You're not a doctor, are you?
No, I'm not.
You're not a PhD? You don't have a license to practice medicine?
No, I do not.
You can't diagnose anything? I'm sorry?
No, I cannot.
That doesn't prevent you from taking care of your own daughter, right? Many women these days are doctors, nurses, and so on. You're not.
Correct.
But you're asked some rather technical questions about blood work and other types of medical issues. You're not a doctor.
No.
In fact, there's been expert witnesses who have been hired to testify in this case, right? They will give the medical information and the medical testimony.
Correct.
I'm gonna ask you page 148, and I only have one more topic here. Page 148, they asked you about, this is the other one they asked you about, the defense. The statement of under no circumstances would you be put on a ventilator. Do you remember that?
Yes, I do.
And that's line 10 down to line 14,
Yes.
right?
I see it.
You see that?
Yes.
They didn't ask you about your testimony that led at the top of the page where you were asked about this conversation and you said, well, if she's already gone, it's futile. Do you see that?
I do.
So if she's already gone, it's futile, and she wasn't already gone until you got a phone call, FaceTime call from your daughter saying, we're asking for her to be resuscitated, please help her, right?
Correct.
Up until that point in time, she wasn't gone, right?
No, she was not.
That morning, she was 90-something% oxygen, right?
She was.
And so you said, do your best job, right?
I did.
Is doing nothing, absolutely nothing in response to your cries to help your daughter and save your daughter the best job anybody can do?
I don't believe so.
And it wasn't until Dr. Shokar ordered everyone, do not resuscitate your daughter. A DNR is not just a statement or a conversation or an order for everyone in that hospital to follow. It was not until Dr. Shokar ordered everybody else at the hospital to do nothing that your daughter became futile.
This misstates the evidence.
Is that
On a second, so don't answer when there's an objection.
Oh, sorry.
Objection sustained. Jury should disregard that answer as well as the question. It's inappropriate and I think inaccurate. Next question.
Ms. Schara, is there anything else that you would like to say, and it's okay to, it's time for you to go.
As a mom who lost her daughter in the hospital and do know that there's other ways to provide assistance if somebody is in the situation that Grace was at, event that denying Grace any assistance to help her in her final moments was just horrific. And in this case, I just, what we're talking about today, the whole idea about Grace not getting anybody is just wrong. And the order that was placed on her without our permission and her would be help her is just wrong.
That's all, Your Honor.
At this time, I said to you yesterday, we allow jurors to ask questions of witnesses. So is there any member of the jury who has a question for this witness? If you do, you just raise your hand. All right, there are no hands. Do you mind getting exhibits? Ms. Schara, you may step down. Your testimony is complete. Thank you.
I just take this one.
You can keep that right there. The clerk is coming to get it. And we have about a half hour left, Mr. Boylan, so do you want to call your next witness?
Was counsel
Okay.
about who's going to call? Our next witness, Judge, would be called on cross, which is a nurse Samuel Haynes. I don't know how much.
It's a little different than that. Haynes is here.
It might be best. I have to make sure that's okay with him.
Judge, we're trying to confer in the interest of saving time and getting one witness.
The goal will be to adjourn within a half an hour.
Correct.
Yeah, in light of the way it is, let me go see if I can get him to make sure that's okay.
Ms.
It's Nurse Haynes, Your Honor, but we're having an issue because defense would like to do direct examination at the same time and just take care of that witness.
Back tomorrow, whatever we don't finish by 4, we'll just start.
The choice at that point is we could bring him back tomorrow morning, or I would just withhold him and do it with the defense case in chief, given that it's not going to be consecutive.
You want?
Okay. Let me, if I may be excused to go find him, he should be in the hallway right outside.
Who's handling this witness?
I am. Yeah, I agree. I agree.
Mr. Guzzi, I hate to send you to go chase after somebody, but. All right, if you want to come on up to the witness stand. And when you get up here, in standing, raise your right hand. and the clerk is going to swear you in.
You do solemnly swear or affirm that the testimony you shall give shall be the truth, the whole truth, and nothing but the truth to help you God? Please have a seat. Can you please state and spell your name for the record?
Samuel Haynes, Haines.
Witness, Mr. Minister.
Judge, we're going to allow Mr. Frankowiak to do his direct. Are we not?
When?
You want me to cross him first?
No, my understanding was that you were going to call him adversely and I would do my direct afterwards. We will forego direct. And we will put him on during the defense case in chief to allow you to do your.
That wasn't my understanding, but we can certainly proceed that way.
Thank you.
Sure. Good afternoon, Mr. Haynes.
Good afternoon.
Can you please state your name and spell your last name for the court reporter?
Yeah, Samuel Haynes, Haines.
And how are you employed, sir?
I'm a nurse at St. Elizabeth's Hospital.
And what type of nurse?
Nurse.
Okay, make sure you speak into the microphone because I think we're having some difficulty hearing the witness stand.
I'm an ICU nurse.
Are you a registered nurse?
Yes.
You're a registered nurse in the ICU?
Correct.
What kind of training did you have in order to achieve that position?
Initially, I went to nursing school at Mid-State Technical College in Stevens Point, receiving my associate's degree in nursing. I went to University of Oshkosh, where I completed a bachelor's degree of nursing there. After that, once I was at St. Elizabeth's Hospital, I received 3 months of orientation where they taught me about medications and taught me about ICU-specific skills that I'll need.
ICU specifics and what?
ICU-specific skills. There are some things that ICU nurses do that other sorts of nurses don't have to do.
And as an ICU nurse, you're familiar with the medications that are commonly given to patients in the ICU, correct?
Yes.
Those medications would include Precedex, lorazepam?
Yes.
Any others you want to tell us about?
There are many other, and morphine, yes, morphine is one of those medications as well.
Right. Okay, so you said as relevant to this case, and that takes me into the next logical step. You recognize that we are here to talk about the care rendered to Grace Schara.
Yes.
In October.
Yes.
Of 2021. And I'm sure you've looked at the medical records and refreshed your memory as to the care that you rendered.
Yes, sir.
Okay, great. So I have a couple of questions regarding your care in the ICU, October 2021. When did you first encounter Grace Schara?
I worked with her 2 days. One of the days was on October the 7th, and at that time I was working overnight. So that would have been from the 7th to the 8th. And then the second day would have been on October the 12th to the 13th, if I remember properly.
Thank you. What did you do with respect to the Precedex while you were on the night shift of 10/7, October 7th?
That would have been the first day. I had started the Precedex on that day, and then I made a titration of that medication on that day.
Yes, thank you for using that term. Would you explain to the ladies and gentlemen of the jury what you mean by titration?
Yes. Some medications that are used in the hospital, particularly in the ICU, are medications that you don't flat rate of that medication. As patient conditions change, you might need to go up or down on those medications. So titratable medications are ones that are ordered in such a way that I, as an ICU nurse, can adjust those medications as needed to meet the patient's needs.
And shortly after 10 p.m. or 2200, did you modify or titrate the Precedex?
Yes.
And explain to the ladies and gentlemen of the jury what happened to your titration at 2200.
Yes, so that medication prior to 2200 was running at a rate of 1 microgram per kilogram per minute, which is just the way that that's dosed. It was 2207, I think. I reduced that medication from 1 microgram per milligram, or 1 microgram per kilogram per minute to 0.7.
Okay, so you had the authority to go ahead and titrate or modify the level of medication that was being delivered to Grace, correct?
Within the parameters that were set by the doctor with the order, yes.
Right, and you did so? Okay. And what was the rationale in your mind as to why you quickly reduced the oversedation or the Precedex?
I reduced the medication at that time because she was receiving too much of the medication for her at that point in time.
And how did you know that?
So there are many ways that you can see for patients receiving Precedex. One of the ways is that to reach a specific goal, we use a sedation scale called a RASS, where we measure agitation versus drowsiness. So there's a particular goal that we shoot for, and that goal is -1. So she was more drowsy than she was supposed to be on that scale. And then the other way that we modify those medications is based on if the vital signs are appropriate. So something that can happen on that medication is your blood pressure can go down. So if your blood pressure goes down too quickly or your respiration rate goes down too quickly, I can then turn down that medication so that we reach an appropriate amount.
And at 22:20 on October 7th, you made just that assessment, did you not, that she was oversedated?
I believe at that time, I would need to see the record to be certain, but I believe that her RASS was less than -1, so I reduced the medication.
Would it surprise you to know that her RASS was -3 at 22:20?
No, that's why I adjusted the medication.
Okay. And you placed a note, did you not, which said needed to quickly reduce dose that's a symbol for related to, correct?
Yes. Yes, when the RASS was lower than -1, I reduced the medication.
And what is an MAP?
MAP stands for mean arterial pressure. It's the way that we measure how effective your blood pressure is perfusing your organs.
Okay. And your next line of the note at 22:20 says, patient's BP, that's blood pressure?
Correct.
Dropped to a 65.
Correct.
And O2 said she apparently, based upon her pressure, she was decreasing. Sometimes.
At that time, it was lower than it needed to be.
Right. And she was what you would call desatting, or O2 saturations were decreasing.
Yeah, at that time they were low.
Right. And so you took this action viewed as an oversedation on October 7th.
My view of it at that time is that she was receiving too much of the Precedex for her at that moment.
Right. And this could have put her in a critical state, could it not?
It can, but it didn't.
Okay.
Lowered the Precedex to the appropriate amount for her at that time.
Perfect, thank you. Now let's move forward to October the 12th, going into the 13th.
Okay.
You're working the night shift, correct? And what are the hours of that shift?
At my hospital, the night shift works from 7 p.m. to 7 a.m.
Okay. So you would have signed onto duty at 7 p.m. on the 12th of October?
Slightly before, but yes.
Okay. And then would have ended your shift on the 13th?
Approximately, yes.
Is that fair?
Yes.
Now, let us know what the protocol is, if you would, in terms of turning over when you're getting ready to leave. Strike that. Let's go back and set the stage for this. Grace Schara was in the ICU at this time.
Yes.
You're treating her in the ICU.
Okay.
This is not a section of the hospital that says ICU, is it? I mean, it's not delineated by any signage or any special entry.
In my hospital, the second floor of the Fremont Tower where our ICU is, the whole unit is the ICU.
Okay.
So I don't know specifically where that's marked. I don't really pay attention to that, but that floor is the ICU in our hospital.
Right, but if someone such as Mr. Schara, who was not a part of the medical team and didn't have any medical background or training, showed up on the second tower in this area, there's nothing to designate to him that it's the ICU.
It's possible, I'm not certain.
Okay, all right, so getting back to what would happen at the end of your shift.
Okay.
You've got a nurse coming on to take care of the patients that you were taking care of in the prior shift, right?
Correct.
And what would be your standard protocol at patient to the oncoming shift?
So for continuity of care, we discuss things that are important for them to know. So we talk about a head-to-toe assessment of what abnormalities are able to be located on assessment. We talk about their course of care, so what's happened thus far in their stay in the hospital. We talk about medications that they're currently receiving. And then any abnormal things that happened on the shift.
Right, and correct me if I'm wrong, but is the 12th, would that have been the next time that you had cared for Grace following that discussion we just had about the 7th?
To the best of my recollection, it was a long time ago.
Right, but you've had an opportunity to review the medical records?
I have no other documentation with.
And therefore, right, it would be reasonable to assume, since there are no entries with your name on it for the 8th, 10th, or 11th, that you were off.
Correct.
Right. And you recall what happened to her on the 7th when you titrated the Precedex, right?
Yes.
And having that in mind as you're caring for her, would that have been something that you would have felt is important for her, correct?
Correct.
And also that you might want to lay to the oncoming shift?
I care much less about different levels that you've had in the past, and I care much more about what you look like right now. So I would talk about the level of medication you're receiving at the moment and the effect it's having on you right now.
Okay, that's reasonable. You know, it just occurred to me, before we leave that topic of the oversedation on the 7th, did you have occasion to see Mr. Schara?
To my recollection, I talked to him.
Okay. And do you know whether there's any indication that you relayed him that on the 7th, while you were caring for Grace, she had become oversedated?
I don't remember specifically conversations that I had with him. I know that generally when there's any interesting things that happen over the course of my shift, if there's family there, I'll update them on that information.
Okay. So who took over for you on the morning of the 13th of October in the ICU?
That would have been another nurse named Holly McInnes.
And when you turned over Grace's care to Holly McInnes, how would you have brought her up to speed based upon the events that transpired during the night, during your shift?
I would have told her about notable events, and I would have told her about a head-to-toe assessment and the medications that she was on at that time.
Do you think you would have informed her that strike that? Would you agree that Grace was probably the only Downs patient you cared for in the ICU during that period?
No.
Just during that period I'm talking about, that week?
In that week, probably, yes.
Right. So we can agree that Grace would have been a relatively unique patient in the ICU during that week.
I'm confused by the question. All patients have other comorbidities that affect their health. Down syndrome is unique in that it's a condition, but it versus other comorbidities aren't necessarily unique.
All right. You recall Grace?
I recall Grace, yes.
Certainly. And my question relates to, wouldn't it have been important for you to, in delivering a report to Nurse McGinnis, to inform her that this same patient, who was still on Precedex, had suffered an oversedation event on 10/7?
I wouldn't say it was an oversedation event. Precedex, by its nature, is a medication that you turn up or down as you need to. On the 7th, on the 7th to the 8th, when I turned it down, didn't have to titrate that medication anymore that day. The fact that I had a moment then that she had too much medication doesn't mean that it was an event that was having lasting effects on the patient, because after that time, she was on the appropriate amount of medication.
Give me 1 second, if you would. Sorry, I've got a little housekeeping to do here.
Whatever you're going to show to the witness, is that been marked as an exhibit?
Yes, sir.
Which exhibit?
Strange, I'm handing you what's been marked as Exhibit 7. Ask you to take a look at. There are 4 pages to a line here. If you look to the lower right quadrant at page 40. And it really begins, for completeness, I want to move back up to 39 so that we set the stage for the answer. But the question was asked on line 17. I think it's clear from your testimony, I just want to make it clear, you believe that this hypoxia and hypotension was related to Grace receiving too much Precedex. Is that correct? And the answer on page 40, beginning on line 1, says, at that point, I turned down the medication. And that was my belief at the time. Is that was that your testimony in May of 2024?
It was.
Okay. And so do you stand by that today, that you believe she was oversedated?
At that time, yes.
At that time. Thank you. So you don't have any recollection as you sit here today as to whether or not you would have relayed to Nurse McGinnis in the early morning hours of October 13th that this patient had been sedated, oversedated on Precedex 6 days prior.
Objection asked and answered.
I don't think it was answered, so overruled. Go ahead.
I don't remember specifically if I would have said that, but also as that medication was appropriate at the time, the fact that 6 days ago she had a small amount too much for a short period of time.
Ascension St. Elizabeth?
I am, yes.
Thank you. Nothing further.
Are you planning on asking questions now? Or?
Well, Your Honor, I had one clarification, just because I think by the rule of completeness, I think it would be appropriate to read a couple of lines from that page of the deposition that he just, otherwise I would reserve my right for further questioning, because I can't do my questioning in 15 minutes of this witness.
Yeah, you only have like 10.
So if I could, I'll reserve the right to call you, but I did want to clarify one thing. You have this document in front of you, page 40 of your deposition?
I do, yes.
And you recall being asked, the question put to you was, your answer was, at that moment she was over sedated, so I turned down the medication. That was my belief at the time.
Yes.
See that? Okay. When we go down to line number 10, your answer there, or follow-up answer, do you see that?
I do.
Okay, and that reads, at that moment, by its nature, Precedex is a medication that needs to be adjusted. That's why it's a titratable medication. Question, sure. Then you follow up with the following answer. So it's possible that you're oversedated partially at some time with it and then need to have more of it at others. Likely.
You did.
And that was an accurate statement.
Yes.
Anything regarding this adverse examination?
No, Your Honor.
Okay. Do any members of the jury have questions for this witness at this time? Right. There is one. So let me just tell you the process. Use a full sheet of paper in your notebook, and if you can write the question down, or questions if it's more than one sheet of paper, if you can write your juror number, which is 249, and then the bailiff will take it to attorney administrator first, and then to defense counsel, and then it'll be brought up to me. As that question takes some time, and first of all, there's 2 for 2 that you've heard deposition testimony. And typically in a case like this, you're going to hear it all trial. So that's what hopefully I got accomplished before. It's going to be common, and that's just the way it is. I think they've gone through with you the lunch plans for tomorrow, and so hopefully you have that worked out. But I think it'll be much similar to today, but we'll just have a full day of testimony. And I haven't gone through with the attorneys, but I think we'll probably have 2 and maybe a 3rd witness tomorrow. And then you can plan on Thursday sort of being the same type of day. Okay, or okay, and with your initials, and then pass it over to the other attorneys. And asked. But when I do this, about 98% of the time, the questions get asked. And I used to keep track of it, and I stopped maybe a couple of years ago. But every once in a while, it's just a question that isn't appropriate for some reason. And if I don't ask it, don't take offense to that. Don't read into it. I'll probably explain why, just like I would on any objection. But that shouldn't deter you. We're starting to mark as exhibit number 501. The questions from juror number 2749 and from exhibit number 502, questions from juror 244, the following. Do you review including notes with the incoming nurse?
Depending on time, generally we do to the best of our abilities, but if time can be short, sometimes you don't get the opportunity to thoroughly go through it right away with the other nurse. Sometimes you go through it time later.
Okay, and that would have been your practice back in October of 2021?
Correct.
And how many patients are you responsible for at any one time back in October of 2021?
So if you have an ICU specifically, because sometimes we'll be moved into other units, I can only have 2 patients at a time. Sometimes it'll be less than that based on how sick they are. If you're sick enough, sometimes it'll only be 1-to-1.
So if I understand it correctly, so back in October of 2021, you would have had 1 or 2 patients at a time?
Correct, 1 or 2.
And do you remember on your 2 shifts with Grace, whether it was 1 or 2?
I don't. I can be reasonably certain it would have been 2.
Okay. On both shifts?
Probably, yes.
Okay. Any additional questions from the jurors based on those questions and answers? There are none from the jury. I always allow counsel to follow up based on those questions and answers. So anything, Mr. Administrator?
No, sir.
Mr. Frankowiak?
No.
Mr. Guzzi?
No, Your Honor.
Any objection to 501 and 502 being received? All right, those exhibits are received. That's going to finish our time with you this morning, members of the jury. I'm just going to ask that you stay there so we can talk after they leave. I want to spend a minute talking about things. So I want to remind you of that rule that you're not allowed to read anything about this case or any issues associated with the case. You're not allowed to listen to TV or radio associated with this case. You're not allowed to have communication, written or verbal, with anyone, including each other, including your family members, about anything regarding this case, other than the fact that you are on the jury and, you know, it went the full day today and tomorrow you need to be here at 8:15, and you can also say it's a civil case. That's the rule that you took. Just a reminder that if you happen to read something, you know, or see something tonight, the rule is stop. Don't read further once you realize it has anything to do with this case, and then you report it right away to the bailiff when you show up tomorrow morning. There's also no contact with anybody involved in this case at all. You have your notebooks for the first time, so when you go back to the jury room, that room will be locked, and you know, that's your room only. And we'll see you tomorrow morning at 8:15. Thanks for your attention today, and we'll have another full day tomorrow. The jurors are excused. All right, this being outside the presence of the jury, you can be seated. Just before we excuse this witness, I didn't want to tell him to come back tomorrow morning, or he's excused now. The plaintiff is done with him, and the defense will bring him back whenever they want to bring him back, if you do. Is that the right approach?
Yes, I believe we'll probably call him back sometime next week in the defense case in chief now. Since we weren't able to get him in today, that's fine.
Okay, and you're good, he's excused for the rest of your case?
Yes, sir.
Okay, thanks for your time today. You're free to go.
Thank you.
We have a couple you can just keep that exhibit there. The clerk will come and get it. The witness was just holding up exhibit number 7. Any objection to receiving exhibit 7?
No objection.
All right. One of the jurors' questions, on the back side, it had Nurse Teens. I thought it was the juror's name on it, so I'm not concerned with. I was going to ask if it would be okay if I whited out the juror's name, but that's a non-issue. I don't know, counsel, if you want to come on up and approach. I received a note from the jury when they came back from that last break, and I'll just have you look at it. And I'll explain it out loud as you're looking at it, and then we kind of talk what we'll do. First of all, I marked this as exhibit. So the bottom part is what I first received. I didn't know which juror it came from, so you probably saw me hand it to the clerk, and the clerk went over to the bailiff, and the bailiff had the juror write on the blue note that's on there, the jury number. At that one break, I think you guys were talking about something, but I explained, you know, what a deposition is and how it works. And that's the reason I did that. I thought I'd want to show that to you. One thing I'd like to do is just take off the blue note, since that's a note from the clerk to the bailiff, and just put juror number, if I could write on the bottom of the note 587, which is their jury number. And then it's, okay, and it's marked as Exhibit 500. And I don't know if we need to receive it, but I just thought it was fair to give, if I get a note like that throughout the trial, I probably will let everybody always see it, so you see what I see. And you can use it to whatever degree you think is beneficial. So any objection to receiving 500?
No objection.
Okay.
Your Honor, if I might request if we could maybe at the beginning of the day, either tomorrow or something, remind people what we're doing with that. I'm a little concerned that this is a typical.
Yeah, and you guys can go back and let's just talk about it. But yeah, and I didn't want to call anybody out, but there is some that I think can be read in by certain sides of whatever's going on. And I think you're referring to the badgering that was referenced on there.
Yes, I guess I'm a little concerned based on the nature of that question that maybe they don't fully understand what's being done here. This is a very typical procedure, and obviously the goal is to get the truthful testimony out before them, whereas if they are in their minds perhaps penalizing the attorney, utilizing that as a cross-examination tool, that might not be appropriate. I don't know if there's a good way to do that. We have to remind them every day, something to disabuse them of the notion that we're attempting to badger the witness simply by holding them to their deposition testimony.
Remember when I addressed it with the jury, I tried to say, I didn't want the rest of the jurors to hear me read it and saying badgering, because they're not talking about it, and if we can just keep it to the one. But then I gave the history of how depots are and that everybody uses depots, and I tried to give them the real life perspective, and I said to them, I would think this is going to happen throughout the trial. And then when Mr. Administrator did it, I think I said to them, see, we have 2 for 2, and you're probably going to see it the whole trial. So I tried to make it just that this is going to be common. So do you want me to do that again, or do you want me just, when you guys use it on the third witness, you just want me to, I mean,
if it doesn't come up again, I guess we can assume that we've answered their questions to that point. I'm not sure if it would sink in if we did it more than once, or if it hasn't sunk in already, but I don't have an objection given your admonishment or your explanation today, if that's the extent of it.
Anything?
No, I think it's an as it comes up rather than highlight.
Okay, and I don't know who wants to talk on behalf of the plaintiff, Mr. Administrator.
Thank you, Judge. I would resist any attempt to give them a super admonition relative to the use of depositions. I think the court cleared that up perfectly for them, and we don't need to highlight it, frankly.
You said perfectly. I'm going to remind you that in probably the next decision where I go against it.
I'm sure there'll be.
Okay,
more.
so, and that'll be my practice. I imagine we're going to be getting notes like that. I didn't, you know, one side of me, if I'm going to the bathroom or I need a bathroom break, I would probably let you guys know that's what it said and then throw it away. And that one, I thought I'd communicate to everybody what was actually written so you'd understand why I did what I did when I did it. I didn't do it right away. I waited till the opportune time. And then I thought, well, I was sitting here for the last half hour going, well, should I even show it to you guys? And I thought, no, that's something if I was a lawyer, I'd want to know so you can frame what you want to do. And that'll be my practice. So Exhibit 500 is received. I just want to make sure Exhibit 418, which was Ms. Schara's deposition, has that been offered and received? Okay, so I think we're up to date on motions for mistrial that the defense wants to. We only had 2 today, so.
No, nothing further.
That kind of hurts a little bit, Judge, but no.
But there's only 2?
But, I mean, we're kind of under that, you know, plus or minus 5.
Okay, so what's the plan for tomorrow?
First witness is going to be Scott Schara. I imagine it's going to take quite a bit of time given the scope of the cross-examination. So I would imagine that we're looking at least the entire morning into the afternoon.
Okay. And your second witness then?
The second witness is Nurse McGinnis.
Do you have time for a third? Who's that going to be?
Who got you next one?
Your Honor, I think the witness after this is John Flighter for record. The next witness was Dr. Shokar, who is coming on Thursday, was the next witness on our list. Thursday morning, followed by Dr. Gilbert Burdine.
Okay.
Who's coming in Thursday after.
Okay. So the idea would be we'd have two witnesses tomorrow, Mr. Schara and Nurse McGinnis. Okay. One thought that I've had, and I don't know if I'm going to give you guys a choice on this, other than I'm just going to see how tomorrow goes. But as the jurors asked the questions yesterday, as we got near the end of voir dire, they started questioning like, "Is it every day?" And I don't know if you had the tone of that question. The juror in the front row, who was like in seat 8 or 9, and started talking about like, when are we going to be done? And she had some issue. So. And then the questions that I got from the bailiff during the lunch hour, like, what's the schedule tomorrow? And I thought to myself, well, I thought I already told them the schedule. But, you know, one thought I have is, what about like an either early release or a half day on Friday or on Fridays? I don't want anybody to comment. I just want you to think that I'm starting to think about it, because as I saw them today, I'm thinking these are long days for them. They have everything else going on in their life. I don't know how that would impact it. I have not brought it up to the jurors. I started thinking about it past the bailiff today at lunch, just the ones that are in contact with them. And I told them, don't bring it up, just get a sense, and I'm going to probably come back tomorrow to the bailiffs and see what they think about that idea. My normal process as a judge is I just kind of steamroll through. I like to work and I like to get stuff done. And so it's against my normal approach. But then as you start watching, you go, these are long days for these normal people. So my normal approach of plowing through might not be the best thing for them. So I thought I'd kind of just share that with you. You guys, I'm not trying to favor one side or the next. I'm just trying to throw out an idea. And you know, if the jurors didn't want to do that, if they want to work all day, then I'd say we're working all day. I will bring this up just so everybody knows. My son made the state tennis tournament next weekend, but I don't think that's justification to stop on Thursday or Friday. I heard you say give birth. I think giving birth is a little bit different than a high school tournament, right? So I'm not planning on that on Thursday or Friday next week. I only bring it up now because I don't want you to think it's self-serving. And I didn't really start thinking about it until I started watching the jurors today, and I'm getting feedback from the bailiff. And I'm not thinking Thursday and Friday. I'm just thinking, like, if on Thursday morning we say, hey, tomorrow's a half a day, they might be more.
Yeah, I think that it's a great idea to try and give them a heads up. Unfortunately, they're already gone, so we can't talk to them about tomorrow, but I might suggest that if they were told upon arrival tomorrow that this is likely to be a day that ends before 4. I don't know how that's going to play out relative to the, obviously cannot gauge the amount of cross that we're going to have on Mr. Sheriff, but
I hate to tell them that and then have them sit here in the afternoon and get upset with one of you.
Right.
that's true.
But I was talking more on Friday, and I want you guys just to think about it the way I've been thinking about it. I don't think you have to tell me right now what your feelings are. I just wanted to give you a heads up that I'm thinking about it. Yes, Mr. Guzzi.
I just think the way the witnesses are set up right now, I think it accommodates that type of schedule, because it's only Jessica on Friday, right?
Right. Yeah, right now Jessica's the only witness on Friday. It may organically be only a half day if there's no other witness ready to go that day.
Because you have the 2 doctors on Thursday, is that what you're saying?
Right, that's Thursday's probably going to be a pretty
Well,
full day.
after Jessica, then why wouldn't we have another witness?
The only one left from plaintiff's case after Jessica would be Nurse Eichinger, but she's not scheduled till the next Monday, the 9th.
Your Honor, there may be some overflow from Dr. Burdine Thursday into Friday. I
Okay.
Especially depending on how long Dr. Shokar goes in the morning. I think having just one witness right now on Friday, technically scheduled, is probably a good idea, given Dr. Verdine closing out Thursday right now.
Okay. The other thing that made me think about it was, I think yesterday in one of our sidebars, there was a conversation of this might be done earlier than the end of the third week, like as close, in those first few days of the third week. And if that's the case, I was thinking to myself, well, if I'm on the jury, maybe I'd rather have a 2.5-day week. If you're on the jury, you can go into work tomorrow afternoon, or Friday afternoon, and get stuff done and have an extra weekend. You're coming into that third week anyway, and either way, we're not going to force them into a fourth week.
Right.
So, I'm gonna have you guys think about it. Just be ready to give me an answer on what you think. I'm not gonna try to favor one side or the next. If we think it's a good idea and we have the bailiff throw it at them and they say no, then the answer is gonna be no. So we just keep going through it forward. Gap in your witnesses on Friday afternoon, because my expectation was somebody's gonna be here Friday afternoon to testify. I thought that was our plan.
No, Your Honor, honestly, we did think that Shokar and Burdine would run over into Friday, so we thought we had and if they end on Thursday, then we'll know we'll have a little bit of a shorter day on Friday.
Okay, so maybe it kind of fits naturally with the plan for this week, that we just plan on doing those 5 witnesses before the week's over. 2 tomorrow, and then those other 3, and whenever that wraps up, we're done. And then when we start next week, Monday, same plan where we're at for it.
Next Friday will be 2 of our experts, but I think, well, I can't speak for the one, but the one will be Dr. Beach, and I think she will be an hour and a half tops.
That's next Friday?
That's next Friday, so then I think the other expert is the nurse expert for the hospital. Not a half day, certainly. Early out.
Yeah, it might not only be a half day, but we might be done before 4 on that day, depending how quickly cross goes on those 2 experts.
And are both of them coming from out of town?
I believe so, yes. They're both flying in. Certainly Davis is flying in, the nurse.
Yes, Dr. Beach is coming from there.
All right, well, anything else on schedule or anything else? So do we have the exhibits already handed to the clerk and agreed upon? Should we do that now?
I believe so, Your Honor. In the morning, we have just some pictures and a few videos. I may not even show them all, but I want to at least take some clips from the videos that I've provided to the defense, just to get Grace live before the jury.
Okay, and are those objected to?
I haven't seen the videos yet, but other than one, I don't anticipate an objection, but I will let counsel know tonight.
I appreciate that.
Okay, and I'd like you to let me, if you can use that same email string. I don't need to know unless there's an objection.
Sure.
And if there's an objection, let's plan on meeting at 7:45. Okay. What time will you have that objection noted by? 10 o'clock?
What time?
10?
10, absolutely.
I go to bed typically by 10. I'm getting old.
Stay up and watch the late show. Yeah, definitely by 10, and that's only if there will be a.
Okay, and if there's not an objection, 8 o'clock? We'll
Sure.
Start up and we'll have the jury in at 8:15, and if they get here early like they did today, we can get them going. That good with everybody? Okay, anything else today?
That's it for us.
Nothing. Everyone for your work.
Thank
So this wraps up day 1. Again, this is a replay of the first day, as I started my channel on the second day of the trial. And so if you're just joining for the trial, you can see the rest of the trial on my channel. It's already completed, and I will be doing a wrap-up video shortly. I hope you guys have a wonderful evening, and thanks for joining.